All right, Ms. Brown, you ready? Okay, let me know. All right, thumbs up. Let me do one more thing here. All right, good morning, everyone. We're back on the record in Daniels versus MARTA. It is a little after 9 on Tuesday, the 20th. Deputy Gordon tells me that all 13 of our jurors are here. I'm happy to report that Ms. Clay and her special passenger got here at like 7:45. So Ms. Begg may want to rethink this whole carpooling thing. Who knows what time she got picked up, but they encountered no troubles getting down here. Mr. Johnson, anything from your side before we bring the jurors in? The plan is still to call Ms. Lundy, then 3 depositions, and then your client.
Yes.
Got it. Ms. Arnold, anything from the defense before we bring the jurors in? Okay, and everyone received the draft jury charge electronically this morning. We'll go over that this afternoon if we end reasonably before 5, or we can go over it tomorrow morning and maybe have the jurors show up a little bit late because we won't, I don't like saying be gone for an hour and a half while we do the jury charge and something else, and then they come back for closing. So we'll figure that out. Let's bring the jurors in.
All right, good.
Thank you, Deputy Gordon. You're welcome to be seated. Good morning, ladies and gentlemen. It's great to see your smiling or masked faces. I'm happy to report that our carpool experiment seemed to work. Ms. Clay got her passenger down here at like 6 in the morning, whenever you guys arrived. I'm not normally here that early, but my youngest son has decided he wants to do a morning school activity. So he had to get to school at 7 this morning, which got me here super early. So I was here when you guys got here. It's not fun waking up that time. And Mr. Garfinkel, you're still here. Great. Mr. Goss, any issues this morning? Okay. I meant in terms of getting here because everyone else was here and you just squeaked in, but it was all good.
Yeah, my car's in the shop, so I gotta get MARTA, work around MARTA.
Okay. Well, you did great. I'm sorry that that's going to keep happening. What's the prognosis on the car?
It was just my bumper, my fender got bent, and so it's still Friday.
MARTA bus hit your car?
No, failure to maintain the lane. I was rushing through an Uber Transit and end up hitting the lady on the side.
Oh, you did it? Okay. Well, there you go. All right. We are still in the midst of the plaintiff's case. So Mr. Johnson is going to call his next witness in a moment, I think, but this is plaintiff's decision. But the forecast is that we'll have a live witness and then we'll have a few more of those depositions where we'll hear from medical professionals, but on a screen. I reserve the right to pause those from time to time if it looks like you all are fading, just because it's a little less interactive. But we do have a few more medical professionals from whom we will hear in that format. But I think we're starting with a live witness. Is that correct, Mr. Johnson?
It is.
Great. Call your next witness.
Thank you, Judge. We call Marilyn Lundy.
Would it help you, Ms. Brown? We're trying to make this happen. That screen right there, if it showed what the rest of us are seeing, which is the witness, does that help you? Or because you are doing the takedown the way you do, it's not a seeing thing, it's a hearing thing?
It's a hearing.
Okay.
That would be awesome.
Okay.
If you can't, don't worry about it. I'll just.
Okay. I think if I can log in there. I thought it was connected to all these other machines, but our tech people say it's not. But I think I can log in there, and that way, when we take a break, I'll do that. Sure. Just don't hack my email account.
How's that?
Oh, good. Morning, Ms. Lundy. Make your way safely and slowly right on up to this witness stand, please.
State your name for the record. But you can take that all the way off. The rules allow that. Yeah.
Marilyn Lundy.
Ms. Lundy, good morning. Thank you for being here. And thanks for removing your mask. I hope you're comfortable with that. When you're answering the questions, and there'll be some from Mr. Johnson and then probably a lawyer for MARTA, the closer you can get to the microphone, the better, so everyone can hear you. That chair, unfortunately, doesn't have wheels, so you really have to heave it, but you projected pretty well, so you may be fine. But if Mr. Johnson is asking you to speak up a little bit, you can either speak up more or get closer to the mic. Either one will work for you.
Yes,
Okay, thank you so much.
We ready?
If you are.
I am. Thank you. Would you tell us again who you are?
I'm Marilyn Lundy.
And Ms. Lundy, how is it that you happen to know Jame's name?
I'm her mother.
Are you working these days?
No,
Where do you live?
I live in Atlanta.
Well, are you retired or have you just never been in the workforce?
I'm retired.
What did you used to do for a living?
I was a payroll specialist.
Who did you work for?
Paychecks.
Ms. Lundy, I want to ask you first how you came to learn that your daughter had been involved in a collision with MARTA. How'd you find out?
I received a phone call from the hospital. I believe it was an emergency worker. And
What were you told?
I was told that there had been an accident and I needed to come to the hospital
And is that what you did?
immediately.
Can you tell the jury what Ms. Daniels' condition was in when you first saw her, when you first got to Brady and you were able to see her? What was that like?
She was lying there on the bed and in a lot of pain, crying, and there was a lot of activity going on. She was, is that what you mean? Just, they were working on, there was a lot of activity going on.
Were you able to take a few pictures while you were visiting her at Emory? Let's strike that at Brady. Did you take some photographs?
After the emergency, not in the emergency room, but when she was in the hospital, yes.
Later you did?
Yes, I did.
Okay, we'll talk about those. Was Ms. Daniels able to communicate with you at all when you first saw her at Brady?
She was crying and she was saying, "Mom, Mom." She recognized that I was there. She was crying because when I showed up.
How long did you stay that first day?
All night.
Ms. Daniels was in Brady for 2 weeks. Did you see her more than those first 2 days?
Yes.
Tell the jury how often you saw her during that 2 week period.
I believe I stayed about 3 nights in a row. And they took her to surgery, so I was in the waiting room. And then when they took her to ICU, I stayed in ICU all night. And then
Let me ask that we put up exhibit P25.
So 2 things. One, it's not in evidence yet, so we shouldn't put it up. But 2, it may well be that both sides have agreed that these are stipulated to in terms of foundation, et cetera. But I just want to make sure, because if you put something up, unless your technician has mastered it, it won't appear just on the screen in front of Ms. Lundy. It will be everywhere. Then we might have an objection because it's not in. So I just want to make sure as we're getting into visual exhibits, we do it smoothly.
Sure. These are photographs that we discussed with the court prior to trial.
Understood.
But nevertheless, now that I understand how your technology is working, I think it's a good idea. I'll proceed and we'll discuss when it's time to put it up on the screen.
Okay. Again, to publish it, which is what would be putting up on the screen, it needs to be in evidence first. So if you want to seek to admit it at some point, you're free to do that. If you've got, before you approach the witness, if you've got a series of exhibits that you'll be admitting through Ms. Lundy, my request would be you put them all in front of her at once so you don't have to trek back and forth.
Thank you. Ms. Lundy, can you take a look at the photograph marked P25? Do you have it in your hand?
yes,
Ms. Lundy, did you take that photograph?
yes.
What does it show?
It shows her lying in bed.
Does the photograph accurately depict the way she appeared to you at the time you took that photograph?
Yes.
Judge, I tender P25.
I'm not sure who's handling this witness. Ms.
No-
Page.
No objections, Your Honor.
Okay. P25 is admitted.
May we put it up on the screen, please? So do you remember at what point during her Brady stay this was? Can you look at it and tell, was this first day or later on?
Are you asking me, is this the first day that I saw her?
I guess I'm asking you if you know when during that 2-week stay you would have taken that photograph.
This is when she's in ICU.
Okay.
The first day is when she was down in the emergency room when I saw her.
And then the second day she was in ICU?
Yes,
Could she move at all at the time you took that photograph?
no,
Could she move her hands or her arms at all?
she wasn't moving anything at this time when I took this picture.
How was she able, were you there when people took care of her? Did you observe how they gave her food or how she used the bathroom, anything like that?
I didn't see that part. On this picture, she's just lying there. I'm not sure what day. I think it was the second day. I'm not sure the day some therapists came in and sat her up. She wasn't doing anything on her own.
Was she able to talk to you when she was in that condition?
They had her really drugged up, and every now and then she would say "mom," or like she was calling my name. And so I went out for sleep one time to lay in the lobby, and she woke up, and they ran in there and said, "Your daughter woke up and come in the room. She wanted you in there." So I came back in and I sat in the room with her.
Was she able to communicate with you when you sat there, or were you just sitting in silence?
So she was just in and out because they were managing the drugs. They were explaining to me that they were trying to manage it within so many hours. They would give her the strong drug. They didn't want to get her like hooked. So they were telling me that we give her one drug and then they would alternating certain drugs. So she would be asleep, like that. So I was just sitting.
Can you take a look at exhibit P17 that's for you? Are you looking at P17?
Yes,
Did you also take that photograph?
yes.
And can you tell us what it is a picture of?
It's a picture of when she first got out of surgery.
At Grady Hospital?
Yes,
And does that photograph accurately fit the scene as you remember it when you were there?
yes.
Judge, I tend to P17.
No objections.
P17 is admitted.
We can put that on the screen, please. So this was after the initial surgery to her legs and her hands.
I'm going to pause you for 1 second. Ms. Lundy, if you would press the button that says "got it" on the screen, that'll make that go away. There you go. And stay muted, that button. That way you can see, you're welcome to look at the hard copy, but it's also on the screen,
Okay.
more unobstructed for you.
Thank you.
Sure.
This was after the initial surgeries to her legs and her leg and arms.
This was that, yes.
How soon after that surgery were you able to get in the seat?
After recovery, they keep you in recovery and then they bring you up to ICU. And I believe these foams were on her arms then. So the 25 May, I don't want to speak and guess, but these foams were on her arms when she came out of recovery because it was supporting her arms.
Was she able to communicate with you after that surgery at this time, or was she still pretty much unable to do?
All of these pictures were around the same time because she was just doped up. And she would just say "mom," kind of mumbling, because she was in a lot of pain.
Was she able to be more communicative over time during that 2-week stretch at Emory?
Yes, as she progressed, she was being able to talk a little bit more.
And as you were there, were you there to be able to help her in any way if she needed something?
Doing that too, yes, I fed her. I did some things like that. She couldn't do it because her hands, she wasn't able to use her hands or do things. So I helped in between the nurses, bring things, bedpan. I would fix food. She hated the food, so I would fix stuff and feed her, bring from home. And I've got pictures of that too. I would feed her. Couldn't do anything.
After the 2 weeks at Grady, Ms. Daniels was transferred to another hospital. Is that right? And that was Emory DeKalb.
Yes,
Were you able to visit your daughter at Emory DeKalb?
no,
And why is that?
COVID. They had started making us, weaning us down there was a lot of family was trying to come in, but COVID started. So it was like 2 people, then 1 person. And so then they transferred to DeKalb. I couldn't see her at all.
When was the next time you did get to see?
When she came to my home,
Did she go directly to live with you after she left Emory DeKalb Hospital?
yes,
Emory DeKalb Hospital?
yes,
This is the period, and how long did she stay with you?
until, don't quote me on dates, but it was until she went to Texas.
Couple of months?
Yes,
This is a period of time I want you to help the jury understand for Ms. Daniels, okay?
all right.
What condition was she in when she first got to your house?
I don't want to be too talkative because this is really emotional for me. She couldn't do anything. Had to do everything for her. She had a huge cast on her leg, arms were bandaged. So she was in a lot of pain. And I had to bathe her. She had learned how to, she had a little therapy. They had given her a weighted spoon or fork to try to put food in her mouth, but I would put a towel here because everything would fall off. So she's very determined. That's how my baby is. I'm sorry, my daughter is. So I would give her food and try to help her. No, Mom, I can do it. And she would try to eat, but I had to bathe, all personal things, ladies, everything. And I'm disabled, so the cast was so heavy, trying to move the cast, and she couldn't turn because the arms, there's no use on the arms, so we had to try to move her. It was just a lot. She couldn't do anything.
And, I'm sorry to ask you some of these details that nobody ever wants to talk about in life. But when she had to go to the bathroom, was that also your responsibility?
Yes.
Was that easy for Ms. Daniels?
She was embarrassed, and sometime with the Medicaid, do I have to go into detail with that?
Just a little bit, and then we'll
Okay.
move on.
I had to do the bedpan for her.
Was she able, when she first got home, was she able to sit up?
I will put the bed up. We had the hospital bed brought in.
Now, while she was staying with you, were her children able to come help and visit her?
No, COVID is, and I have underlying conditions. And so my doctors were not going for it. So we didn't have people come in. So they had to be separated too. It's just me.
So you were the only family that took care of her during this time period?
And my husband helped with the lifting. He couldn't do the other stuff. So he would, if I had to pull her up, he would come in and help me pull her up. So it's my husband and I. And a friend came by every now and then to help with that when she had, to take her to.
While she was staying with you during this part of her life, did she begin some therapy to learn how to get out of bed, for example, get into a wheelchair? Was that something that eventually she worked up to?
I think she started going to a therapy outside of the home. I forget where that was going to. I think it was.
Was there a time at your house when she sort of learned with some assistance to move into a wheelchair?
I think we did later on down the road toward, yes, she did. She was trying to do that.
And after she had stayed with you for a while, she moved to Texas, is that correct?
Correct.
Can you explain to the jury why she left your house after this period of time and moved to Texas?
As I stated, I'm disabled and I couldn't care for her. And COVID came started, that's when COVID started in 20. And we have a huge extended family in Texas. And so they were gonna come to help when this accident first started, but COVID started and they couldn't come. So they decided that we would move her there, because I have like 6 sisters and they can help care for her. And that was the decision made for them to go there, because I couldn't help with the kids. They couldn't come in the house. So that decision was made.
So after she moved to Texas, did you have any face-to-face contact with her while she was living in Texas?
We FaceTime all the time,
Oh, you FaceTime on the, what, on the iPhone or the computer?
constantly. That's where we contact all the time.
At the time she left her house to go to Texas, was she able to walk?
No.
Now, Ms. Daniels is now returned from Texas, and this past June, had an ankle surgery. Where is she living now?
With me,
So she's back with you, and why is that?
we to help care for her.
When did she move back with you?
A little prior before her surgery.
And has she been at your house since the surgery?
Yes, sir.
And have you been the one taking care of her?
Yes, sir.
Can you tell the jury that story? Can you pick us up where she's now back at your house, she's fixing to have ankle fusion surgery? And just tell the jury what her life has been like since that surgery in late June until now, as you've observed.
Prior to the surgery, we were preparing because we knew she was going to be down. We prepared for her because we knew she was going to be down again. So we made sure that everything was in order, and got a bed ready. She wasn't going to be able to walk. The doctors let us know what was going to happen. And you want me just to tell from the surgery?
Yes, ma'am.
She had the surgery and she experienced a lot of pain and swelling. We had the cast situation going on again. So she's not walking again. She's having the therapy, whatnot now with the boot. Anything she does now, there's pain, swelling, anything she does, I'm the mother, so I'm constantly like, put the foot up, because anything she does, we get this fat foot in the pain. So it's, call it a Fred Flintstone foot. It's just swells up.
You can't say your daughter has a fat foot.
I'm just saying, because it puffs up. I'm sorry. That's why I tease her, because it swells. She has a lot of swelling and pain with it.
Last little piece of history I want to go over with you is Ms. Daniels' life before this bus crash, okay?
Yes.
Not talking about when she was a little girl, but in the year or so before this awful thing happened. Can you just describe your daughter for the jury as though they never met her, you were trying to explain who she was?
Very outgoing, loving life. I call her like diva. She's my fashionista. She outgoing, I think. Hard worker. She got that from us. I think we all have a good work ethic, and I was really proud of her. She loved her job. Faithful. I might be prejudiced because she's mine, but family oriented. I could go on here and we don't have all week.
We do not have all week. That's correct.
So I mean,
how has your daughter spent most of her days since coming back and living with you at once?
we spend time talking. We do devotionals. As a mom, I try to keep her encouraged, being positive, reading. We listen to music. She has a lot of downtimes because this incident is really changed her life a lot. And a lot of times she says some things like, Mom, look at this. And I go, honey, we thank God you're still here. She's like, look at my leg. I'm like, you know what, babe? You have a leg.
Sunday, I want to thank you very much. And I have no further questions.
Ms. Page, do you have any questions for Ms. Lundy?
Yes, Your Honor.
All right.
Good morning, Ms. Lundy.
Good morning.
How are you today?
I'm good, thank you.
Welcome. Jamice is your only daughter, correct?
Correct.
And you also have a son named James.
Yes.
And you have a very close relationship with your daughter.
Yes.
And you affectionately refer to her as your pudding, right?
Correct.
And you told me in your deposition that you describe her as a mama bear.
Yes.
And you even jokingly said sometimes you think she's your mother.
Yes.
And she's also the mama bear for her friends. Is that a yes?
Yes.
And her children's friends.
Yes.
And she looks out for them and tries to help them. And you describe many of them as your bonus grandchildren.
Yes.
And Jamice, you talked about this a little bit on your direct, but Jamice received her initial treatment at Grady Hospital, right?
Yes.
And once she was discharged from Grady, she went to Emory DeKalb for rehab.
Yes.
And when she was discharged from Emory sometime in April of 2020, she came to stay with you.
Yes.
And she stayed with you until June of 2020 when she left to go to San Antonio, Texas.
Yes.
And she moved back to Atlanta January of 2021, correct?
Yes.
Okay. And when she moved back to Atlanta in January of 2021, she moved to her own apartment with her children.
Yes.
Okay. And she just recently moved back with you in May of this year. Is that correct?
It's toward the end, closer to June. Yes.
Okay. So because you didn't live with her from June of 2020 until May of this year, you're probably not the best person to speak to her ability to do things around the house on a daily basis before she came back to live with you, right?
We FaceTime. She was with her dad and my family, so we speak daily.
Okay.
And my family is very close. I have 6 sisters, and my ex was the pastor of my dad's church, so we're FaceTiming every day. And so I'm finding out they're constantly talking to me about what she's doing and what she can't do. Even his wife, we're fussing about what she can't do. So I'm aware.
Okay. But when she moved back to Atlanta in January of 2021, were you with her every day?
No, but we FaceTime.
Okay. And before the fusion surgery in June, she was starting to do a little better, correct?
Before? Yeah, she was doing a little better.
Okay. And she was able to bathe herself.
Yes, I gave her one of my seats. So she would be in the shower where she could sit.
Okay.
Because her balance and everything.
And she was able to walk without assistance.
Yeah, she had a really bad hobble. So.
Okay. And currently, Jamice is in recovery from her ankle fusion surgery.
Yes.
And your understanding is that the fusion surgery is supposed to alleviate some of the pain she experienced from built up arthritis, correct?
Say that again.
Your understanding is that this fusion surgery is supposed to alleviate some of the pain that built up from some of the arthritis in her ankle, correct?
From what she's telling me, because I'm not a medical person, I just know that they told me that it was going to fuse it so that she could move it.
Okay.
That's my understanding.
Okay. And you describe Jamice as a go-getter.
Yes.
And she has a can-do attitude.
Yes.
And one thing you told me in your deposition is that sometimes you feel like her spirit is willing, but her body isn't cooperating. Is that correct?
Yes.
But these surgeries are intended to help with some of that body cooperation, right?
They're intended to.
Okay. And faith is very important to Jamice.
Yes,
and she's really big on family.
yes,
And before the accident, she used to plan parties and get-togethers for your family and friends.
yes, we did them together.
And one of Jamice's top priorities is her children.
Yes,
And she wants to make sure they're okay
yes,
and be present for them.
yes,
So when Jamari was accepted into college at Aurora College in Illinois, it was important for her to go help see him off in August of 2021, right?
yes, she had to because I couldn't do anything. So everything was on her.
Okay. And she traveled to Illinois to help him with that moving process.
Yes,
And Jamari was a member of the football team,
yes.
and she went to a couple of his games.
She had to support him because I couldn't go.
Okay. And she took her daughter, Imani, to Vegas last November to celebrate her 21st birthday, correct?
Yes,
And still to this day, because family is still important to her, she goes out to eat with her son.
say that again.
I said, because family is important to her, one of the things she'll do is she'll go out to eat with her son, correct?
Yes, they try, all the children. We try to keep her doing things.
Okay. And recently you all went out to celebrate her birthday last month.
I'm trying to figure out what did we do for her birthday. I don't remember all of us going out
Okay.
birthday. I can't remember. There's so much going on, so I can't remember everything. I don't remember that.
Okay, but you did say that you all will try to, as a family, still get her to be active and get out the house, correct?
We try to keep her moving because she's sitting there in a room. So as a family, we want to keep her motivated and moving instead of sitting in a room. So yes, we try to keep her active mentally, emotionally.
Thank you. No further questions.
Mr. Johnson, any other questions for Ms. Lundy?
No, Your Honor.
Okay. Any questions from the jurors? Yep. Deputy Gordon, if you'd resume your responsibilities, please. Sorry, I was tying my shoe. Don't write on the back. All right, counsel. Ms. Lundy, a few more questions.
Yes.
Do you know if your daughter considered or doctors considered for her any rehabilitation work at the Shepherd Center, if you know what the Shepherd Center is?
I don't know what that is.
Okay, that answers the question. Do you know where your daughter was living before the ankle fusion surgery? You helped a lot with the timeline of where she was at different times. So just before the ankle fusion surgery, where was home for your daughter?
She had her own apartment. It was,
It doesn't matter where it is so much, but she was living on her own.
yes,
Did either of her children, son or daughter, live with her?
yes,
Both?
yes.
Okay. All right. Do you have any follow-up questions based on that, Mr.
I
Johnson?
don't, Your Honor, thank you.
All right. Any follow-up questions, Ms. Page?
No, Your Honor.
All right, Ms. Lundy, thank you so much for being here. Appreciate it. You can leave those exhibits right there and just carefully get yourself off that witness stand. All right, Mr. Johnson, your next witness is
Dr. Moore.
Dr. Moore. And this will be a deposition, this will be a video presentation of questioning that you and counsel for MARTA already performed.
That's correct, Judge.
Okay. Whenever you're ready.
Moore Jr. I'm an orthopedic surgeon at Emory, and I work at Grady Hospital, which is a level 1 trauma center in Atlanta.
Dr. Moore, I represent Jame Daniels, as I think you know, in this case, stemming from a head-on crash with a MARTA bus back on March 2nd of 2020. And I'm here to ask you some questions today about your care and treatment of Ms. Daniels following that collision. Would you please tell the jury what you were doing for a living back in March of 2020 when you first began treating Ms. Daniels?
My job is a orthopedic trauma surgeon, so we take care of high energy trauma that comes into our level 1 trauma center. I'm also a assistant professor of orthopedic surgery, and I teach residents and fellows and medical students. There are multiple orthopedic trauma surgeons who care for these injured patients that come in through our hospital.
And can you just tell us a little bit about your medical educational background?
Sure. So I did my orthopedic residency at Emory, and then did a specific 1-year fellowship on orthopedic trauma, so high energy trauma, peri-articular or trauma of the joints, and then complex fractures of the pelvis and acetabulum. So after that 1 year of fellowship, I came back on as faculty at Emory, where I did my residency.
And doctor, you're board certified in orthopedic surgery, is that right?
Yes.
And you're properly licensed to practice medicine in Georgia, and your license is on file with the proper authorities.
Yes.
As part of your practice back in March of 2020, did you have an occasion to treat Jame Daniels?
Yes.
When did you first see Ms. Daniels?
I first saw her the morning of surgery, her initial surgery, I think on March 3rd, in evaluation of her injury, and then myself and other physicians managed her injuries in the operating room on that first day after the accident.
And what was her physical condition at the time you first saw her on the day of surgery?
She had 3 extremity injuries, one to her knee, her right knee, and then 2 injuries to her upper extremities, her forearm and her wrist.
And how about her right foot?
I'd have to look back at my notes, and I know that I have them here. Yes, she also had a calcaneus fracture on her right ankle or foot, yes.
I'm going to ask, Doctor, I'm going to ask the court reporter to share the screen with us with a medical illustration I'd like to ask you about. And we'll mark that as Exhibit 1. Dr. Moore, can you see the medical illustration on the screen?
Yes.
Does this illustration accurately depict the injuries that Ms. Daniels had on March 3rd, 2020, and the subsequent medical hardware that was used to repair those injuries?
Yes. It shows the injuries and also the pictures of the implants that are used to stabilize the fractures.
Now, as I understand it, on March 3rd of 2020, your surgical involvement involved her lower extremity, meaning legs and ankles. Is that correct?
Yes, that's correct.
I'm asking you whether you performed the surgery on her upper extremity, her arms, or did your surgery on March 3rd focus on her legs and ankle?
Right. So my surgery was her leg, her knee and her ankle, although it was the same anesthetic event. So it was the same surgery where the hand surgeons managed the upper extremity fractures. But no, I did not perform the fixation or implant placement on the upper extremities.
Okay. And as far as based on what you saw in the surgery and your notes, what had caused Ms. Daniels to be before you that day?
So, this is a high energy motor vehicle collision that causes fractures of the extremities.
And your focus was on the lower part of her body.
Right.
And then I believe there was another doctor, Dr. Payne, Diane Payne, who would have done the surgery to the arms. Is that correct?
Yes.
Okay. Can you use the illustration that we've marked as Exhibit 1 to explain to the jury what you did during that first surgery on March 3rd of 2020?
Sure. So the bottom right picture, there's a window that shows first surgery. It's an external fixator. So it's a picture of some pins that go directly in the bone, distal or away from the zone of injury, away from the knee, and some pins in the thigh bone or the femur, and then bars outside the skin that are intended to hold the bones in as good of a position as we can without making incisions. And what that allows us to do is not only look at the soft tissues, but we allow the swelling to sort of come and then and reach its maximum. And then as the swelling is coming back down, usually somewhere between a week or two after the injury, we go in and definitively fix it with plates and screws. And so that definitive fixation construct is pictured on the other side. You can see the picture that says right knee. There's plates and screws that are put in through an incision on the lateral aspect of the knee. There are also screws on the medial aspect of the knee, and those are all intended to hold the bones in the right place while her body heals the fracture. On the bottom left, there's a picture of the right ankle, which shows a fracture of the calcaneus bone, which is the heel bone. And in the same fashion, there's a plate and screw construct, which is intended to hold the bones in the right place until the patient's body heals the fracture.
So we will talk about that second surgery that you just mentioned in a minute, but I want to stay with the March 3rd surgery.
Okay.
You mentioned an external fixator, and that's what you referenced in that box to the right of Ms. Daniels' picture on the illustration. Is that correct?
Yes.
Is that designed to be a permanent fix, or is that external fixator a temporary measure, as I think you've just testified to, before you then do a second surgery for a more permanent fix?
It is intended to be temporary and a staged fixation, although we have treated fractures like this in the external fixator. But the goal is to stabilize things so that the swelling can come and go, because to do the definitive surgery at time zero or at the index procedure, there is an increased infection risk associated with that because of the swelling. And so we very commonly stage these types of tibial plateau fractures.
Can you kind of paint a picture for the jury of where this external fixator is? It's outside of her leg, is that correct? It's on the exterior, but then
That's right.
there are some, screws that go through her leg into the bone on the inside? Is that how that works?
Right. So there are Shan's pins, which have threads. They're long threaded pins that go directly into the femur and then directly into the tibia outside the zone of injury. So this is uninjured tissue, and the bars are outside the skin. So we're not making incisions or disrupting the soft tissue that's already injured, so that we can allow that to sort of start the healing process prior to an incision in that area.
Was your initial surgery successful? Did it come off as intended?
Yes.
Where did Ms. Daniels go after that first surgery?
She stayed in the hospital, and so we will commonly have physical therapy see patients after a surgery like that. And if the patient has an isolated injury, sometimes we send them home and have them come back for that definitive second surgery. But in this case, she stayed in the hospital because she had 3 extremities injured. It's hard for her to mobilize and take care of herself at home and make it to home and back to the hospital for that second surgery. So she stayed in the hospital for the week to a week and a half before the second surgery.
So the second surgery, as I understand from your notes, occurred on March 11th of 2020. Is that correct?
Yes, I believe so.
And if you would bring those surgical notes up on your computer so I could ask you about them.
Okay.
Can you tell the jury what the pre-operative diagnosis was before you performed that second surgery on March 11th?
Sure. Right bicondylar tibial plateau fracture, status post external fixation, right closed intra-articular calcaneus fracture, bilateral upper extremity fractures treated by the orthopedic hand service, and morbid obesity.
Okay. I'd like to go back and get you to help the jury understand what some of these terms mean, okay?
Sure.
So number 1 was right bicondylar tibial plateau fracture. What is that? And can you use the illustration that we have to help the jury understand what that is?
So it's probably easiest to see on the picture on the right that has the plate and screw construct, but the tibial plateau is the joint, the tibial side of the joint, the knee joint. And commonly there are fractures on the lateral side, which is the side with the plate on. In Ms. Daniels' case, there were fractures on the medial side as well. They were posterior medial. So bicondylar just means both laterally and medially. These fractures, because they go into the joint, the goal is to restore the anatomy of the joint. When patients break bones outside the joint or in the shaft of the femur or tibia, commonly we don't place the bones in the right spot. We just sort of span them like in the external fixator case, because as long as they heal and heal straight, they're fine. We don't need every piece perfectly aligned. But in the case of a joint fracture like this, we want the joint pieces to be as aligned as possible to restore the anatomy of the knee joint.
And then your second diagnosis was right closed intra-articular calcaneus fracture, and help us understand what that is.
The calcaneus bone is the heel bone on the bottom left. You can see the picture of the heel bone. And so with an axial load, you get fractures of what we call the posterior facet, or the joint part of the calcaneus. So in the same fixed, it's the same, restore the joint bone or the joint that's depressed down. Plates and screws are put in to hold those pieces of bone in place. Heals the fracture.
And it looks like you added the diagnosis.
Can you pause for a second? I can't tell because we've got layers of production here. Is the internet issue here, or the internet issue was in the original deposition, so that no matter where you play what you're playing right now, we would have it be choppy?
I'm not not sure. I wasn't in this particular Zoom,
Neither was I.
so I'm not sure if
Oh.
the audio.
Did you play it
It's here.
better beforehand?
It's here? But I'm noticing, like it says,
I sent it to Ms. Arnold as well, and just before trial, and she was able to play it, so there's some kind of a lag.
okay, because it's showing, you don't need to be taking this down. It's showing Dr. Moore with red bars next to him. Of course, Dr. Moore said what he said weeks or months ago. That's not on Fulton County. So I'm here to help, but Dr. Moore was a little choppy and he's getting an alert on that screen. That is not our alert. That would have been an alert at the time of the deposition. So I'm happy that we keep playing. I asked only because if it's an issue here, we could try to work on it. I don't get the sense that the issue is here. I get the sense that Dr. Moore has a bad connection from Dr. Command, wherever he is doing his thing.
Except that the version I sent to Ms. Arnold.
Oh, well, no, I was just don't recall it. I cannot say I have watched this.
Okay, well, let's just let it.
We will, but I'd be surprised if Ms. Arnold with crystal clarity could say at 12 minutes and 18 seconds, I recall there was no internet lag. So let's keep going. I'm just flagging it. If you determine, technical expert, that it is a network issue here, we can see if we can do something differently. I think we've got good, robust connections, even though it's a county connection. So let's keep playing.
Thank you.
The surgery, it's number 5. That is.
Right. Displaced lateral meniscal tear. So it's so much joint depression and depressed into the metaphysis or wide part of the bone. It takes a piece of the meniscus, which is the cartilage that lines our bones, sort of like the cushion in between the joint. And that's a structure that doesn't show up on x-ray. And so we commonly can't see it on our initial x-rays or our CT scan. And so we always look for it in the operating room when we do the surgery. And in this case, the meniscus was torn and pushed down into the tibia, into the metaphysis, and had to be elevated and repaired.
Just so we understand exactly where we're talking about, if you look on this illustration, there is a box labeled right knee.
Yes.
Do you see that?
Yes.
Are we talking about really the area right behind the knee? Is that where this meniscal tear is located?
Yes, the meniscus is on the lateral side in the knee between the tibia and the femur is where the cushion is. And so when it's torn and displaced, it's actually pushed down into the fracture or down into the metaphysis of the tibia, into the wide part of the tibia. And so when we elevate it, we repair it. And so it's now sitting in between the repaired joint on the tibia side and the intact femur. And so, go ahead.
Yes, sir. Doctor, can you just, in the most lay terms possible, take the jury through what you did during this surgery, just the order in which you did things and what you repaired and how you did it, again, using language that those of us who aren't doctors might understand.
Sure. So we make an incision on the lateral part of the knee, incisions through skin and subcutaneous tissue down to the tendons that insert on that part of the knee. The tendons, the insertion of the iliotibial band or one of the muscles is incised, which gives us access to the bone. We move some of the pieces of bone out of the way to find the joint pieces which are depressed down, and we elevate those back up and then hold them with wires. It's temporarily held in place. Then we close all the pieces back, the bony pieces on the side, and hold that with plates and screws. And then commonly for patients that have a lot of depression, we will backfill, fill underneath that joint. We will backfill it with some substance, whether it's bone chips or a bone graft substitute, which is what we used in this case. Prior to elevating all those pieces up, we do the meniscal repair, which we talked about, the cushion, the cartilage in the knee. That repair is done prior to elevating all those pieces up. In my patient's case here, she also had fractures on the medial side. So the way that we stabilized those is we used fluoroscopy, which is live x-ray, and we put in screws oriented 90 degrees to where that plate is to hold the medial fractures in place. Then, after we completed that, we closed the layers of tissue with stitches, with sutures.
So in terms of the metal hardware that you implanted during this surgery, if we look at the illustration, there's a box labeled right knee.
Yes.
And it seems to show some metal along the large bone there below the knee joint. Do you see that?
Yes.
Was that hardware put in by you during that surgery?
Yes, that second surgery was intended to put that hardware in to hold the fractures in place after we put them in the right place.
And then sort of same question for the box that shows the right ankle. There are, I believe, 3 pieces of plate there on the right ankle. Were those installed by you during this surgery?
Yes, it's a single plate that has, almost a Z look to it. And yes, those 3 portions fit on the lateral aspect of the calcaneus, but they do the same thing. They function the same way as the plate on the tibia. They're holding those broken pieces of bone in the right spot.
You then see, I take it, by the way, that after the surgery, she was taken back to her room in Grady after she came out of surgery, where she remained.
Yes.
I believe you next saw her after that surgery on April 17th of 2020. Can you pull that up for me, please, sir?
Yes.
And that was a 4-week post-op follow-up visit. Is that right?
Correct.
And by the way, after that surgery that you just told us about, how long did you say that she needed to remain non-weight bearing?
Usually it's 3 months after a surgery like that, and that's what we told her. 3 months of time for the body to heal those fractures to allow enough stability for the patient to start bearing weight again.
So back to the April 17th visit, how was she doing 4 weeks after her surgery?
So according to the note, she has, let's see, the patient's pain is controlled on PO or oral pain medicines. She has no fevers, no chills, no incisional drainage, no other complaints or issues. Her self-reported visual analog score, pain score is 7, that's 7 out of 10. And her hinge knee brace has been on since surgery. She also has a splint on the ankle. So after we do the surgery, we put a brace on the knee and then a splint on the ankle. She still had those on.
Would you, was her pain complaint of a 7 out of 10 in the knee, is that what you would expect of a patient 4 weeks post-operatively?
Those pain scores are very subjective, and so it's hard to really comment on what it's supposed to be. I think it has more utility to look at trajectory and how much pain compared to another visit. So 7 out of 10 isn't certainly not abnormal, but I wouldn't say it's normal either. Every patient's a little different. Okay.
And I believe you then next saw Ms. Daniels on May 28th of 2020. You'll pull that up, please.
Okay.
And that's a note by your physician's assistant, Lauren Upchurch, is that right?
Yes.
Explain to the jury how you use a physician's assistant in the care and treatment of your patients.
Ms. Upchurch has mostly a clinic role. She does do some inpatient rounding as well, but in the clinic setting, she sees patients and takes histories, does physical exams. She can write prescriptions. She can evaluate patients just like a physician. She's a physician's assistant. And so she sees a lot of post-op patients sort of randomly as they come in through the clinic. So the fact that she picked up the chart doesn't mean anything other than she picked that one up. That was the next available chart.
And
forgive me.
You review her notes when she does a visit with a patient?
Yes.
And do you agree with the notes of the May 28, 2020 visit?
Yes.
What did Ms. Daniels tell you during that visit about her plans going forward?
So she had mentioned in this visit that she was going, I believe she's moving to Texas. And let me find that exact. So she's moving to Texas next week for family support during her recovery and plans to follow up with an orthopedic surgeon once she is there. No fevers, no chills, no drainage, no other concerns.
What did your patient tell you about her plans following the May 28, 2020 office visit?
The patient stated she's moving to Texas next week for family support during her recovery and plans to follow up with an orthopedic surgeon once she is there. No fevers, no chills, no drainage, no other concerns. Her pain and reports well overall. History exam.
Did you then, when she returned on 1, that's the...
Yes.
About how she was doing?
She clinic visit now is she's moved her last visit with us. She's now back in a follow-up. When asked about her symptoms, she says it's just what it is. Upon further questioning, the patient has intermittent right knee pain and foot pain. Her pain is rated as 5 out of 10 on the visual analog scale. She states her knee pain is worse with prolonged standing or walking. She reports she does what she needs to day, but otherwise is fairly sedentary. When asked what is preventing her from being more active, she is unsure. She does not feel instability in her leg. She reports she's still doing physical therapy exercises that were given to her. She previously took ibuprofen, which provided some relief, but she ran out of this medication. She has no fevers, no chills, no drainage, or no other concerns. She requests to have her complaints and diagnoses documented for her lawyer.
Did she follow up with you again after that on June 3rd?
Yes.
And that's 2021, correct?
Correct.
What was her main problem that she was having when she saw you on June 3rd?
Her knee pain seemed to be what she complains about. Knee pain is worse with prolonged standing or walking. She also has some ankle pain and swelling. She also has some reflux symptoms, so mostly knee and ankle pain.
And what did you do for her on that visit?
So at this point, the x-rays have shown that her fractures are healed, although she has some arthritis in her knee and her ankle. She also has some deformity to her knee, so we sent her or referred her to a joint replacement specialist to evaluate her knee.
And we'll talk about that in a little bit. I want to focus on the June 3rd, 2021 visit. Did she have a steroid injection?
Yes, with patients have arthritis, we will commonly offer them a steroid injection, which is an anti-inflammatory. And so we did offer her that, and I'm trying to find that in the note. If you bear with me, I'll see if I can find that. Yes, steroid injection at her knee was given. We also gave her a prescription for Celebrex, which is an oral anti-inflammatory as well.
So after that steroid injection on June 3rd, it looks like you saw her, and you had asked her to follow up in 6 months, is that correct?
I can confirm that. Let's see. Yes, 6 months.
So I haven't done the math, but 5 or 6 months later, it looks like she returned November 11th of 2021. Can you find those notes, please, sir?
Yes.
Was Ms. Daniels doing any better with her right knee when you saw her on November 11th of 2021?
So reports she is the same as she was at her last visit. She does not think she's any better. She continues to have right knee and right foot pain. She's and one is not. She did 6 out of 10 on visual analog score. She's taking Tylenol. She did not fill or take her Celebrex. She reports the steroid injection to her knee helped, but only for about 2 months. She states it did not relieve any pain. It only relieved pressure on her knee. She does request another injection today.
And did she get one?
Yes.
So that was her second knee injection, is that correct?
Correct.
And then I believe she next followed up with you on February 10th of 2022.
Yes.
What kind of pain was she experiencing when she saw you on that day?
Her pain is rated as 7 out of 10 on the visual analog scale. Would you like me to read the rest of the subjective? This is a little bit longer of one.
I'm just wondering how her right knee was feeling.
So she rated it as 7 out of 10. She continues to have excessive swelling when she walks for prolonged periods. She does not like to take medicine for pain. She reports that her second knee injection did not help at all. Unlike the first one, she would like to avoid additional surgery, but is amenable if we think it's legitimately going to help her with her pain. She continues to have worsening pain with prolonged standing and walking. No wound issues, no fevers, no chills, no drainage.
So I want to ask you about her right knee because you had mentioned in your notes, I don't remember if you used the term knock-kneed or a valgus to explain why her right knee seems to be pointed inwards. Can you help the jury understand what that condition is and how it's caused, why she would have that condition?
Sure. So a valgus knee, just like you mentioned, is a knock-knee deformity as opposed to varus, which is the bow-legged deformity. And so a knock-knee deformity is common in tibial plateau fractures because the lateral part of the joint, the outside part of the joint, is what gets depressed down. And so when we elevate it and hold it in place, if it depresses back down, what happens is the top part of the knee, the femur, falls into that defect, creating that knock-knee deformity. And so a valgus knee or deformity like that causes, when you walk, it causes pressures to be focused on the lateral part of the knee. In a normal knee, in a knee that doesn't have deformity, the pressure is spread out between the different parts of the knee. But if you have a valgus knee, more of the pressure goes on the lateral side, which exacerbates the pain and inflammation in a knee like that. And so that's why injections of steroids can help. And that's also why if you're a knee replacement can help as well, because you can not only restore the anatomy, but you can take the arthritic part of the knee out and replace it.
Now, doctor, you initially repaired her knee so that it was not a valgus bend toward the center. Is that correct?
That's right.
Did this condition, this knock-knee condition with her right knee, become worse over time or stay the same over time?
It became worse over time.
And can you help the jury understand why, over the passage of time, her knee bend became worse?
Sure. So it's multifactorial. I would say that the biggest factor that's involved with a post-op deformity, especially if the joint alignment was restored at time zero, at the time of surgery, the initial trauma, the initial displacement of the fracture tends to be the biggest predictor of whether or not it's going to fall into that defect or fall down and cause that deformity. There are other factors that can predispose patients to having a post-op deformity. If patients don't follow instructions and put weight on their leg when they're not supposed to, that can cause it to happen. Inadequate fixation, if the screws aren't put in the right spot or aren't strong enough or aren't done well enough, that can cause it to happen. If you don't backfill the area enough, that can cause it. Certainly patients' bone quality is a factor as well. If patients have poor bone quality, it puts them at risk for the implants to not do the job that they're intended to do. So the bone can, if you don't have good enough fixation in them, they can fall back into that depression and cause that deformity. Other things like infection, and problems with hardware, that can all cause it too, but it doesn't seem to be the case in Ms. Daniels' surgery.
In Ms. Daniels' case, what role did traumatic arthritis play in the deformity in the knee that you've been describing?
So traumatic arthritis refers to the joint line itself having inflammation, and so that has to do probably secondarily to the deformity and to the trauma to the knee. I think they're sort of mutually exclusive diagnoses. The deformity itself has to do with the position of the bone, and then the arthritis has to do with the irregularities in the joint surface and the lack of cartilage on the bone. So they're actually separate issues, but they are related in that if you have the deformity, more pressure goes on the outside of the knee, which predisposes patients to arthritis. So I would say the deformity and the fracture type and the energy of the fracture lead to the deformity, which leads to the arthritis, worsens the arthritis.
Based on this office visit, what were your recommendations for Ms. Daniels?
So we told her to continue weight bearing as tolerated. We can continue range of motion as tolerated. We talked about continuing physical therapy, home exercise program, weight loss, activity modification, over-the-counter anti-inflammatories and pain medications, then follow up in the ortho-arthroplasty clinic for her right knee. And then we also suggested she follow up with Dr. Kadakia, who's a foot and ankle surgeon, for her right ankle, or right calcaneus.
What were your thoughts on what needed to be done for Ms. Daniels' right ankle when you referred her out to a specialist?
So just like in the tibial plateau, the ankle or the subtalar joint, the bottom part of the ankle, can develop arthritis. And so an ankle fusion or a subtalar fusion is a very good operation for arthritis on that joint underneath the talus, which is what I felt the patient needed. Given the displacement, the initial displacement, and then the settling of the fracture, there's a chance that she may need more than just a fusion. In other words, reestablishing or putting bone in that area to help reconstitute the calcaneus. And so that was the reason for sending her to Dr. Kadakia, who's a foot and ankle specialist.
And we'll talk about her knee in a minute, but let's stay on the ankle. Can we again look at the illustration? And if you look at the box that's labeled right ankle, do you see that, doctor?
Yes.
Can you explain to the jury how a right ankle fusion would be accomplished? I see there's already hardware at this point, right, inside of her ankle.
Yes.
Can you explain to the jury what happens to that hardware and how the fusion is accomplished?
Sure. So a subtalar fusion is where the bone between the talus, which is the bone right above the calcaneus, right above where the plate is, and then between that and the calcaneus, the remaining cartilage is scratched off, and the bone ends are irritated to a point where they when they're put together with the calcaneus, they fuse together. When they fuse, they have no motion and the pain generator goes away. The plate is oftentimes removed to make way for screws or another plate to do that surgery. But if the displacement of the fracture, if it has redisplaced and the heel bone needs to be reconstituted, commonly we'll put extra bone into that space, kind of like you're jacking up a car to jack up or to open that joint up to make the heel bone more anatomic, to allow the mechanics of the foot to be more normal.
What would a fused right ankle do to Jame Daniels' mobility?
So at this point, her mobility is very little and she's left with pain. So it really wouldn't affect the mobility of the ankle much. So most people have a stiff hind foot. This joint is very stiff. That's why we fuse these joints. So the difference pre-op versus post-op is minimal, but the pain goes away. And the difference between the premise of doing a fusion on the ankle and a knee replacement on the knee, we don't commonly fuse the knee because the knee, you want to preserve motion of the knee. Preserving motion on the hind foot is very difficult, and her motion is minimal, is very likely minimal on that subtalar joint.
Can you explain to the jury, when you fuse an ankle like you're talking about here, what kind of motion does that prohibit?
So we call it accommodation, and it's the bottom part. It's not the ankle joint itself. You think of the ankle going up and down, that actually wouldn't be affected. It's the heel moving side to side. And so what people complain about when they have a really stiff subtalar joint is problems with accommodation. So you step on an uneven surface and you don't realize it. And in a normal foot, your heel will go side to side to sort of accommodate an uneven surface. And if the ankle's fused, when you step down, you don't have that accommodation. So people can have a feeling of imbalance and unsteadiness when they walk from that perspective.
Moving on to her knee, you mentioned that you referred her to Dr. Sadlak for her right knee. And I want to ask you what the lack of permanent success of the steroid injections told you as a doctor about whether Jame Daniels might need a right knee replacement.
So we use steroid injections not only therapeutically to make a patient feel better, but it's also a good diagnostic test in that if a patient has relief from an injection, we know that that's the pain generator, because there are a lot of other pain generators in the knee. And so when they get relief, we're pretty sure that it's an intra-articular pathology, a problem inside the knee. But when it wears off, when it doesn't last, usually the cutoff is 3 months or so, you can't really get those injections more than every 3 months. Most people will get them every 6 months. But when you start having effectiveness that's below that, it commonly is time to start talking about knee replacement.
And is that, as we're here today talking, is that kind of where we are? You have referred her to these doctors.
Yes.
Doctor, in your medical opinion, what was the cause of Ms. Daniels' pain and broken bones and other injuries that you treated her for and that you've testified here about today?
So the motor vehicle collision, which causes the fracture and the joint depression and the fractures, leads to the arthritis and the deformity and the need for restoration of anatomy and replacement of the knee joint and fusion of the subtalar joint.
And doctor, was your treatment medically appropriate and necessary given Ms. Daniels' pain complaints, test results, and symptoms?
Yes.
That's all I have. Thank you, Dr. Moore.
Can you pause it for a sec? Thanks. We're going to do our morning break, not right now, but when this deposition ends, but I just want to give you guys a chance just to stand up for a second. We're going to hear the cross-examination from one of MARTA's lawyers of Dr. Moore, and then when we're done with that, we'll take the morning break. Everyone going to make it for a few more minutes? Feel free to stand for a second if you want to stand. That's not an issue. I'm going to do it. And then we'll press play and hear. It's not the second half. What's left is shorter than what you've already heard. It's the second segment of this deposition. You bet. I feel so much better. All right. When you are ready, let's keep playing, please.
Good morning, Dr. Moore.
Good morning.
The last surgery that you performed on Ms. Daniels was in March 2020, correct?
Correct.
Okay, and that was to remove the external fixator, which was in place for just over a week.
That's right. Correct.
And if you'll pull back up the plaintiff's exhibit 1, please. Right. So in Exhibit 1, with respect to hardware in her lower extremities, the external fixator has been removed, and what remains are the plates and screws shown on the left.
Correct.
Okay. In your treatment, you said doctor was limited to her right knee and right ankle, correct?
Correct.
Okay, you did not treat any of her upper body extremities, correct?
Correct. That's correct.
And you have no opinions as to any injuries to her upper body or any related treatment?
I have no opinions. I don't have any. I did not perform the surgeries. I'm familiar with those surgeries, but no, I don't have any. I guess I don't understand the question.
You're not here to testify about her upper extremity injuries or any treatment?
Correct.
Thank you. You last saw Ms. Daniels on February 10th, 2022?
I believe so, yes. Yes.
All right, you haven't seen Ms. Daniels since that date?
Correct.
You haven't spoken to Ms. Daniels since that date?
Correct.
And that's because you referred her out to Dr. Kadekia and Dr. Sadlak?
Correct.
And you referred her to Dr. Kadekia for her foot and ankle, is that right?
Correct.
All right, and that's to consider the subtalar arthritis or ankle fusion that you mentioned?
Correct. Subtalar fusion, yes.
Subtalar fusion, thank you. And no decision has been made yet as to whether she needs that or she will be undergoing that surgery, as far as you know, correct?
As far as I know, there's no plan put in place. There's no surgical date. There was some talk about getting further imaging, a CT scan, to look at the joint anatomy.
Okay, so no decision has made yet as to that, has been made yet as to that surgery, as far as you know.
That's correct.
And you referred her to Dr. Sadlak for her right knee,
Correct.
and that was to consider a knee replacement, correct?
That's correct.
All right, and no decision has been made yet as to whether she needs or will undergo that surgery, as far as you know.
That's correct.
All right, you were not present at either of her visits with these two new doctors, correct?
That's correct.
All right, so we would need to hear from them directly as to their assessment and their recommendations, true?
I'm not sure what you need. If you need to do that, that's fine. I'm sure that they would be happy to talk to you.
Well, let me ask it again. We would need to talk to them directly about any of their own independent assessments or recommendations, correct?
So if they want to do, if they're doing the surgery and you're right, you'd want their opinion on what surgery is best and the timing and the order and how the surgery is done, because they're the ones that would perform the surgery, not me.
And they're both specialists in their fields.
They are both specialists in my field and specialize in knee replacement or joint replacement and foot and ankle surgery.
And would you defer to them at this point on any recommendations they make as to future treatment for her knee and her ankle?
Yes.
You don't have a plan to see Ms. Daniels at present, correct?
That's a good question. I commonly at the last visit will say that patient can follow up PRN or as needed. And so I probably did that. I don't know for sure. I can find it for you, but if we don't have an actual appointment scheduled, then yes, there's no plan to see her, but patients do commonly call and make appointments if they have issues, as Ms. Daniels did, between March of 2011 and her next visit.
Okay. And you testified at your deposition on April 5th of this year, 2022, that you don't have a plan to see Ms. Daniels. To your knowledge, has that changed?
No, it's not changed.
All right. Dr. Moore, you'd agree that conservative treatment is an important first step in any patient with injuries like Ms. Daniels, true?
With injuries like this, so conservative treatment is the first step for surgeries like replacing the knee or fusing the ankle, but there is not a role for conservative treatment in these injuries. When she came into the hospital, as far as my opinion would be that these need surgery. There's no non-operative treatment options. So if you treat these injuries without surgery, the deformity that she has now would have been significant, and my concern would be the fractures wouldn't even heal. So let me rephrase my answer. The conservative treatment there is a role for that in elective surgeries like joint replacement and subtalar fusions, but not for fracture care in this case.
Okay, so recovery from surgeries like those that Ms. Daniels underwent would include conservative treatment post-surgery. Like
yes. So, okay, so yes, conservative treatments, which I would assume you mean non-operative treatments, that is part of the constellation of treatments for any injury. Yes, correct.
Right. And in fact, there was conservative treatment that you recommended for Ms. Daniels after her initial surgeries in March 2020, correct?
Yes, correct.
Some of those conservative treatments would include anti-inflammatories, right?
Correct.
Activity modifications, correct?
Correct.
Topical medications,
Correct.
weight loss,
Correct.
braces, orthotics, or shoe modifications.
That's correct.
Ms. Daniels did have a knee brace that you deemed no longer necessary at some point, correct?
Correct.
And that's because you wanted her to use her own muscles to do the function of the hinged knee brace.
That's correct. I was concerned that if the brace was inappropriately applied or not perfectly aligned, patients don't move their knee. And so knee stiffness is a concern in these patients. And so I wanted her to move her knee, and I wanted the brace. If the brace was preventing that from happening, then I didn't want it on her.
Because a brace can prevent a patient from using their own muscles, as you said, and weakening the joint instead of strengthening the joint, right?
I think a brace, the intention of the brace is to provide some stability to the knee, which can help with pain control. And so that's the reason we use it. We commonly will use it in patients with meniscal tears like she had. So that's the reason for it. It doesn't actually, it's not an automatic brace. It doesn't make it so her knee bends on her own. She still uses her muscles, but it can take some of the stresses off the structures around the knee when the knee is moving. So it offloads the knee. Yes, you're correct.
All right. And so she did stop using that at some point so that she could increase her range of motion in the knee.
That's correct. I believe it was her first post-op visit at a month when we discussed removing the brace to help with knee motion.
Okay. So the knee brace was part of that conservative treatment. Another type of conservative treatment are the steroid injections.
Correct.
Right. And we talked about those a minute ago. And then physical therapy.
That's correct.
All right, so let's talk about weight loss. You talked about the diagnoses with Mr. Johnson a minute ago. One of the diagnoses you mentioned is morbid obesity, which is still identified as a diagnosis in your note of February 10th, 2022. Isn't that right?
Yes, I believe so. Yes.
And we talked about weight loss being part of the conservative treatment for any ankle or knee pain scenario, right?
Yes.
And that's because there's less stress that goes through a knee if there's less weight going through a knee or an ankle or a joint that's arthritic.
That's correct. Yes.
And weight loss is still something that you were encouraging Ms. Daniels to do at her last visit in February 2022.
Yes.
And do you know what efforts, if any, that she has taken in that regard?
I don't recall any objective efforts, and I don't recall her exact weights at these clinic visits, but she still had a diagnosis of morbid obesity.
Weight is also something that should be considered when determining whether a patient is a candidate for surgery, right?
For an elective surgery like knee replacement and probably for ankle replacement as well, it is a factor because doing a surgery like that on an obese patient increases the risk of infection, which is devastating for any surgery, but specifically for an arthroplasty or a knee replacement, it's a devastating complication. So commonly surgeons will insist on weight loss prior to an elective surgery like that.
Okay. So there's a risk of infection, right?
Correct.
The risk of wounds, the wound not healing,
Correct.
and a risk of other complications.
Correct.
And so that was also part of your discussion with her at her last visit in February 22.
Yes.
So we also mentioned physical therapy as an important part of conservative treatment for joint injuries post-surgery, as you helped clarify. You'd agree, doctor, that non-compliance with PT can delay a person's recovery.
Yes.
Can also create problems with stiffness,
That's correct. Yes.
and it can affect the ability to regain strength.
Correct.
So it's important to keep injured joints active to the extent a person can, so they don't stiffen up as they heal, right?
That's correct.
And PT or physical therapy is something that you recommended for Ms. Daniels,
That's correct.
and that's something that you were still recommending for her as of February 10th, 2022, right?
That's correct. And so our use of physical therapy might change over time, what we expect the physical therapist to do with the patient, but I do think they provide an important tool for a patient to either regain motion, regain strength, and then once patients are on their feet and they have those two things, they can even help with balance, proprioception, and putting your foot or your leg in space. And so there are a lot of benefits to physical therapy after an injury like this, and benefits for patients who have run-of-the-mill arthritis too.
Right. And if Ms. Daniels wasn't going to formal physical therapy, you'd expect her to be doing home physical therapy exercises, right?
Correct.
You don't necessarily have a preference at this point.
I don't have a preference. If we're talking about range of motion exercises or strengthening exercises, commonly the physical therapist will see the patients and give them a set of exercises which they do at home. And then the therapist is more of a coach that sees them over time. And then eventually the coach can sort of move to the side and the patient can do the home exercise programs on their own. And really how many sessions and how often they see the patients are really up to the physical therapist, in my opinion. Because some people are self-motivators and some people are motivated by more visits with therapy, and that's an individual patient preference.
Right. The key is to get better over time and to reduce symptoms.
Correct.
Okay. And you consider that important for her to continue doing for the reasons we discussed.
That's correct.
That home exercise program should include quadricep strengthening exercises, right?
That's correct.
And that's because the quadricep is an important muscle in walking
Absolutely.
and holding yourself upright
Absolutely.
and standing in one place.
Absolutely. Yes, correct.
And when the quadricep is weak, it can cause frontal knee symptoms, right?
That's correct. So frontal knee pain with a weak quad is very common in injured patients and in uninjured patients. So that's one of the reasons why physical therapy or a home exercise program is important for people with knee pain.
And any home exercise program for someone like Ms. Daniels should also include ankle strengthening exercises.
That's right. Ankle strengthening or calf strengthening is important for ankle injuries, ankle fractures, or calcaneus fractures. Correct.
So the jury in this case will hear about a functional capacity evaluation or an FCE that was performed on Ms. Daniels by a paid expert hired by her lawyer. You're familiar with a functional capacity evaluation, correct?
Yes.
Essentially, a functional capacity evaluation evaluates an individual's ability to perform work activities related to his or her participation in employment, right?
That's correct.
And you don't perform those yourself, right?
That's correct.
But you certainly like to know if one of your patients undergoes a functional capacity evaluation.
That's correct.
And any conclusions in the functional capacity evaluation should align with your current care or treatment as a treating physician.
Yes, I would hope so.
And when I took your deposition on April 5th, 2022, you were unaware that Ms. Daniels had undergone a functional capacity evaluation by a paid expert hired by her lawyer. Isn't that correct?
Right. Correct.
And since that date, have you been provided a copy of the functional capacity evaluation that the paid expert performed?
No.
You don't know whether the conclusions and the recommendations in that functional capacity evaluation align with your care and treatment as a treating physician.
I do not know that.
Okay, and that's something that you prefer to know as a treating physician.
Correct.
You agree that a functional capacity evaluation should consider the patient's activities of daily living, right?
Correct.
Okay, and that's part of the process.
Part of the evaluation and in my opinion, should be part of the recommendations, yes.
So learning about and considering the patient's activities of daily living is relevant and important to consider when performing a functional capacity evaluation.
Yes.
And since you haven't seen a copy of the functional capacity evaluation performed by Ms. Daniels, paid expert, you don't know whether those relevant and important facts were considered, do you?
I don't know that.
The jury will also hear about an impairment rating that was given to Ms. Daniels by a paid expert hired by her lawyer. You're familiar with what an impairment rating is, correct?
Yes.
So essentially an impairment rating is the percentage of damage to the patient's body caused by a particular injury. Is that fair?
Yes.
You don't perform those yourself either, correct?
That's correct. We don't do that in my clinic.
But you certainly like to know if one of your patients undergoes an impairment rating, correct?
Correct, yes.
And when I took your deposition on April 5th, 2022, you were unaware that Ms. Daniels had undergone an impairment rating by a paid expert hired by her lawyer. Isn't that right?
That's correct.
And since that date, have you been provided a copy of that impairment rating?
No.
So you don't know whether that impairment rating assigned to Mrs. Daniels aligns with your care and treatment as a treating physician, do you?
I don't know that.
And that's something that you would prefer to know as a treating physician.
Yes.
Dr. Moore, you don't know whether Ms. Daniels is currently employed, do you?
I don't know that.
You don't know whether she has worked at all since this accident?
I don't know if she has. We commonly write notes to employers to say that patients can or can't work. In other words, aren't allowed to or not. And that's usually in that first 3-month period where we're saying, hey, no weight bearing, no putting weight through your legs or arms. And so that's when we say they can't work. And then after that, it's a determination based on their function, how they get around and what they can do in their job description as well. And so no, I'm not aware of any notes saying that she should go to work or can't work as far as I know.
Okay, there's nothing in your records that says she's unable to work.
I don't believe so, but the medical records are very, I haven't gone through every page, but no, I don't believe there's anything in there that says that.
And that's not an opinion that you intend to give in this case, that she is unable to work. Is that
That's
right?
correct. That's correct.
You don't know whether she's even looked for a job since the accident, right?
Correct. I don't know that.
And I think you told me last time that it was impossible to say whether or not Ms. Daniels is able to maintain any form of gainful employment. Do you recall that?
It's impossible for me to comment on someone else's independent medical exam or functional capacity exam. And so our exams in clinic are focused exams on the knee or the ankle or the wrist or the forearm or whatever injuries there are. And so it's hard for us to make final determinations about ability to work. Because those functional capacity exams are so detailed and require so much time, we just don't have the ability to do that for all of our patients, all of our injured patients.
And so you're not here to give an opinion about her ability to work because you don't have enough information to do so, right?
Correct.
And part of the information you'd want to know is more information about her activities of daily living, right?
That's correct.
As you told me last time, that's just one of the many things that such an evaluation would involve.
Correct.
And as we sit here today, are you aware of what Ms. Daniels' activities of daily living entail?
I'm not aware of them specifically, but common activities of daily living would be, getting around the house, making food for yourself, getting to and from a bathroom, to and from the different rooms in your house. And they're just requirements that a day has. So those activities are different for different people.
And are you aware of Ms. Daniels' ability or inability to perform any of those tasks?
I'm not aware of that for this patient.
And you're not aware of how much time she spends sitting in a car each day, right?
I'm not.
You're not aware of what she does in and around her home each day.
That's correct. I'm not aware of that.
And you're not aware of any travel that Ms. Daniels has engaged in since this accident.
Other than her subjective exam telling us that she moved to Texas, I'm not aware of any travel.
And that brings up a good point. So she moved to Texas in June of 2020, correct? Your last visit was in June of 2020?
That's correct, yes.
Okay, and then she did not return to see you again until March of 2021?
That's correct.
Okay. And during that 9-month period of time, do you know if she continued treating with another orthopedic doctor in Texas?
I don't know. I don't know. I don't have any records of that. And honestly, I don't remember her saying that. But we did discuss that with her at her last visit about trying to find an orthopedist. Although we did tell her she could advance to weight bearing as tolerated or advance to walking. It is good to have someone follow a patient with an injury like this to make sure that she's meeting goals and doing things appropriately.
Okay. So you don't know whether she was seeing another doctor during this time?
I don't.
And you don't know whether she was going to any PT in Texas during those 9 months?
Correct. I don't know that.
All right. When she returned to see you in March of 2021 and asked to have her complaints and diagnoses documented from her lawyer, were you aware that she had filed a lawsuit at that point in time?
No.
All right. Thank you, doctor. Those are all my questions for now.
Dr. Moore, a couple more questions for you. Do your patients, in your experience, always let you know whether they've had a functional capacity evaluation in connection with litigation or any other reason?
Yes, they do not always let me know, I would assume, although I don't know how often patients are getting these. We do have patients ask us to do them commonly, and we make a point of not doing these exams because they are time consuming. And our busy orthopedic clinic, we don't have the ability to do these exams for all of our patients.
Do you need an FCE, a functional capacity evaluation, in order to treat a patient like Jame Daniels?
No.
Doctor, does injuries such as Ms. Daniels sustained that you've testified about affect her ability to lose weight?
So in the initial time period after a trauma, especially multi-extremity or multi-trauma, multiple areas, the body actually uses more calories at baseline than they would otherwise. So most people actually do lose weight from the trauma because of the body's need to repair all of these tissues. So it is not uncommon for patients with multiple injuries to lose a significant amount of weight in that perioperative or 3-month time period. After that, as the patients start to recover, we prevent people from exercising using weight bearing on their knees in that 3-month time period. But after that, they certainly are allowed to do that. But part of the activity modification recommendation for an arthritic patient, for someone with arthritis, would be don't do things that exacerbate pain. And so, if you imagine jumping jacks as part of your exercise routine, it would be hard to do that with a valgus knee or with arthritis in your ankle or with a subtalar fusion. But there are other exercises that we recommend for patients, like aquatic therapy, exercise bike, which are non-weight bearing activities, which can still be useful for weight loss.
Is there anything that you recall that Ms. Daniels did during the course of your care of her that you criticize her for?
I don't recall criticizing her. I don't recall ever criticizing her, but no, I don't recall anything.
Doctor, you're giving your testimony here by Zoom video deposition. What effect would you being on call for a trial have on your practice and the patients you see?
being on call for a trial. So my weekly routine is I cover the trauma room, which is the room that's left open and fills with patients from overnight trauma, whether that be highway trauma or ballistic trauma or motorcycles or falls from heights. And so we have a very busy trauma room that we cover, a few days a week. I also have elective OR rooms where I take care of patients who, I decide on weeks in advance. And then I have a clinic once a week. And so while I do have some administrative time to do things like this, it is hard to align schedules to allow for that. I also teach residents and fellows and medical students, which takes up a lot of my administrative time.
Doctor, I appreciate it. Thank you, sir.
Just a couple of follow-ups, Dr. Moore. You don't know Ms. Daniels' weight prior to this accident, correct?
I don't.
Okay, so you don't know whether she was obese or morbidly obese prior to this accident?
I don't know, although the medical record would have a documented weight when she came in.
Okay, and you don't know that as we sit here today?
I don't.
I'm sorry, I did not hear that question.
And you don't know that as we sit here today?
Correct.
And you don't know whether Ms. Daniels had an active lifestyle before this accident?
That's correct. I don't know that.
And you don't know what activities she does or doesn't engage in now post-accident, correct?
That's correct.
Thank you very much, Doctor.
Thank you.
Trying to decide if he'd get out of jury duty with the little schedule he just shared with us. I don't know. Ladies and gentlemen, we're going to take our morning break. We'll make it about 10 minutes, maybe 11:05, 11:06. I'll have Deputy Gordon check with you all. Be at ease back there. Feel free to use the back hallway. Don't talk about the case. When we get back, I think there's another doctor we're going to hear from in this format. That will likely get us to the lunch break. And so we'll probably have lunch after the next deposition. Eat lightly, because there may be one more deposition after that one, and we need you to be alert for the deposition. So unless you all have any logistical questions, enjoy your break, and we'll see you in a little bit. All right, you all can be seated. Mr. Johnson, anything before we break?
No, thank you, Joe.
Ms. Arnold? The next deposition, can it be another one of the hour-long ones so that it gets us?
1 hour, 5 minutes.
Perfect. That'll get us.
The last one, just so you know, 43 minutes.
You had told me that we had 2 hour-longs and one less than an hour. I vote for the hour-long one next because that'll get us right into lunch. Plus, it's a shorter one after lunch when we're going to have jurors digesting and being a little drowsy.
Apologies for the Zoom, imperfections. The nature of our life these days is recording these things through Zoom. I think you're right. Ultimately, I think probably it was the thing on the.
Oh yeah, as I watched more of it, the issues, and they were minor, were at the time, not what was going on here. Ms. Arnold had some. I don't know if she was talking through a sock, but she had a bad connection for that Zoom as well. And that had nothing to do with the wonderful equipment in here. So maybe the next one is clear. I'll note this, Dr. Payne's was a whole lot better because you all were in the same room with Dr. Payne.
Some doctors just don't let you do that these days. Yeah.
They're in charge. All right. We'll see you guys in about 8 minutes.
Thanks, sir.
I'm gonna try to log on right here. No. I can do it all right here. This rotates. Yeah. Did you watch the games last night? Alan was watching. He said, "If you ever let me stay up, the Bills are winning by 500 points. You don't get to stay up. It's not close." The Eagles game, that's not close.
Eagles my team, so I really watch for Eagles all the way. I got a fantasy team, and stuff on this,
Roscoe was behind by 60 points going into the games last night. They had Diggs and Hurts. Yeah, and that got him 70 points. And so he won. He won. Dude, you don't want to wait till the last minute for those guys to flash.
Judge, I apparently had bad information on how long the next two videos are. Can I tell you?
Sure.
Because she's the expert.
Yeah.
For the long one is 43 minutes. The
Okay.
short one is
35.
35 minutes.
Okay.
So I just want to let you know,
All right.
since I just learned that.
Got it. That's better. Shorter.
It's
is better.
marketable. It is.
Yeah.
So I'm not upset to be giving you that.
Okay.
No.
So, Charlie, get off here. What do you think?
Meaning you put something in the microwave? Or you actually-
No. Oh, I mean, it's possible.
I know.
Did you see the, I was there, saw the clip with, Pat Williams and. She like Pat Williams came into town to a comedy show.
Yeah.
So my next,
You're gonna stop it?
my
This
best
one-
friend.
It's not the bunch of time to get the road.
How does this team look?
So he was.
That's fine, I just like-
But, yeah, I'm tired of you. Jalen Hurts.
Bill had an insane game too.
Yeah, 42.
Okay.
Oh my God, guys, watch 31.
Yeah, that won't be happening. The Dolphins aren't that good. They should be a really bad team. That won't happen again, but the Bills are crazy.
Oh, yeah.
Having Diggs is a good thing.
Yeah, Buffalo defense 33, Nick Chubb gave him 31.
Yeah.
He'll give him, he won.
My other son won because he had Chubb as backup. He had MARTA. And that, so. We'll see. Oh, look what shows up there. Huh,
Yeah, we signed in there, right?
interesting. I didn't know they talked to each other. That's fascinating. Well, Zoom is gonna be up there, so that'll work. I just need the court reporter to, hopefully she's got a Zoom account. Yeah. All right, your break is over in about 2 minutes.
Don't say that.
Well, mine hasn't even started yet.
Pat Williams. I'm here. Wanda, Frankie, they used to have a show together. Oh my gosh, it was a huge thing. She ended up getting kicked off the show anyway.
Oh, I did.
That's her husband.
Yeah, I did.
So the cooking thing,
That Williams had asked her what she cooked, and she said broccoli. And he was going in on her about how all your dreams were broccoli. Yes, that's all he don't have. Like, it doesn't make me.
I think they love like.
He put out a green on that.
I didn't see that. Well, I heard about it.
Boy, that cook was hilarious. And that's what it started. It started off with cooking. Remember, down with cooking.
Another Will Smith.
Will Smith has more to lose than one.
He'll be okay though. He'll be okay. Okay, yeah. Coach, she's not ahead of all one.
But she's not that funny. That's the other thing. I
We
mean,
have a Zoom account.
I do, yeah.
He wants you to sign in.
You want me to sign? Okay. Ooh, can I remember it?
Oh,
okay, cool.
Sorry.
so over there. Put some down and put it down. Keep your time very good.
Okay, so if you go in okay, you can go in okay. Down in the basement? Yeah, right down in the basement. It's like the door is, it's in front of an office building, you go down the steps. Is there anything else I'm doing? Besides signing in? Well, you'll have to get the meeting ID from when you come in. Oh, okay.
Did you talk to Brandon about what you're doing in terms of takedown?
Yeah, the video, she was like, yeah, cause you
Yeah.
guys have the
Yeah, I just wanna
original
make sure you spoke
testimony.
to him.
Yep, I sure did. I did exactly what you told me to do.
Yeah, I just made sure.
They were great.
Me
Oh, thank you. Oh, there's a meeting ID, that's right, that's what that's. Yeah, he has to give you the meeting ID. Okay.
Yeah.
Excuse me.
I'm with you.
Brad?
Yes.
I told the judge that, Charlie, just told me that I was wrong on the times, these next two depositions, just so you.
Sure?
They're short.
Okay, because I was like,
I know, I thought that too, I thought, how is this possible that we did that? No, it's 43 minutes for this next one and then 35 for the last one. Yeah. We did not.
I hear you.
Yeah, I don't want one time. You don't see that. Yeah, I'm waiting. I know.
I know, she doesn't want body fat.
Well, that's not- a lot more of the code.
Oh, right, oh, Sam.
Constant battle. I've now conditioned I was asleep with a cold machine. I keep my set at 68. Get two blankets.
Yeah.
And then you know, yeah, I was like, well, yeah, you get 2 million blankets. Yeah.
So,
Oh, that is.
Are they ready? Don't bring them in yet. Just make sure they're ready. You're good? All right, Mr. Johnson, you ready?
I am, Judge.
Ms. Arnold?
Yes, sir.
All right, let's bring the jurors in, please.
All right, judge. President.
Great. Everyone can be seated. Mr. Johnson, your next witness is?
Dr. Gaddafi.
All right, and this is another deposition.
It's shorter than the last one.
Okay. Oh, hold on one second. Can you log into Zoom? You did. Let me give you the meeting number. So you want to join a meeting. So here is the top one is the meeting number, and then the bottom 6 is the passcode. And I think it will show up there. You guys will have a bonus view of what's going on. This is the first time it's been using no video. Great. Yeah, no audio. It won't let you continue. Okay, so join with computer audio. That's fine. Yeah, you're not joining. Then you can maximize that. Excellent. Okay. Sorry about that. All right, we are ready for the deposition. please.
Doctor, would you please introduce yourself to the jury?
Yes, my name is Dr. Rishan Kadakia. I'm an orthopedic surgeon at Emory University with a focus in foot and ankle reconstruction.
So, Doctor, as I think you know, I represent your patient, Jame Daniels, who was involved in a collision with a MARTA bus back in March of 2020, and I'm here today to ask you some questions about your care and treatment of Ms. Daniels since that date. Okay?
Understood.
Would you please explain to the jury what your specialty is in a way that non-doctors might understand it?
Sure. So I have a focus, I'm an orthopedic surgeon, so I was trained in orthopedic surgery, which is the care of the musculoskeletal system, bones, tendons, ligaments. My focus is within the foot and ankle. So I handle all kind of problems or diseases or injuries that occur within the foot and the ankle.
And can you just talk us through a little bit about your educational background? And really, I think starting at medical school is fine, and then just working forward.
Sure. So I went to med school at Vanderbilt University. I did my orthopedic surgery residency here at Emory University, and then I went to Duke for a foot and ankle fellowship.
And are you board certified in any medical practice areas?
I'm board eligible. So we take our certification exam after you're in practice for a year. So I recently took it.
And are you properly licensed to practice medicine in the state of Georgia, and is your license on file with the proper authorities?
Yes.
So as part of your practice, have you had an occasion to treat Jame Daniels?
Yes.
When did you first see her?
I first saw her in clinic on March 30th, 2022.
And why was she there to see you?
She was referred to my clinic for post-traumatic subtalar arthritis.
Of what area of the body?
Of the foot. So she has arthritis of the foot.
And who referred her to you?
Dr. Tom Moore Jr.
And I want to show you a medical illustration that's behind you and have you take a quick look at it and ask you if that might be helpful in explaining to the jury the state of Ms. Daniels' ankle and right knee at the time she first came to see you in March of this year.
Yes, those are pictures of her injury and hardware when she saw me in March.
And do they appear to be an accurate illustration of her injuries as you saw them when you first treated her in March of this year?
Yes, the fractures that she has are healed. They're still visible on these images, but the hardware is there and the injuries are accurate.
Did you ever treat any area of Jame Daniels other than her right ankle and her right knee?
I have not, no.
Can you just use that illustration, especially the area that's the blow up of the right ankle, to explain to the jury what condition her ankle was in when she came in and you diagnosed the arthritis?
Sure. So this is a depiction of the foot and the ankle. The ankle joint is up here. This is the tibia, this is the talus bone, this is the fibula bone. These three bones comprise the ankle joint. Under the ankle joint itself is the subtalar joint. This is the talus bone. This is the calcaneus bone. This is the subtalar joint in between those two bones. And this is the joint where she had her arthritis.
And what kind of arthritis was that?
Post-traumatic.
And what is post-traumatic arthritis?
So arthritis can occur for a variety of reasons. They can be because of systemic issues, diseases, and in her case, the arthritis is secondary to the trauma she sustained.
What did Ms. Daniels tell you in that first visit about her ankle pain?
She said that the ankle pain was limiting, that she had pain with weight bearing, and it was impeding her daily functioning.
Did she mention swelling?
I don't recall specifically. It may be documented. I don't recall that interaction as well.
I have, Doctor, her note that I think you're looking at from that initial visit. There's a history of present illness section.
Yep, I see it.
And it looks like toward the last, second to last sentence, there's a reference there to swelling.
Yes.
Is that correct?
That is correct.
What does it say?
She states that her ankle swells after prolonged use.
So it was both pain and swelling that she was there to see you for?
Correct.
Okay. What was your assessment of her ankle after you examined her and listened to what she had to say? What did you think?
So she developed subtalar arthritis after the trauma she sustained to her calcaneus. Subtalar arthritis that was painful, causing her swelling and limiting her functioning.
Dr. Kadaki, before we continue, I'm going to ask that the exhibit behind you be removed for now, and we can bring it back if we need to talk about it.
Okay.
We were talking about the right ankle, and you were explaining about the arthritis. Tell me what you noted about her right knee and the plan section of your notes from that visit.
So she has post-traumatic arthritis of the knee as well, and she sees one of my partners, Dr. Sadlak, for this. The plan was to remove the hardware from her knee at the same time that she would have surgery with me to prevent the need for 2 surgical events, because she needs the hardware from her knee removed.
What is the difference, if any, between the post-traumatic arthritis in Ms. Daniels' knee and the post-traumatic arthritis in Ms. Daniels' ankle?
The location that they occur in.
Any other significant differences?
Not that I'm aware of, no.
Okay. So, at the end of that visit, what was the tentative plan going forward?
So the plan after the March 30th visit was to obtain a CT scan of her ankle and have her follow up after the CT scan.
All right. And did she follow up again?
Yes, she did.
It appears that she returned to your office on May 4th of 2022. Is that what your notes show?
That is correct.
So what did you review at that time, and what did you conclude from reviewing test results?
So she came back to clinic. We reviewed her CT scan, demonstrated that she does have post-traumatic arthritis of the subtalar joint and a healed calcaneus fracture. And so we reviewed the CT scan together with her.
And based on that, what did you ultimately decide was the best course of treatment for her?
So we discussed options, and the plan for her was a right subtalar arthrodesis or a subtalar fusion.
Is that the same thing as a right ankle fusion in lay terms?
No, so the ankle refers to a separate joint. So her problem was in the subtalar joint.
All right, and when we get to the surgery, I'm going to get you to help the jury understand a little bit more about that. But first, it looks like she returned one more time before the surgery to see you on June 15th of 2022?
Yes.
And was that a standard preoperative visit?
Yes.
Did you just clear her for surgery during that visit?
Yes, we discussed the surgery in a little more detail as to what it would entail. We were trying to work on scheduling a way to get her knee hardware removed at the same time as the surgery that I was performing, so that we wouldn't have to have her have 2 separate anesthesia events.
And again, what was the plan, as you understood it, for the right knee that involved you removing hardware at the same time you did the ankle surgery?
So my understanding is that ultimately she will need a knee replacement, and the hardware has to come out first, and you can't take the hardware out at the same time you do the knee replacement. Thus, I took the hardware out at the same time we did the foot surgery, so that ultimately she can get the knee replacement whenever she needs it.
And will you be the doctor that does that knee replacement?
No,
And who would that be?
Dr. Sadlak.
Okay. So the surgery then took place on June 22nd of 2022. Is that correct?
Yes, that is correct.
What was your preoperative diagnosis going into that surgery?
So she has right post-traumatic subtalar arthritis after a calcaneus fracture, and she has right post-traumatic knee arthritis with retained hardware.
All right. And what procedures did you perform during that surgery?
So I removed the hardware from her right foot from where she had her calcaneus fracture. I removed the hardware from her right knee, and I performed a right subtalar arthrodesis.
I'm looking at a surgical note that mentions a right calcaneal bone graft harvest.
Correct.
Is that part of one of these procedures?
That is part of the subtalar arthrodesis. So when you perform the fusion surgery, you take some bone from the heel and put it in the fusion site to get it to heal.
All right, let's talk about why you perform this type of surgery on a patient like Ms. Daniels who is complaining of pain from post-traumatic arthritis. Can you help the jury understand what the surgery is designed to accomplish and why it works?
Sure. So what happens when you have arthritis, especially in the subtalar joint, the cartilage between the two bones wears away and the two bones rub on each other. So anytime you have motion, you get a grinding sensation between those two bones that causes pain. That's kind of the general concept of arthritis and how arthritis pain works in any joints in the body. In certain joints, you can replace the joint, for example, in the knee, the hip, the ankle. However, in the subtalar joint, where she has pain, you cannot replace that joint. Thus, in order to eliminate the pain, you get those two bones that comprise the subtalar joint, the talus and the calcaneus, to fuse together or heal into one another, and thus they don't grind on each other anymore.
Can you use the model that you brought with you to help the jury understand where these bones are that you fused together?
Sure. So this is a model of the foot. This is the talus right here that I'm pointing to. This bone is the calcaneus, which is here. The subtalar joint, again, is between these two bones, which is right here. And so the idea is that there's some motion between these two bones, and when there's no cartilage and there's arthritis, that motion causes pain. So what you do is you get these two bones to heal to each other and become one bone, thus eliminating the motion and the pain.
All right. In addition to that procedure, you mentioned at the same time you removed hardware from Ms. Daniels' right knee. Can you explain to the jury what was in her right knee and what you needed to do to remove it?
Sure. So she had plates and screws in her right knee from a proximal tibia fracture that she had sustained, so a fracture at the knee. So I used the previous incision that she had that was used to fix that fracture to remove the hardware that was in there, ultimately that she would need removed if she got a knee replacement.
Where did the surgery take place?
Grady Memorial Hospital.
And did you consider the surgery to be a success both as to the ankle and the knee when you concluded the surgery that day?
We accomplished the goals of surgery at the time. Whether it's successful or not will depend on her recovery.
Okay. And was she released to go back to her home the same day as the surgery, or did she have to stay in the hospital?
I believe she went home the same day.
Doctor, can a patient like Ms. Daniels have a knee replacement surgery if she's going to have one? At the same time, she has an ankle surgery such as the one you performed.
It can be done, but it wouldn't be recommended.
And why is that?
From a rehabilitation perspective.
And what do we mean by that?
So after a total knee replacement, rehab is important. So getting up, moving with physical therapy, walking. After the surgery I performed, she's not going to be able to walk on this for 6 to 8 weeks.
Now, after she was discharged home following this surgery, did you see her again for a follow-up visit?
I did.
I think that was on July 6th of 2022. Is that what you show?
Yes.
How is she doing?
At that time, she was doing well. No fevers, chills. She reported pain to me to be a 5 out of 10. She'd been compliant with staying off of her foot. Her incisions all looked good when I saw her, and she had been healing fine.
Did you review any x-rays?
I do not obtain x-rays at the 2-week mark.
Okay. So after that, well, what was your plan for her when you saw her on July 6th of 2022 going forward? What did it look like ahead?
Right, so at that visit, her incisions had healed well, so her sutures came out, and then she went into a cast, and she stays in the cast for another 4 weeks.
Then what?
Then she comes back to clinic at 6 weeks after surgery. At that time, we get x-rays, ensure that the x-rays look appropriate. If the x-rays look good, she goes into a boot. She remains non-weight bearing or cannot walk on it for a total of 8 weeks.
And then after that?
At that point, she begins weight bearing in the boot and starts physical therapy.
How much physical therapy will she need?
I typically recommend 1 to 2 sessions per week for anywhere from 4 to 6 weeks. It depends on the patient and what they can do and how much they really need.
So did she return one more time after that on August the 3rd of this year?
Yes.
And was that her most recent visit with you?
Yes.
And how is she getting along on August 3rd?
She's progressing well. Continues to have some post-surgical pain. Her incisions looked good. Her x-rays that we obtained demonstrate that her hardware was in a good position. Everything looked appropriate post-operatively from an x-ray perspective. So she went into a boot at that time and is going to remain non-weight bearing, or she can't walk on this boot for another 2 weeks, which will get her to the 8-week mark, and then she starts walking in the boot.
Did you also review x-rays of her right knee at that visit?
Yes.
And tell the jury what you gleaned from the right knee x-rays.
Correct. So her right knee x-rays were reviewed. She has post-traumatic knee arthritis, and her lateral plate and screws were removed from the knee.
So she, as I understand it, will continue to follow up with you as you testified, as she continues to heal. Is that correct?
That is correct.
Now that her right ankle, those bones in her right ankle have been fused together, can you explain to the jury what effects, if any, that would have on her gait or her ability to walk?
So the fusion of those two bones limits inversion and eversion motions at that joint. So the ability to go side to side is limited. Functionally, that would be the motion that's limited. However, functionally, patients can still be quite active and do most activities without issues.
Doctor, do you have a medical opinion as to whether Ms. Daniels will regain the motion that you just testified was restricted by this surgery?
She will not gain back the motion she loses from the fusion.
Is she completely clear of any complications or failures that could arise from this ankle surgery at this time?
No.
Well, explain to the jury what could still happen and what you look for.
So infection after surgery would be unlikely after this time point, but it's not, it still could happen. The fusion surgery, the goal of it is to get those two bones to fuse or grow into one another. It's possible that they don't. It's too early to know. The hardware that I put in could break. Again, she's out of the window of when you would traditionally expect a patient to get a blood clot, but she could get a blood clot. Those are just some of the more common complications that could occur.
Is non-union a known complication of this type of surgery?
Yes.
How long will it be before you know whether that is an issue that will affect Ms. Daniels?
Non-union, typically you wait at least 6 to 9 months before you can determine that it's a non-union.
And tell the jury what a non-union is and what happens if 6 to 9 months out from a surgery, it turns out that a patient has a non-union.
Sure. So non-union is where the two bones that you tried to get to heal or get to grow into one another do not. So they do not unite. If she develops a non-union or a patient develops a non-union, frequently they need a revision surgery. Now we have to go back and try to do the fusion surgery again.
Doctor, was your treatment medically appropriate and necessary given Ms. Daniels' pain complaints, test results, and symptoms?
Yes.
That's all I have for now. Thank you.
Can you pause it for a second, please? So, jurors, I want to mention one thing you may have noticed I did, that there was a break in Dr. Kadakia's testimony, that it looked like the video had been edited, and it has. Depositions are adversarial in the sense that lawyers are free to object to questions that are asked, just like you've seen here in court. We litigate those outside your presence. So I either watch the video or I read the transcript and I rule on what the concern was. And so there may have been things that were litigated, and my ruling was such that we needed to jump over a few questions or a few minutes of the deposition. So please don't assume that one side has edited this and we're not seeing the whole deposition. You are not seeing the whole deposition because either there were parts we agreed weren't relevant, or there was a back and forth between the lawyers that they have to do in real time, right then when the question is asked to Dr. Kadakia, but I'm not there to rule. And so the way it would work is that the question would be asked, there's an objection, and then the poor doctor says, what am I supposed to do? And the lawyer said, go ahead and answer the question. And later on, the judge will decide whether the jury gets to hear your answer to that question and even get to hear the question. So that's true for all of these. I just happened to notice it here that there was clearly a leap from one time to the next, and that's only because we had worked through something outside your presence. Let's keep playing.
Hey, doctor, good afternoon.
Hi.
My name is Brandon Arnold. We've met before. When I took your deposition about 2 weeks ago, I represent MARTA, as you know, the defendant in this case. Dr. Kadeki, you'd agree with me that before recommending a course of treatment for a patient, it's important to understand how those injuries were caused.
What do you mean by that?
The cause of the injury itself that you are going to be treating.
Yes.
Okay. It's also important to get a history of any prior treatment that may be relevant to your assessment.
Yes.
And if you can speak with any prior treaters about their course of treatment for the patient, you'd agree it's good to do so.
Yes.
The first time you treated Ms. Daniels for her injuries was March 30th, 2022?
Yes.
And that was over 2 years after this accident occurred on March 2nd, 2020, correct?
I don't know the exact date of her accident, but I can look that up. I presume that's correct.
Okay. If that is correct, you saw her 2 years after the accident, correct?
Yes.
Okay. And you actually started practicing medicine in 2020, the same year as this accident, correct?
Correct.
Your surgery note that we looked at earlier states that Ms. Daniels sustained her injuries after a pedestrian versus auto accident. Do you recall that note in your surgery record?
Yes.
Okay, and that's based on what Ms. Daniels told you?
Yes.
Do you know whether that's actually what happened in this case?
No.
Ms. Daniels hasn't told you any other details about the accident itself?
No.
And she was referred to you by Dr. Moore?
Yes.
And Dr. Moore hasn't told you any details about the accident itself, correct?
No.
He also didn't tell you anything about the history of Miss Daniels' treatment with him over the 2 years prior to her coming to see you, correct?
No.
And you didn't ask for that information?
No.
You told me before that you would encourage and recommend physical therapy after the surgeries that Dr. Moore performed on Miss Daniels after this accident.
Yes.
Just like you would encourage and recommend physical therapy after the surgery that you performed on Miss Daniels last June, right?
Well, yes.
And you would agree that non-compliance with physical therapy can delay or impede a person's recovery?
Yes.
And that's because it's important to keep the joints active so they don't fuse up as they heal.
Yes, it's important functionally so they can be mobile.
So movement or mobility, whether that be through physical therapy or home exercises or any other kind of physical activity, is important.
Yes.
And that's something you recommend and stress for your patients within the confines of what they're allowed to do based on the surgeries that they've had.
Yes.
Dr. Kadekia, it's true that the only information you know about Ms. Daniels' conservative treatment over the 2 years before she came to see you is information that she told you.
Yes.
And that included the use of anti-inflammatories?
Yes.
And not walking on her leg as much?
Yes.
Okay. She didn't tell you about any other activity modifications?
Other than limiting her activities, no.
Okay. Didn't give you any specifics about that?
No.
Okay. And she didn't tell you whether she had been or was currently engaged in any physical therapy or home exercise program?
No.
The only surgery you performed on Ms. Daniels was June 22nd, 2022?
Yes.
Okay. And that was the ankle fusion and the hardware removal?
The subtalar fusion and the hardware removal, yes.
Yes. Thank you. All right, you personally have no plans to perform any knee surgery on Ms. Daniels, correct?
No.
Okay, and you have not assessed her or treated her for her knee, correct?
No.
Your limited involvement with the knee has been to remove the hardware so that your partner, Dr. Sadlak, can assess to determine whether she may need a knee replacement.
Yes.
Okay. Your treatment was limited to her right ankle and foot?
Yes.
Okay. So aside from the hardware removal, you're not going to be giving any opinions as to the injuries to her knee or any related treatment?
That is correct.
Okay. You also didn't treat her for any upper body injuries, correct?
Correct.
All right, so you have no opinions as to any injuries to her upper body or related treatment, correct?
Correct.
Okay, your opinions are limited to the treatment of the right ankle and the foot.
The subtalar joint in the foot, correct.
Dr. Kadekia, you do not perform functional capacity evaluations or FCEs, do you?
I do not.
An FCE is not something that you're familiar with or that you've learned how to do.
Correct.
You're also not familiar with impairment ratings based on the American Medical Association's guide to the evaluation of permanent impairment.
Correct.
Do you know whether Ms. Daniels is currently employed?
I do not.
You don't know if she's worked since the date of this accident, do you?
I do not.
And you don't know whether she's sought employment since the day of this accident?
I do not.
You told me in your first deposition that Ms. Daniels is not currently working because she's recovering from the surgery that you performed on June 22nd, 2022, correct?
Correct.
Okay. You also told me that you're not in a position currently to opine about her ability to work after she recovers from her surgery. Do you recall that?
Correct.
Okay. And I trust that's still your opinion today?
Yeah, she hasn't recovered from her surgery yet. So from my perspective, for the surgery that she's had with me, I can't clear her for work.
Okay. You cannot offer an opinion about her ability to work at this time?
Correct.
You told me at your deposition that you'd feel comfortable giving an opinion about her ability to go back to work in a sedentary or seated job 3 months post-surgery.
That would be in relation to what I took care of for her. So I can't comment on any other injuries or limitations she has outside of the realm of what I've managed.
Okay. So any such opinion will be limited to the foot?
Correct.
And as you said, you're not even in a position to give that opinion here today?
Correct.
Dr. Kadekia, Ms. Daniels' appointments with you are roughly 30 minutes,
About,
and she's able to sit through these visits with you?
yes,
You don't have any reason to doubt that she can sit for longer than 30 minutes at a time, do you?
no,
Are you aware of the multiple airplane trips that Ms. Daniels has taken since this accident?
no,
Are you aware of the multiple road trips that Ms. Daniels has taken since this accident?
no,
Are you aware of how much time she spends sitting in the car each day?
I am not,
Are you aware of any of her daily activities?
no,
You agreed with me at your prior deposition that it would certainly help to know what activities she's engaging in on a daily basis when giving an opinion about her ability to work.
yes,
Still agree with that?
yes,
That's information you would want to have before giving an opinion about her ability to work.
again, just from my surgical perspective,
Yes, limited to
the foot, correct,
but that's information you would want to have.
yes,
So we went through your visit notes with Mr. Johnson. You've now seen Ms. Daniels 6 times,
yes,
and on all 3 visits prior to your surgery, you performed a comprehensive foot and ankle exam,
yes,
and the results of that exam were identical for all 3 visits prior to the surgery, correct?
yes,
Okay. For each of those visits, you documented her gait as normal,
yes,
no standing deformity,
correct,
and that essentially means normal standing, right?
correct,
No forefoot deformity,
correct,
well-healed lateral incision,
yes,
normal neurological exam,
yes,
normal vascular exam.
yes,
Okay, and those were findings that were documented on all 3 of those comprehensive foot and ankle exams prior to her surgery.
yes,
In your reading of the x-rays that were taken on her first visit with you, was that her calcaneus fracture had completely healed?
yes,
And you discussed conservative treatment options with Ms. Daniels on more than one of her visits with you prior to surgery.
yes,
And conservative treatment is an alternative to surgery, correct?
correct,
And the options you discussed with her included injections,
yes,
bracing,
yes,
continued medications,
correct.
and anti-inflammatories.
Medications, anti-inflammatories, 1.
Any others?
No,
And Ms. Daniels told you she was not interested in pursuing any of those conservative measures.
she had tried some, they weren't working, and she wasn't interested in any other conservative care.
Okay. And again, you had not had any discussions with Dr. Moore or any of her prior treaters about what those conservative measures were?
No,
Okay. If the surgery is successful, Dr. Kadekia, Ms. Daniels shouldn't have any pain in the subtalar joint.
yes,
That's correct, she won't have pain.
correct, she will not have any pain, yes,
Okay. And the only motion that is gone as a result of the fusion is the inversion, eversion.
correct,
And can you show that to the jury with the model foot there of that particular motion?
so again, this is the talus, this is the calcaneus, this is the subtalar joint. Typically, there is inversion, eversion as such, and so that is the motion that will no longer be there.
Okay. So the rest of the motion is kept.
Yes,
All right, so she shouldn't have an issue pressing a gas pedal or moving her foot in that manner.
yes,
She would not have an
she
issue
will
with
not
that.
have an issue with that.
No issue walking on flat surfaces.
Correct,
Okay. Ms. Daniels has not yet started physical therapy?
correct,
Okay. Your plan for her to start physical therapy will be after she's weight bearing in the boot?
yes,
Okay. And that's for, did you say 4 to 6 weeks?
It's about 8 weeks, 8 weeks after surgery.
All right, and according to your August 3rd note, she will begin weight bearing in the boot in the next 2 weeks?
Yes,
Your note also says next week. Is it next week or the next 2 weeks?
2 weeks, so that's an error. It should be 2 weeks.
Okay, because it says she will remain non-weight bearing in the boot for another week and then begin weight bearing in the boot.
Yeah, that's an error. It should be 2 weeks.
Okay. Do you typically document non-compliance with physical therapy if you're made aware of it?
Yes.
So, as we noted, August 3rd, your last visit with Ms. Daniels, she was doing well and the incision had healed well and you had put her in the boot?
Correct.
You also instructed her to begin ankle range of motion exercises daily?
Yes.
What exercises does that include?
So that includes coming out of the boot a couple of times a day to work on moving the ankle around. So moving it up and down, side to side, just to make sure that the ankle doesn't get stiff.
Again, going back to the movement being an important part of recovery from a surgery?
Yes.
And there are documents provided to Ms. Daniels that illustrate those range of motion exercises?
I just go over them with her in the clinic and show her how to do them.
Okay. It also notes, will work on HEP, home exercise program, as given. And I assume that's given by you?
Correct.
Okay. And again, just discussed, no documentation?
Correct.
The note also states work on knee and ankle range of motion. Why is there reference to knee range of motion?
After surgery, any kind of surgery around the knee, it's important to work on range of motion. So now that her incisions have healed, I wanted to make sure that her knee didn't get too stiff.
Okay, so that's a result of the hardware removal.
Correct.
You note that physical therapy will start at the next visit, which appears to be in 4 weeks.
Correct.
And after she completes physical therapy, you recommend a home exercise program?
Correct.
And the purpose of both of those is to improve her gait and functioning with the fusion she now has.
Correct.
It also builds strength?
Correct.
Doctor, you told us at your deposition that you expect Ms. Daniels to be weight bearing in the boot by 8 weeks post-surgery.
Yes.
And that's still a goal?
That is still the goal.
Another goal is to get back in a normal shoe by 3 months post-surgery.
Yes.
And that's still a goal.
Yes.
Walking pain-free 3 months post-surgery is another goal for Ms. Daniels.
With regards to the foot, yes.
Another goal is the ability to run and engage in other high-impact activity 4 months post-surgery.
With regards to the foot, yes.
Okay. As far as future visits, your standard protocol is 6 weeks out, 12 weeks out, 6 months out, 1 year out, and then after that as needed?
I'll typically see my patients post-operatively every year.
And if she heals the subtalar fusion, you do not anticipate any further treatment or surgeries, correct?
With regards to the foot, no.
Okay. And we are now over 6 weeks out from the surgery, correct?
Correct.
Okay. Any indication that the fusion is not healing as it should?
No.
Right, you indicated earlier we're past the time, really, where she could have sustained an infection.
It would be highly unusual to see it this far out, but not. I've seen it happen before.
And highly unusual to see a blood clot 6 weeks after surgery.
Unusual, but again, I've seen it happen before.
Okay. No evidence or suggestion that that is happening here with her?
No.
No indication 6 weeks out at this point of a non-union?
No, it's too early to assess that at this point.
Okay. And you told us last time the rates of healing for the general population from this type of surgery are a pretty high percentage, correct?
Yes.
You told Mr. Johnson earlier you expect that she can functionally be quite active if all goes well with her recovery.
With regards to the foot and the subtalar fusion, yes.
Dr. Kadeki, you don't have an understanding as to what amounts have been billed for any of your treatment of Ms. Daniels to date, do you?
No.
Dr. Kadeki, you do not have access to My Chart, which is the patient portal through which patients can view their medical records with Grady, do you?
No.
Okay. Do you know whether this physical therapy evaluation marked as Exhibit 1 is accessible on My Chart?
I do not.
Do you know whether other documents can exist in the Grady records that may not be converted into My Chart?
I do not know.
Would a records custodian be a better person to ask about that?
I would think so.
Dr. Kadekia, how many discussions with Ms. Daniels' lawyer have you had since your last deposition 2 weeks ago?
None.
And prior to the first deposition, you had a phone call with Ms. Daniels' lawyer?
Yes.
Okay. All right. Dr. Kadekia, that may be all my questions. If you have anything else?
I do.
Okay, go ahead.
Doctor, would it affect any of the medical opinions you've given the jury here today that if it turned out that Miss Daniels was in an automobile when she had the collision with a MARTA bus rather than being a pedestrian? Is that significant to any medical opinions you've given?
No.
Would that change any of your medical opinions?
No.
Does it matter to you whether an injured person is injured in an automobile or as a pedestrian?
No.
Do you feel like you had all of the information you needed in order to treat Ms. Daniels?
Yes.
Did anything Ms. Arnold asked you during cross-examination cause you to change any of the opinions you gave this jury during your direct examination?
No.
Doctor, when you next see Ms. Daniels, what will you be looking for?
So she's coming back to see me on August 31st. At that point, I will see how she's doing with weight bearing in the boot. I'll assess her pain at that time, assess her motion. We'll obtain some x-rays to ensure that her arthritis or fusion site looks like it's healing appropriately.
Doctor, I appreciate it. Thank you, sir.
Thank you.
Just a couple follow-ups.
Okay.
Thanks. Dr. Kadekia, is it your goal for all your patients to have a complete recovery if possible?
Yes.
And the patients themselves must do their part to help that happen?
Yes.
And that includes being compliant with physical therapy and following the physician's instructions?
Yes.
And if Ms. Daniels does that, she will be walking pain-free 3 months post-surgery?
With regards to the foot, if the foot is all that is her issues.
Yes. Thank you.
Yes.
Doctor, forgive me. One more question. It sounded like you testified with certainty that if she's compliant with instruction, she will be pain-free as to the ankle in 3 months. Can you say that as a matter of certainty, or does it depend upon the healing?
So with regards to the subtalar joint, at 3 months, she should be walking in a shoe. There may still be some discomfort. It depends. Patients are all a little different, but my goal for all my patients is to be walking in a shoe functionally with pain improvement at 3 months.
Doctor, as you sit here today, can you or can you not state with any degree of certainty what her outcome will be at the end of her healing process?
I can't definitively say. She's 6 weeks, 7 weeks out from surgery at this time.
Thank you.
Thank you, doctor.
Thanks.
All right, ladies and gentlemen, we are 9 seconds away from high noon. There's one more deposition, but I have some things I need to take up right now based on some people who've walked into the courtroom. So we're going to have the lunch break now. You had an hour yesterday. Was there anyone for whom that was not enough time? You were still chewing when you got into court after the lunch break. You good with an hour? You want a little less than an hour? Stick with an hour? Okay. All right. Follow your lead. I was going to get insurrection here if we did it shorter than that. I'm going to ask you all to be back by 1. And we will resume one more deposition. Don't eat a heavy lunch because there's one more deposition. It's shorter than the one you just saw, but depositions have a greater tendency to lull jurors into that comfort zone, and you'll have just eaten. So maybe you should eat kale for lunch. No big greasy cheeseburger, or save that till after the deposition. But it does sound like we will still wrap up the plaintiff's case today. We'll see whether we get into the defense case. If there's a defense case, the defendant doesn't have a burden in this case, so they may not put up any witnesses. But we remain on track. We'll definitely get this case to you tomorrow for your deliberations to begin. During your lunch break, don't talk about the case. Talk about anything else you want. And we'll see you here at 1 o'clock. Any questions? Great. Thanks so much. All right, you all can be seated. Mr. Johnson, anything before lunch break?
No, Judge.
Before you leave the courtroom, and you are all going to need to leave in just a moment because of what I need to take up, if you would get the exhibits that you put up on the witness stand with Ms. Lundy and work with Ms. Brown as to, don't do it yet because we're still talking, but work with Ms. Brown as to whether she wants you to hold on to them until they go out with the jury or what. I just don't want there to be a mad scramble after closings are done and people don't know where the exhibits are. I think to date, we only have 2 exhibits that are in, but I'll let you sort that out with Ms. Arnold and Ms. Brown.
I do have a question about this.
Yes.
When Ms. Daniels gives her direct, she's going to be commenting upon a number of videos of herself.
Mhm.
These are all videos that the court is aware of and is permitted. Unlike photos, I can't show her in advance, I don't think, the video and have her sit there and watch the whole video and then say, yes, that is me in the video and I recognize that. Given that everyone knows what these are and that Ms. Daniels will testify that it is her in the videos, can I just show them in real time during the direct, or would you like me to do it some other way?
So there's something that you'll be tendering into the record. It may be a DVD, it may be a thumb drive, so that those videos become part of the record, not just playing them. Whatever that is what you ought to use. I'm not going to tell you how to get it admitted, but there is a method to get videos in that doesn't involve us playing it for the witness once, and the witness can say, oh, yep, that's me, and I've watched that. So I'm gonna let you sort through that, but you need to have something physical, tangible, that would be part of the record so that the jurors, for example, could say, hey, plaintiff's exhibit 5, I wanna play that again, and they'd be able to hold it up and say, that's what we wanna play. So I'll let you work through what that physical item is and the methodology by which you would get that admitted. You can have all the videos on there. That's fine. You can have it be plaintiff's exhibit, pick your number, and then on it could be whatever numbers we had for the videos. But you'll need to do that gatekeeping unless you and Ms. Arnold come up with a different approach. There can be stipulations. I'll let you guys talk about that during lunch. But unless Ms. Arnold agrees, it won't work simply to say, I want to show you this video now. In part because you haven't tendered anything, and so Ms. Brown doesn't have a record to complete and transmit should there need to be a record transmitted to a higher court.
Thank you.
You're welcome. Anything else?
No.
All right, Ms. Arnold, anything?
Yes, sir.
All right. Then we'll see you guys a little before 1 o'clock.
You have to leave the court.
You do.
Do we need it first?
You don't.
Clear the table.
No. May I take your phones with you, but just leave your stuff. You're going to come back and you will be in a trial-ready posture. All right, I think it's working. You ready?
Yes.
Mr. Johnson, are you ready with your next and I think final deposition? Okay. Anything else from the plaintiff side?
No, Your Honor.
All right, Ms. Arnold, anything from the defense side? Great. Then let's bring the jurors in and we'll tee it up.
All right, for the jury. Present.
Thank you, Deputy Gordon. You all can be seated. Welcome back, ladies and gentlemen. Thank you for being on time. We're starting a little bit later because I got behind because of what I had to deal with at lunch, but that has been dealt with, and we are going to continue anew with the plaintiff's case. Who is our next doctor? I think we've got one more.
This is it.
This is it. Drum roll.
You call Dr. Sadlack.
Dr. Sadlack. All right.
Doctor, would you please introduce yourself to the jury?
My name is Christopher Sadlack
And where do you work, sir?
at Grady Hospital.
Doctor, as you know, I represent Jame Daniels in this case, stemming from a crash with a MARTA bus that occurred back on March 2nd of 2020. And I'm going to ask you some questions about your encounters with Ms. Daniels and your plans for her future treatment, okay?
Okay.
Can you tell the jury what kind of medicine you practice and where you work and what your practice involves?
I'm an orthopedic surgeon at Grady Hospital. So I do a combination of broken bones and joint replacements in the hip and the knee.
Where did you go to where did you go to medical school, doctor?
George Washington University.
And are you board certified in any medical practice areas?
Yes, in orthopedic surgery.
Are you properly licensed to practice medicine in Georgia, and is your license on file with the proper authorities?
Yes.
And as part of your practice at Grady Hospital as an orthopedic doctor, have you had an occasion to see Ms. Daniels in your practice?
Yes.
When did you first see her?
Let me pull that up. I believe it was March, but let me pull the note up. That was March 30th, 2022.
And why was she in your office to be seen by you that day?
For knee pain, right knee pain.
Had she found you on her own, or had she been referred to you?
She was referred to me by Dr. Moore.
And was Dr. Moore the prior surgeon on her knee?
Yes.
What was the condition of Miss Daniels' knee when you saw her then on March 30th of 2022?
She had a painful knee, and it looked like she had developed some post-traumatic arthritis.
What had been done to Miss Daniels' knee prior to her seeing you?
She had a tibial plateau fracture that they had treated with basically putting the pieces back together and holding it together with plates and screws.
After she had the surgery to put her knee back together, did she have any other treatment to try to control her subsequent knee pain?
I believe so. She believes she had therapy and injections in her knee.
And by the time she came to see you in March of this year, how was she describing her pain in her knee?
Let me pull it up, the note. Basically, she was saying continued right knee pain based on the outside of the knee. She described it as achy and sharp and worse with weight bearing.
Dr. Moore has testified in this case that Miss Daniels has a valgus right knee. Can you tell the jury what that means?
Basically, it might be if you had like a straight line from your, essentially you're in the midline of your body. If you go to the knee joint, then like the lower leg and foot might point away from the midline, so it's more out.
And I may have used the wrong term, because Dr. Moore also used the term knock knee.
Yeah, that's similar. So it would be almost like your knees point towards the midline and your lower leg and your foot would be more towards away from the midline.
And what causes that?
There's a lot of different reasons, but I mean, some people develop arthritis. Basically, your knee, you have 3 compartments in your knee, usually what they describe: the medial compartment, which is the inside of the knee, the lateral compartment, the outside of the knee, and the patellofemoral compartment. Sometimes if you get more wear on one side of the knee as opposed to the other, that can cause you to have the knee bend either towards the midline or away from the midline. So if you have more wear on your lateral compartment of the knee, then the foot and everything will point more towards away from the midline, and your knees would become more knock-kneed.
What had caused the pain issues in Miss Daniels' right knee that she was there to see you for?
When she saw me, she had developed post-traumatic arthritis, and that's most likely what caused her knee pain.
Post-traumatic arthritis from what?
She developed that after her injury.
Did you come up with a plan when you met with her about how to try to lessen her chronic knee pain?
We did. We went over our options and we discussed knee replacement.
And what is your plan going forward for Ms. Daniels?
We will perform a knee replacement.
Are there other options that you considered? And if so, why is knee replacement the option that you recommended?
Other options would be therapy, over-the-counter medications, injections. She had tried those, and so really right now, feel the best chance of giving her long-term pain relief would be the knee replacement.
What would become of the traumatic arthritis in Ms. Daniels' right knee if she didn't have a knee replacement?
Potentially, it would get worse for her.
Now, can you explain to us exactly what we mean by a right knee replacement and tell the jury how you accomplish that? Can you just take us through it as though we're non-doctors?
Basically, for a knee replacement, what you do is you make an incision over the front of the knee. You do the way we do it is a medial peripatellar arthrotomy, where you kind of cut this tissue around the inside of the knee, and then you cut the ends of the bone, take off a small amount of the ends of the bone on the thigh bone, and you place a metal cap onto that. And then the leg bone, the tibia, you make a cut on the top of that and place what they call a tray, a metal tray in there. And then in between the two metal pieces, you have essentially a plastic liner, and that takes the place of the damaged cartilage and bone.
Are there risks associated with this type of knee replacement surgery?
There's risks with knee replacement. I mean, there's risks of infection. There's risks of continued pain. There's risks of blood clots. There's risks of bone breaking, putting it in. There's risks of stiffness. Those are the main risks.
Do you have an opinion or knowledge as to what percentage of patients who have a knee replacement like you're describing are not completely satisfied at the end of the process?
I mean, there's some reports that say up to 20% of patients are not completely satisfied after a knee replacement.
And what are the range in your experience of outcomes that leave those patients unsatisfied with the procedure? What do you see when patients are unsatisfied?
What I've seen is patients say they might have just a little bit of pain at different times. If patients are stiff, they're not happy with their knee. They get infected. That's a very bad experience, and no one wants to go through that. So
now, after you perform a right knee replacement, what kind of care and treatment would Ms. Daniels be looking at after the surgery?
after the surgery, here she'd likely be in the hospital a day or two. She would need to work with therapy. We recommend 2 to 3 times a week for 12 weeks. She'd also have to be moving the leg on her own. And then to fully recover from a knee replacement generally takes about 6 months to a year, but we'd want her getting up on it right away and walking. She'd initially use a walker and then go to a cane and then progress from there.
Doctor, let me ask you this. Is there, in your experience, pain involved in the recovery process from a right knee replacement like you've described?
Anytime you have operation and a bigger operation like a knee replacement, there is pain. We place them on post-operative pain medicine, and generally, like I said, to fully recover takes about 6 months to a year to get back to normal.
Doctor, are you familiar with the physical therapy rehabilitation protocol that Ms. Daniels would go through after this?
Yeah, like I said, we'd have her in formal physical therapy, ideally at least 12 weeks, 2 to 3 times a week.
And what would that involve? Can you help us understand what somebody who's just had a total right knee replacement is going to be facing in terms of physical therapy?
Yeah, they take her to work on range of motion, like bending and straightening her knee, and then working on strengthening of her leg.
After the 6 months to a year, assuming no significant complications, would Miss Daniels at that point be as good as she's going to be on that knee?
I mean, usually tell people about 6 months to a year, but everyone's different, and sometimes patients can make improvements up to 2 years.
Do artificial knees like the one you're talking about here for Miss Daniels last a lifetime?
No, they don't.
How long does an artificial knee such as the one that you're talking about for Miss Daniels typically last?
I'd say potentially around 20 years.
So if Miss Daniels is in her 40s now, you would expect it to last until she was in her 60s?
I think that's reasonable to say that, yes.
Let me ask the question again. You've testified that these knee replacements typically last about 20 years. Assuming that that's the case with Miss Daniels, what is she facing then in her 60s when that occurs, if that occurs?
Potentially she would need a revision at that time, and it really depends on the wear. If the metal components are stable, potentially might just need the liner that goes in between them exchanged. If the metal components are loose at all, then she might need it completely redone.
After that procedure, what kind of recovery would she be looking at, and what would she need to do after that surgery?
She would need therapy again. Again, we'd give formal therapy. We like to do 12 weeks, and she can do it on her own as well, but it'll just be more therapy again.
And would you expect the recovery period to be the same for a subsequent knee replacement as for the original 6 to 12 months as you testified to?
Yeah, it would be similar, yes.
Dr. Kadakia, do you know Dr. Kadakia?
Yes.
He has testified that at the same time he performed an ankle operation on Miss Daniels, he removed metal hardware from Miss Daniels' right knee. Are you familiar with that?
Yes.
And why did Dr. Kadakia remove the hardware from Miss Daniels' right knee?
We discussed the treatment, and since she was going to undergo her ankle procedure first, and it thought it would be best to take out the hardware to make her subsequent knee replacement easier to do later down the road instead of doing it all at the same time. So since she was going to be in the operating room with Dr. Kadakia, since he was comfortable and more than competent to remove the hardware, he could do it at the same time to save her an extra trip to the operating room.
If Miss Daniels was not going to have the right knee replacement, would there have been any reason for Dr. Kadakia to remove the metal hardware in her right knee?
Not at that time. We wouldn't remove it as long as it wasn't bothering her. There's no sign of infection. We'd leave it alone.
And would it have been permanent, absent a problem?
Yes.
So can you tell the jury why you can't go ahead right now and schedule Miss Daniels for her right knee replacement? Why can't she do it, in a week?
Our thought is to let her heal up from her ankle procedure and get to the point where she can bear full weight on that leg and have a strong leg to stand on as far as from her ankle standpoint. So she wouldn't be dealing with two problems at the same time.
If she had not yet fully recovered from her right ankle surgery by the time you did your surgery, how would that affect her rehabilitation?
We were concerned if she wasn't able to bear full weight on her leg, then she wouldn't be able to fully participate in therapy for the knee replacement.
Have you seen Ms. Daniels since that first visit that you told us about on March 30th?
Just briefly, Dr. Kadakia and I have clinic on the same day, and so I saw her once, just briefly, when I happened to be walking by her room as she was there for a post-operative visit with Dr. Kadakia.
And as we sit here today and you testify, is your plan for Ms. Daniels the same plan as you outlined following her initial visit to you in March? That is to have the right knee replacement?
Yeah, that's the plan right now, yes.
Was your treatment and your plan for her future care and the future care you testified about medically appropriate and necessary given Ms. Daniels' pain complaints, test results, and symptoms?
Yes, I think it's a reasonable plan, yes.
Thank you. That's all I have.
Okay, good morning, doctor.
Good morning.
Doctor, the first time you treated Ms. Daniels for her injuries was March 30th of 2022?
Correct.
Okay, that's over 2 years after this accident, which occurred in March of 2020, correct?
Yes.
All right, and March 30th, 2022 is the only visit you've had with her in your clinic, correct?
Yes.
You don't have any current appointments with her scheduled?
No, I don't. She is going to see me once she heals up with Dr. Kadakia, and then he's going to get her set up with me.
And there is no knee replacement surgery scheduled yet, correct?
No, it's not on the schedule yet.
Dr. Sadlak, you would encourage and recommend physical therapy for someone recovering from surgeries such as those Ms. Daniels had immediately after this accident, correct?
Yes, we recommend therapy, definitely, yes.
Okay. Just like you would encourage and recommend physical therapy after the knee surgery that you plan to perform on Ms. Daniels in the future.
Yes.
And you would agree that non-compliance with physical therapy can delay or impede a person's recovery.
It can definitely delay and impede strength and range of motion, yes.
That's because it's important to keep the joints active so they don't fuse up as they heal, correct?
Yes.
So movement, whether that be through physical therapy or home exercises or any other kind of physical activity, is important, right?
Yes, I agree.
Okay. And that's something you recommend and stress for your patients?
Yes.
So physical therapy after Ms. Daniels' original knee surgery would have been important to help strengthen the muscles around the knee and keep her knee moving, right?
Correct.
Okay. Just like it will be important after the knee surgery that you intend to perform, correct?
Yes.
Okay. And that's regardless of any arthritis that may exist in her knee.
It's important to do therapy, yes. Sometimes if it's, depending on how significant the arthritis is, I could limit it, but it's very important to do therapy.
Right. It's still important to gain back that strength and range of motion, right?
Yes.
Dr. Sadlak, you do not perform functional capacity evaluations, correct?
No, I don't.
Okay. You also do not perform impairment ratings, correct?
No, I don't.
However, you have seen impairment ratings before, correct?
Yes.
Okay. And all of the impairment ratings that you have seen have been performed by a doctor trained in impairment ratings, correct?
Yes.
Okay. You have never seen an impairment rating prepared by someone other than a doctor, correct?
Correct.
Okay. And you are not aware that Ms. Daniels attorney in this case hired a professional expert who is not a doctor to perform both an impairment rating and a functional capacity evaluation.
Yeah, I'm not aware of that.
Okay. You told us at your last deposition that that would be something you'd be curious to see. Do you remember that?
Yes,
Okay. And as we sit here today, taking your testimony for trial, that has not been provided to you by Ms. Daniels or her lawyers.
I have not seen that.
Dr. Sadlak, you don't know whether Ms. Daniels is currently employed, correct?
No, I don't.
Okay. You don't know if she's worked since the date of this accident,
No, I don't.
and you don't know whether she has sought or looked for employment since the date of this accident.
No, I don't know that.
You have not discussed employment with her.
No, I have not.
Okay. And you don't know what her ability to work is at this point.
No, I don't.
Okay. And that's primarily because she hasn't yet had this knee replacement surgery that you think will eliminate the pain in her knee.
I think that'll give her the best chance, yes.
Okay. Do you expect that this knee surgery will help eliminate any discomfort Ms. Daniels has when sitting?
I think as far as the knee, it should help her, yes.
Okay. And would you also expect from her recent fusion surgery to help alleviate any discomfort she may have when sitting?
Yes,
When you saw Ms. Daniels in clinic, she was sitting, correct?
correct.
You don't have any reason to doubt that she can sit for longer than 30 minutes at a time.
Yeah, from my opinion, I don't see that as a problem, no.
Okay. Are you aware of the multiple airplane trips that Ms. Daniels has taken since this accident?
No,
Are you aware of the multiple road trips that Ms. Daniels has taken since this accident?
no,
Are you aware of how much time she spends sitting in her car each day?
no,
Are you aware of any of her daily activities?
no,
And you agreed with me before that you would want to know what type of activities she's engaging in on a daily basis before giving any opinion about her ability to work.
yes,
Okay, that's information you would want to have before giving such an opinion, correct?
yes,
Dr. Sadlight, your treatment has been limited to Ms. Daniels' knee, correct?
correct,
You did not treat her for any upper body injuries, correct?
correct,
Okay, so you have no opinions as to any injuries to her upper body or related treatment, correct?
correct.
You're aware that Ms. Daniels does not have a primary care physician or a PCP.
I believe you said that last time, yes.
Okay. And last time you told us that it's a good idea for everyone to have a PCP for basic maintenance of health and preventative medicine, right?
Correct,
And Ms. Daniels is in her mid-40s, right?
yes,
We know that she is obese, right?
yes.
And we know that she's got high blood pressure, right?
I believe so, yes.
You'd agree, Dr. Sadlight, that weight loss can improve joint pain.
Yes,
And you don't know whether that is a conservative option that Ms. Daniels tried before coming to see you.
I don't know that, no.
And you also agree that obesity is a risk factor for surgery?
Obesity, depending on how obese you are, morbidly obese patients are higher risk, yes.
You discussed this with Ms. Daniels?
I did not discuss it at that visit, no.
Okay. You plan to have that discussion with her before proceeding with surgery?
Yes, we talked, I try to go over everything with patients before their operations, yes.
Dr. Sadlight, you testified before that Ms. Daniels' injury either caused or accelerated pre-existing arthritis. Do you recall that testimony?
Yes,
But without seeing x-rays, you can't say whether Ms. Daniels had arthritis before this accident.
right. I would have to see x-rays of her knee before the accident to see what type of, how much arthritis she had before the accident. Without seeing her x-rays before, I would not be able to comment on that.
And you talked to us earlier about the plan to proceed with the ankle fusion surgery first before the knee surgery, correct?
Correct,
And that's because your goal is for her to bear weight through the ankle before undergoing the knee surgery, right?
yes,
And that way, after the knee replacement, she can put weight on her ankle in her leg right away.
Correct.
Okay. And immediately start working with therapy, bending the knee and straightening it.
Correct. Yes.
And as for now, you've encouraged her to do physical therapy as tolerated.
Yes.
And she should be starting physical therapy soon for her ankle and her foot, right?
She should, yes.
And when you saw Miss Daniels earlier this month, she appeared to be doing well after her ankle fusion, right?
I mean, we briefly just talked. She looked reasonable, yes.
Okay. The goal of the knee replacement surgery, Dr. Sadlak, is to alleviate pain and give Miss Daniels good motion in her knee.
Yes.
Okay. So there's no, with this surgery, limitation on range of motion or movement in the knee as a result.
Yeah. After a knee replacement, she can move it as much as she wants.
Okay. You mentioned that Miss Daniels has a valgus knee, which means she looks a little knock-kneed. But without seeing x-rays, you can't be sure whether she had this condition before the accident.
Correct.
Okay. You also told us that the valgus knee should not complicate the knee replacement or her recovery, correct?
Correct.
All right. Ms. Daniels doesn't have any increased risk compared to a standard knee replacement.
No, I think a knee replacement, she's not going to have any major increased risk, no.
And that's because she doesn't have a huge deformity as a result of the valgus knee, right?
Correct.
Okay. And the surgery will actually fix the valgus alignment.
Potentially, yes.
Okay. And you've told us before that the condition of her knee is all fixable with a knee replacement.
I think, yes, the knee replacement is our best shot to make that, give her a more functional, less painful knee.
So at this point, you expect Ms. Daniels will be back to see you after her fusion is healed and she's able to walk with minimal pain in the ankle?
Yes.
And we talked about the physical therapy that you will recommend after this potential knee surgery, correct?
Yes.
All right. And that physical therapy is important to get range of motion back in the knee post-surgery, right?
Correct.
And to build up strength in the knee.
Correct.
And you'd also expect her to be doing home exercises and strengthening on her own, both during and after therapy, right?
Yes.
Okay. Assuming she complies with the recommended physical therapy, you told us you expect it to take 6 to 12 months to get back to normal.
Yes.
Okay, and that means giving her a knee that she can walk on pain-free?
That's the goal, yes, pain-free. Unfortunately, in medicine, you can't guarantee everything.
Right, but at this time, you have no reason to believe this goal can't be achieved for Ms. Daniels.
Correct.
And that would include walking in normal shoes again?
Yes.
Maybe even wearing
depends,
heels.
I guess, on the ankle. We'd have to ask Dr. Kadaki about the foot, but she should be able to wear comfortable shoes, yes.
Maybe even high heels.
I'd have to discuss that with Dr. Kadakia, but from a knee standpoint, there shouldn't be any limitation to wearing high heels.
You'd agree that you're essentially taking the pain generator away, as Dr. Moore put it, by doing this surgery.
Yes.
Okay, and that's because you're taking away the part of the knee that's causing her problems
Correct.
and replacing it with the artificial knee that we discussed earlier.
Yes.
Dr. Sadlak, we talked last time about costs and why you may not know exactly how much a knee surgery will cost to somewhere between 12 and 40,000 sound accurate.
Yes.
Okay. You mentioned that she should be able to get 20 years or so out of this knee replacement, correct?
Yes.
Okay, and she'd be a candidate for revision at that time because of her age and the fact that knee replacements do not last forever, right?
Correct.
Okay, and you'd agree that most people get better after knee replacement surgery?
Yes, the majority of people do get better after knee replacement surgery.
Okay, you mentioned the 20%, but the majority of the patients are satisfied.
Yeah, the majority are. I mean, like I said, there's some that are not completely satisfied, yes.
Okay, and at this point, you don't have any reason to think Ms. Daniels won't be satisfied with her knee replacement.
I think it would help her, yes, and I think she would be satisfied with it.
Okay, doctor. That's all my questions. Thank you very much.
Thank you.
Doctor, let me go back to the issue of arthritis and ask you some questions, okay?
Okay.
You testified that when you saw her, that the cause of her pain, as I understood you, was traumatic arthritis. Is that correct?
Correct.
What's the difference in traumatic arthritis and, let's say, if somebody just had some chronic arthritis in their knee? What's the difference there?
Osteoarthritis, when we talk about that, it's usually wear and tear on the joints over time. I mean, it comes with age, genetic predisposition, etc. Whereas post-traumatic osteoarthritis is more likely came secondary to an injury to the joint, and after the injury, they developed arthritis after that.
Is it the injury itself, that is the moment that her knee shattered, that causes the traumatic arthritis, or is it the result of having the surgery to reconstruct the knee, or is it a combination of both?
Okay, I'd say it's a combination, but the initial injury with the type of injury she had, I mean, she damages the articular cartilage, which is the cartilage we have on the end of our bones, which helps provide that nice smooth gliding motion, but you will have damage to that cartilage with the injury, and potentially that can lead to arthritis later down the road.
Let me ask this again to make sure we're clear for the record. After the impact on Ms. Daniels' knee and the collision that we're talking about, what is it about the injured knee that causes the onset of traumatic arthritis?
The damage to the articular cartilage in the knee.
And what exactly are we talking about with traumatic arthritis? Can you just help us understand exactly what that is?
I mean, it's basically arthritis in the joint after an injury.
And what is arthritis?
It's damage to the articular cartilage, which is the end of the cartilage we have on the end of our bones. Kind of like the end of a chicken leg, you know, that smooth, shiny part you see at the end.
Mm-hmm.
That's what we have on the ends of our bones. And when there's damage to that, that's basically what osteoarthritis or arthritis is.
Thank you, doctor.
Yes, sir.
Andrew, just one follow-up regarding the arthritis. If all goes well and once healed after the knee surgery, it shouldn't be causing pain to the knee, correct?
Correct. She shouldn't have pain in the knee after, if everything goes well with her operation and she recovers from that. Yes.
Thank you, doctor.
Thank you, doctor.
Thank you.
That's it for the depositions?
Yes.
All right. Thank you for having those ready to go. Your next witness is?
Well, my next witness will be Ms. Daniels. I'd like to tender a couple of exhibits at this time.
Okay.
I'd like to first tender P35, which is the medical illustration that doctors use during their depositions.
You give me the whole list and then we'll see if there are any objections, unless it's a really long
It's
list.
just three.
Let's
The
keep
others
going.
are P41 and P42, which are the mortality tables under the code section.
Okay. MARTA, any objection to P35, the demonstrative that we saw in several of those depositions?
We just object to when they go back to the jury.
Okay. It's being made part of the record. We can discuss later whether that's something that goes out with the jury. Okay. So P35 is admitted right now as a demonstrative exhibit. And then you said P41 and 42 are the mortality tables?
Yes, under OCGA Title 24, Appendix R2 and 3, I've got copies.
Okay. And those are the mortality tables? Are
From the code.
okay.
Yes, sir.
Any objection, Ms. Arnold, to the admission of P41 or P42?
I think same objection, Your Honor, that we would have them around jury.
Hold on. My understanding from some of the jury charges we're going to discuss, they're actually tools that jurors can use in determining life expectancy. So we'll talk about this during our jury charge. I will admit 41 and 42, so they're at a minimum part of the record. Whether they go any further than that, we'll see. You guys will be educating me on the proper use of mortality tables, but I noticed it last night in some of the jury charges that was mentioned, and I was wondering when they were coming in, and the answer is right now they're coming in, and we'll work through that during the charge conference. Okay. Anything else, Mr. Johnson?
Not at this time.
Okay. Ms. Daniels, if you would please come on up to the witness stand. If you want to, I can have the deputy bring it to you. You can have your water up there if that would help. Okay, he'll get it to you once you get situated.
Raise your right hand. You swear or affirm that the testimony you will give will be true.
Yes.
Go ahead. State your name for the record.
Jame Daniels, JAME'(DANIELS).
So, Ms. Daniels, you'll be testifying for a while, I suspect. You're going to need to speak up a little bit. So if you need someone to help you move the chair closer, we can do that. Maybe Mr. Johnson can help with that. But it's going to be important, just like with all the other witnesses, that we hear what you have to say.
You good? You sure?
You ready, Judge?
If you are.
Ms. Daniels, before we begin your substantive testimony, I'm going to hand you a stack of exhibits for you to review, so we can talk about it briefly. Exhibits P6, P9, P12, P13, P14, P15, and then I'm going to also hand you a thumb drive. Can you review these exhibits and tell us what they are?
Screenshots of videos.
Can you speak a little louder for me?
Screenshots of videos.
And have you seen the entire video of each of those exhibits?
Yes.
And do they depict matters that you are familiar with and that are relevant to this case?
Yes.
Are they an accurate portrayal as you recall the events?
Yes.
And to your knowledge, have they all been put in their entirety on that thumb drive?
To my knowledge, yes.
Judge, I tender these exhibits by way of a single thumb drive in evidence.
Okay, that thumb drive you're calling what?
We will call that plaintiff's exhibit T for thumb drive.
PT. All right. There you go. PT. And that is something that Ms. Daniels has testified she's reviewed the contents of, which are some other Ps that you'll be publishing by exhibit number.
We'll have some photos.
Okay. So
but I wanted to go ahead and tender these so that we could play them without any further delay as we go along the direct examination.
So I want the record to be clear. PT, the thumb drive, has both videos and still images, or just videos?
Just those videos with those exhibit numbers.
Okay, and remind me what exhibit numbers are on PT.
Yes. I get it wrong. P15, P14, P13, P12, P9, and P6.
All right, so that's 6 videos, all contained on PT. PT goes into evidence, and then you'll be publishing those 6 as you go along.
That's my intention. Yes, Your Honor.
All right, Ms. Arnold or Ms. Page, any objection to the admission of PT, subject to discussions we've already had and concerns that you've preserved on the record outside the presence of the jury?
We're just checking those numbers, Your Honor, but I don't think so.
Okay, why don't we, I'll admit PT. If you conclude that there's a new number on there, let me know. I didn't keep track of the number of videos. It doesn't sound like we've gone beyond the universe. I suspect that's exactly the universe, but let me know if you disagree. When you're ready, Mr. Johnson.
Thank you, Judge. Ms. Daniels. Hard to know where to start, but let's just start with this. How old are
45.
you? And where have you lived between about 2010 to about 2020?
In Atlanta, with some parts in Texas for a few months.
Sure, we'll talk about that. How long have you lived in Atlanta?
It'll be 19 years in December.
And do you have any family?
Yes.
I think they know that. Tell us about your family.
Well, I have 3 children. My 21-year-old daughter, Imani, my soon-to-be 20-year-old son, Jamari, and my just turned 18 daughter, Zaria.
Where are you living right now?
Currently with my mom.
And where are your children living?
My youngest, Zaria, is with me at my mom's house, being that we are vaccinated. And my 2 oldest are still at my apartment.
I want to start by talking about your life before the crash, okay? Pre-crash life. Can you, and let's break this up into categories. So let's talk about family life, okay? Can you just tell us what your family life was like for a couple of years leading up to this crash? What was your involvement in your children's lives? What were they doing? What were you doing to help them?
Well, I'm a single parent, so I was highly active in my children's lives. My son was athletic, so we were constantly involved with sports. My oldest, she's worked and been in school since she was 16. And my youngest just goes to school. So it was just my life revolved around them. Whatever they wanted to do, we did it. Wherever they wanted to go, I would take them. Outside of that, other than that, we were always at some school because my son had a game.
What were your, well, let me ask you this. What did you like to do for fun outside of looking after your kids?
I mean, I would go out. I have friends, but my life was my children. I would go out if there was a family member or a close friend who had a birthday, if I really liked them like that. But other than that, it was just going, anything that involved my kids.
When you got away from the kids with your friends, what did you like to do?
Movies. We'll go hang out at lounges. That's pretty much it, or hang out at each other's houses.
Let me show you what the marker is in the P32 and ask you to review that and let me know if you know what that is.
Yes.
And tell us what that is.
It's pictures of me prior to the accident.
And how many pictures are on exhibit P32?
4.
All right. Do they accurately depict the way you look back then?
Yes.
Judge, I tender P32 into evidence.
Any objection to P32?
There.
It's admitted.
And if we can put that on the screen, please. Ms. Davis, from where you're sitting, can you see any of the screens that show this exhibit? Oh, you've got a screen in front of you.
Yes.
Right. And you can see P32 on it?
Yes.
Let's go from left to right. Can you tell us for each of those pictures where you were, if you know, and what you were doing and how you were feeling about that?
Well, the first two were taken at my mom's house. The first one, I was headed to go hang out with my cousin. The second one was I was headed to go my cousin's birthday at a lounge. The third one, I was at, at the time, I believe it was State Farm Arena to see Kevin Hart. And the last one was the last time that I celebrated a birthday, dressed up out at a lounge.
What is your birthday?
It's August 1st.
So that picture of you in the blue dress is August 1st, 2019.
18.
This collision happened on March 2nd of 2020.
Correct.
So you went out for your birthday on March of 2018?
That was August.
Forgive me, August of 2018?
Yes.
Have you ever worn any of these clothes since March 2nd, 2020?
No.
Did you have any physical problems or issues before this collision?
Not anything major that would hold me down.
What minor issues did you have?
Well, back when in middle school, I was diagnosed with scoliosis. So I had a surgery to have rods put on my spine back in ninth grade to correct the curvature. So as a result of that, I was left with back pain for the rest of my life.
How bad was it? And when I say how bad was it, I'm talking about, let's say, the year leading up to the MARTA scratch.
Like I said, it was never anything that was traumatic that would keep me down for days or at any time, or that I would need to take medicine. It's just common back pain.
Did you ever miss any work because of back pain?
No.
Did you treat for something sort of arm or neck related back in 2017?
My left arm had went numb some sort all of a sudden while I was at work. So I went to one of the urgent cares clinics who did x-rays, and there was like a curvature in my neck. And as a result of my left arm going numb, it was because of me constantly sleeping on my arm and keeping it bent for years. Because as you can see, I used to keep my hair done and nice, so I would sleep on my hand to preserve my hairstyles.
You still do that?
No.
You had that problem since 2017?
No.
Let's talk about your work life. Who were you employed by in March of 2020?
HSI Management.
And when did you first start working for HSI?
October of 2013.
And where did you start working in 2013?
At Vineyards of Browns Mill.
I'm sorry?
Vineyards of Browns Mill.
Vineyards of Browns Mill?
Yes.
And what is that?
It's an apartment community.
What was your first job with Vineyards of Browns?
Leasing agent.
And tell me about being the leasing agent. What was that like? What did you do?
I would have to, it's a lot of administrative clerical, answering the phones. I would tour prospects to the apartments for any models, market the property, meaning going out to do marketing. I didn't have a vehicle at the time. So when I would catch the train to work, I would leave it at the bus station, stuff like that. Or if I would go to the store, I would leave them in the grocery stores or wherever I may went to do marketing. Again, as I said, with tours, walking the property, stuff like that, calling to do market surveys.
How long did you have that job?
That position,
Yes, ma'am.
I was in that position for 2 months.
Well, after 2 months, what happened next?
I was promoted to assistant manager.
Great. And who promoted you?
Heather Poole,
And what was her job at the time she promoted you?
property manager.
So tell us about your experience being an assistant property manager. What did you do? What did you think of the job? That sort of thing.
By then, I was then collecting rent. I had more duties as far as being involved with the residents and their issues that they would bring forth. So I was then kind of, I guess you can consider the good cop in any kind of resident issues. I would post rent. I would help in the weekly reports that the property manager would be required to do. I would also still walk the property, still show units, pre-lease apartments, do move-ins, stuff like that.
How long did you keep that job?
I was in that position for probably about 9 months.
Did you like it?
Yes.
What was your next job?
I was then promoted to property manager.
And was that by Ms. Poole?
Yes.
Now, I want you to take some time and tell them about what is involved in being a property manager at the Vineyards of Brownsville.
For me, being that I finally found a job that I was good at and liked, I consider it like that was my property. I didn't look at it, I was working for anyone, that was my property. So I treated it as such. As far as at that time, I was then required to maintain the money. So I would do budgets, make sure I stayed within budgets, do whatever I can to save the owner money or bring them in more money if possible. I was then more into working with the City of Atlanta Housing because we do accept housing residents. So I was then required to do more of it's hard to describe the kind of reports, but it was just more work that was required, more reports that the manager would use to give them a scope of how the month went. They call them month-end reports. So those were required every month. There was weekly reports required every week. There was then more involvement with the courtesy officer. There was reports that I had to collect and speak with him. There was more meetings with the staff, as well as with the courtesy officer. Maintain the residents and their issues. Anything that came up on with the property. I was then dealing with vendors, contractors. If there was any issues that were brought up with any inspections, I was responsible for hiring those contracts to get quotes if it was something big, or to get it fixed if it was within a certain amount that didn't require me to get approval to spend the money to get it done. So it was a lot more responsibility that was put upon me once I became a property manager.
Tell us about the physical aspects of the job. You just described what I would call administrative part of that job. Can you talk to us about physically what that job involves?
Well, I was required to walk the property. It just depends on what day it was. I can't say like I had a certain day where I was required to do, I had deadlines or whatever. So it just depends on what needed to be done to the extent of how much time I would spend outside or what I would be doing. But it does require a lot of walking up and down the steps if I'm doing inspections, or if I'm checking on something that one of my maintenance staff would have pointed out that something is needing to be fixed. If there's a resident that called because there's either an issue in their apartment or they're having an issue with their neighbor, I would have to go and handle that. If I'm having to do something with the contractor, or if there's something I need to get quotes on. So there's a lot of physical as well. It just depends on what is needing to be done on any particular day.
And so how many buildings are there at this complex?
10 buildings.
And how tall are they?
Some are 3 stories, some are 4 stories.
Are there any elevators on the property?
No.
So if you have to get up to the 4th floor of a building, how do you get up there?
Climb the steps.
Do you feel like as of March 2nd, 2020, you were meeting your career objectives? How did you feel about the trajectory, it's a hard word for me, of your career around that time?
I was definitely at the point of where I was being groomed and was groomed to move up further. I was, because of the length of employment that I've been there, and how well my property, I was the star property the whole time I was a property manager. So I was the, I guess you can say I was the best property manager that they had in their portfolio, period. So if ever there was a new property manager that was hired, or if they were having issues on their property, I would be the one that would either go to train them or to assist them with anything that, to help them get their property to an outstanding level of performance according to the management team.
Let me ask you this. Based on your understanding of your job as property manager and your knowledge of your physical injuries and limitations, has there been a time between March 2nd, 2020 and today that you believe you were physically capable of returning to that job?
No, I don't believe I am.
And why is that?
Because I can't move. I'm not as mobile as I was. Definitely would take me forever to climb the steps. Not to say that I wouldn't, but it would take me forever, as well as would be in pain if I was to attempt to.
Let me ask you about something that Heather Poole mentioned, and that is a special project in Florida. Can you tell the jury why you were selected for that and what you did?
Well, at that time, that was the beginning phase of grooming me to be moved to a district manager, to give me more experience, because I went into this job with zero experience in property management whatsoever. But being I progressed very well and was good at it, they wanted to move me up. So going down to Tallahassee, it at first was just a temporary thing where I would go down, they would put me up every week. And that was just helping because they had a high turnover with the property manager down there, or keeping a property manager. So it started as a temp thing, which then after a couple of months, the owner of my management company that I worked for, he was also part owner of this property down there. So he he asked me if I would take on being the property manager, because within that 2 months time that I was just temporary doing there, he saw a slight change in where the collections of money was coming up. The occupancy was moving up a little slow, but more so the collections, and he's getting money. That's all he wanted. So being that I was succeeding, that he asked me to take on to be the actual property manager down there. And so I took the job.
For how long?
I was there only until February, because being that it was still costing a lot of money to turn over all the vacancies, he then decided or asked me my opinion, and I gave it. So he decided to pull out being the management and hire a new management company.
And where did you go?
I came back to Atlanta he gave me or made sure I got my job back.
You had no physical limitations of any kind, to your wrists, to your knees, to your ankles, to anything. You were back exactly the way you were physically just before this wreck. Would you like to have that job back, or are you glad you're out from under?
Absolutely.
Absolutely.
Want the job.
I want to turn now to the day of the collision, okay? We're going to talk about the crash.
Mhm.
Tell the jury where you were coming from and where you were going and why you were going there.
I was coming from work, headed to a rehab center. An ex of mine that I was dating, I was still close to his mom, who was she was hospitalized and then put into rehab to gain strength back into her legs. We had a real close relationship. And there was an issue with, I guess a nurse had done something physically to her to hurt her. And he called me and I was headed to meet him to find out the details concerning her and her well-being.
What kind of car were you driving?
Nissan Altima.
At this time, Judge, I'd like to play, so that it can be in evidence, the bus collision again, exhibit P6.
Sure. So it's in evidence because PT has been admitted, but you'd like to publish P6 now. Okay.
Was that you inside the white car?
Yes.
What's the last memory you have before that impact occurred?
Sitting at the red light.
How far back was the red light from where this happened?
I would probably maybe a couple of 100 feet.
Remember being at the red light?
Yes.
What's the next thing you remember after that?
Waking up
And where were you when you woke up?
in my car.
Tell us the story of what happened after you woke up in your car. Need just a moment, Ms. Daniel?
Do you want to take a break or you need just a little moment? We can take a break if that's okay. Take your time.
I woke up like in a daze, not really knowing what had happened. I remember the firemen running up to me, informing me that I was involved in an accident. However, it wasn't registering. They were telling me to unlock the doors so they could get in to get me out. It still wasn't kind of registering. When it finally did click that I understood what they were asking of me, I went to try to unlock the doors, but couldn't because my arms were dangling. When they saw that, they then proceeded, they broke out the window to the back door to unlock it and got the doors open and came to my side and had to force the door to stay open. They were asking me if I was able to get out. I still wasn't recognized. I remember telling or asking them if they could just get my right leg because it felt like it was just stuck in a position. If they could just move it and then I think I could get out. But when they did, that's when we realized, or it hit me, that I guess had broken that leg, and I was then in extremely much pain to where they had to force me out and pull me out. It took about maybe 2 or 3 of them to get me out the car.
What did they do with you when they got you out of the car?
They then put me on the gurney and put me in the ambulance and took me to Grady.
How long were you in Grady?
I was at Grady for 2 weeks, roughly.
That's the period of time I want to talk to you. Let me show you what's been marked as exhibit P10. Ask you if you can identify that.
Yes.
And where is that?
It's a picture of me in the hospital bed.
In which hospital?
Grady.
Judge, I tender exhibit P10.
Any objection to P10?
Fair.
Admitted.
Thank you. We've got it up on the screen here. Do you remember how you felt? Do you remember either feelings of pain or emotion, anything that you felt when you first got to Grady, and what did they do for you initially? How did you end up from the ambulance to where you are in that picture?
From this picture, it looks like, well, I definitely already had the first surgery. I haven't had the surgery on my leg yet, but I was in the hospital room. I was definitely in a lot of pain, extreme pain when I first arrived there. They were doing a lot of x-rays. So I was undergoing that. That was the last thing I remember as once I got there, as well as asking someone to call my mom. After that, I don't remember going up to the room, being in ICU. That's very vague because I was highly medicated, I know. So it's definitely a lot of pain.
Let's talk about how you felt when you got up to the room. I'd like to, this time, Judge, play exhibit P9, just a short video.
Okay.
Oh my God.
I know. We're gonna go get him. Okay.
Was that taken before that video, taken before or after those external rods were put in your leg?
After.
I didn't see the rods there. Why is that?
When they were removed.
That was after they had done the second surgery and they removed the
Correct.
exterior piece from your leg.
Correct.
What was hurting you so bad?
I was just in pain, period. Everything was hurting.
Be as specific for me as possible. I mean, was it possible at that time for your mind to distinguish between arm pain or leg pain or any other pain?
No, not that I can recall.
Were you given treatment for your pain? Were you given medicine?
Meds, yes.
How did that help?
It helped.
Was the hospital and their staff able to do anything else to make you comfortable during your stay there at Grady other than give you medicine?
Other than give me meds, I don't think so.
I want to show you what has previously been entered into evidence as exhibit P17 and ask that that be put up on the screen. You recognize this?
Yes.
When was this photo taken?
When I was in ICU.
I'm sorry, I didn't hear you.
When I was in ICU.
Was this after you had had some surgeries to your arms?
Yes.
What was the purpose of those bone pieces, as you understand?
I don't know. I guess to protect myself, I don't hurt myself. I don't know.
During the 2 weeks you were in Grady, were you able to use your arms or your hands for anything at all?
No.
How did you hold a cup of water?
Someone, whoever was staying with me in the room, would hold it so I could drink out of a straw.
If you had an itch,
They would scratch it for me.
you had to go to the bathroom.
I didn't get up and go. Believe I was on a catheter.
Did they eventually move you off the catheter into some other means of going to the bathroom?
I don't think it was there. It might have been once I got to the other hospital for rehab, because that's when they started putting me on bedpan.
Where did you go after the 2 weeks of Grady?
DeKalb, Emory, DeKalb.
Tell the jury why you switched hospitals. Why switch from Grady to Emory DeKalb?
For rehab.
Okay. Tell us about what the plan was. We'll talk about what happened. Tell us what the plan was over at Emory. What was supposed to happen?
I was just going to go through therapy just to learn the basics, to try to bathe myself, feed myself with my left hand, because my right hand had the plate in. So I was going to do some rehab with the right hand, but I was going to learn to feed myself with my left hand, try to become more functional with that, because I wasn't going to be able to use my right hand. Learn to put my clothes on if I can by myself. Just try to become a little bit more independent. Learn to transfer myself from the bed to the wheelchair, to get out of the bed. Just basic needs.
So that was the plan.
Yes.
What happened?
COVID happened, and being that I was in a lot of pain. So of course, having the injuries that I had, you're going to have your temperature is going to go up and down. One night, one nurse, she was checking in on her shift and came in to do my vitals and got a high temp, and she went into panic mode, came in and all dressed up with mask and all that kind of stuff, and contacted the doctor, who then sent me for the x-rays and diagnosed me with COVID. I didn't have a test done, just said I had COVID. So they stuck me in the COVID ward. The doctor in there came to see me right away. He told me he looked at whatever reasons why she had sent me in there as to why I was having COVID. Didn't see any reasons. He did a test and said that as soon as he was going to send it for rapid, and as soon as he gets it back, he'll get me out of there.
Let's talk about what rapid means back in March of 2020. We think of that now as you go and fix an hour, right? To get your results. What was rapid back in 2020?
I was there for 2, maybe 3 days in that COVID ward.
When the rapid test came back, you negative?
Yes.
Where'd you go then?
Back to the room or the hall that I was on for rehab.
Tell us about the rest of your stay there. By the way, were any of your family able to come see you at all during this 2 weeks you were there?
I believe maybe the first and second day.
After that?
No.
And why is that?
Because of COVID.
And during the entire 2 weeks you were there, were you able to sit up
In the bed?
by yourself, unassisted?
No.
Were you able to do anything with your arms?
Not really. They were coming in to teach me or help me with my left hand.
So tell us how the rest of the time went. What was that like for you? The rest of the time spent at the hospital there before you could finally let go?
It was the longest 2 weeks. For one, just not being able to physically see my family or have them there. I was able to see my children and my family through FaceTime or talk on the phone. It wasn't the best 2 weeks because, as I said, it started with me being in the COVID ward where they treated you like crap. Then it was like, it was fairly new, so everybody was scared. However, I just wasn't treated like a person. I was left alone. When I went back to the regular hall, I began therapy. I was going several times a day, seeing different therapists. One that would help me with my memory, one with the occupational, one that would help with learning to dress and to bathe myself, one that would help me with I guess motor skills. I don't know, it was so many of them that I was seeing several every day. A few of the nurses weren't the best or therapists to where they hurt my leg several times because they didn't know how to, I guess, properly handle a wheelchair or anything like that because they had dropped my leg several times. Needless to say, it was definitely, I was ready to go when it was time.
You didn't want to stay on?
No.
Once you left, once you left Emory, where did you go from there?
To my mother's.
What was your physical condition at the time you first got to your mother's house after being discharged from the hospital? What could you do? What kind of physical state were you in?
I was still bedridden. Still couldn't too much do a lot on my own. I needed help with bathing myself, help, using the bathroom, doing the woman thing, with feeding myself, everything still, because as I said, I didn't get the full extent of the 2 weeks of the rehab. So I just they gave me everything and just told me just to continue on with the hand exercises and the different tools to move with my arms. I couldn't do nothing. We weren't doing any kind of physical therapy or any kind of work with my leg. Everything was just pretty much just my arms and hands.
So since we're talking about your mother, so let me show you what we marked as P11 and ask if you can identify that.
Yes.
And what is that?
That's me laying in the bed at my mom's house.
Judge, I tender P11 into evidence and ask that it be shown.
Any objection?
They are.
P11 is admitted.
Is that the bed at your mother's house that you stayed in the entire time you were there?
Yes, it's the hospital bed that they had sent home or sent to her house for me.
And at the time that picture was taken, could you get out of that bed by yourself?
No.
Could you go to the bathroom unassisted at that point?
No.
Could you feed yourself any food?
Just barely.
Did you start to make progress toward healing when you were at your mother's house?
A little bit, yes.
Remember the first time that you were able to get out of bed and get into a wheelchair?
Yes.
Let's show that video and talk about it. That, forgive me, that is exhibit 12, E12.
go. Look at that champ.
Yes.
Look at that champ.
Yeah, boy. Never can keep me down.
How did you feel about yourself when you were able to get out of bed and into the wheelchair?
Proud. I felt accomplished.
How hard was that for you?
Very hard.
By the time that video was taken, were you still unable to feed yourself, clean yourself, use the bathroom by yourself?
By that time, I was able to do, I was becoming, I wouldn't say independent, but I was just able to do a little bit more without help.
Was your progress while you were at your mother's sort of gradual, or was there just all of a sudden, within a span of a few days, you made a big jump in your recovery?
Gradual.
How long did you stay at your mother's after you were discharged from Emory?
A little over 2 months.
And during that 2-month period, were you able to see your children?
Not much.
Why couldn't you? They were in town, then, right?
Yes, they stayed in my apartment by themselves.
Then why couldn't they come see you?
Because COVID had just started, and my mom and her husband wouldn't allow them to come. Being that my two, I still had two that were in school. And so with the in and out, there was just real concerns on my mom's end.
So after that 2 months, where did you go after you left your mother's house?
I went to Texas.
Why did you leave Atlanta and go to Texas?
Well, as I stated, my children were living by themselves. I could no longer afford the rent. I kept it going as much as possible, just till my kids had finished school. But I couldn't afford it anymore, so they had to move. We couldn't stay at my mom's, although there was room, but because of COVID, we couldn't all live there. So, as well as with her disability that she had, there was just more people or more family in Texas. They actually wanted me to come there instead of going to my mom's house, but I couldn't just up and leave, especially as I said, I had two that were still in high school at the time. So I couldn't just up and leave, as well as I did have or was going to have another surgery. So I still couldn't leave, but that's why I left, just to get more support, family help with moving and just whatever else that I needed.
So at the time you left your mother's for Texas, that was what, about 3 months after the crash?
No, it was 2, maybe. Well, yes, about 3.
Yeah, because first month was in the hospital.
Mhm.
So at that 3-month mark, when you relocated to Texas, did you walk?
No,
Where did you learn how to walk again?
in Texas,
And how did you learn how to walk again?
physical therapy
Where did you get your physical therapy?
at Tupperwine
And
Physical
where's that?
Therapy. It's in Live Oak, Texas.
Remember what it was like learning how to walk?
It was hard.
We're going to talk about how you did it.
Okay, but
I want to show you exhibit P13, which is a video, and then I want to talk about it. You can help the jury understand how you learned how to walk.
Just today. I know I'm pushing it. Just today. So just twisting here and turn around so you bring the wheelchair forward. Turn around. I would not recommend you doing this at home. You think I'm gonna do this at home? You don't.
What was going on there? How did they teach you how to walk?
well, this was taking this wasn't until like the end of July. I had already been in physical therapy since the beginning of June. I made it to Texas, I believe, June 6th, around that, June 4th, 5th. And my first appointment was in June 8th. So we didn't start taking any steps then. The therapist had, I guess, looked at my medical records and just went according to what the doctors had ordered as far as physical therapy. So as again, that was done at the end of July. So up until that time, it was just building up the strength in my legs, doing home exercises, stretches, rotating, things like that. And then doing the weight bearing. After the weight bearing for some time, once it became a little tolerable, is when I built up to take those first steps.
Now, after that video was shot, how long did it take for you to actually complete the physical therapy regimen over there with the harness and all of that?
With the harness, I was using the harness for at least a month, I believe,
Let me
maybe.
show you exhibit P14, which I believe was shot a month after the video we just saw. Tell us while this is going, what you're doing here.
So I was still on the harness because I wasn't stable on my feet. What he's doing is now teaching me how to walk using the cane. This is trying to lead me onto still needing assistance, but moving to where I can no longer, because I don't have the harness at home. The harness is there just to hold me in case I may stumble or anything like that. But that is where he's going with that, is trying to teach me to use a cane.
And you were using that cane with your left hand, is that correct?
Correct.
Are you right-handed or left-handed?
Right.
Why weren't you, obvious question for the record, why weren't you using the cane with your right hand if you were right?
Because it would hurt for me to grip and hard for me. As you can see, I had the cast on. So during that time, I was still in the healing process with my hand and going through physical therapy. And I was having a lot of issues with, because there's a lot of joints or tendons, I don't know the proper word, but it kept getting, whatever the little small pieces were becoming dislocated a lot. So that was another reason why I couldn't put the weight on that right hand.
How long did it take you before you were able to walk, however you define walking? I'm not asking about perfect, but walking without help and without a harness and without a cane. How long did that take?
Without any assistance and still,
You've been able to walk all on your own.
it was probably around the middle to end of November, maybe the beginning of December.
8 or 9 months. Does that sound right? I need you to say out loud.
Yes, I'm sorry.
That's all right. You're fine. I want you to talk to the jury about, I'm going to skip ahead, okay? And because I want you to talk to the jury about how you ended up being able to walk, what your walk looked like once you had achieved your best level of success, okay? Once you had completed as much of the healing process and you were walking the best you've ever walked since March 2nd of 2020, what did that walk look like?
It was slow, and I walked with a limp. I don't know if you guys had paid attention to the first picture when I was at home laying in the bed and how my right foot was to the side. So the foot never came back straight. It was not as that far to the side, but it was still, it went to the side.
Let's
And
go P11, like,
okay.
since you just mentioned it. Okay, now, what were you saying?
Yeah, so as you can see, it was to the side. I guess the other picture that didn't have the cast on, if you, it makes it more clear. I don't know what number that was.
Talking about the one at Grady?
No, at home. Was there another one or even,
No, not yet.
well, without the cast, even still, you can see how it goes to the right or to the side. It never came back straight. So when I would walk, that right foot still went out as the left knee, the right knee would go in, knock kneed. Again, as I said, it was slow paced. I could move fast as I could, but it wasn't like a normal walk. I had a limp with it.
Feel when you walked, say the length of this courtroom, what was the physical feeling for you?
Right now?
No.
Oh.
When we're talking about when you were, because you're recuperating now from ankle surgery. Before that, when you were at your best walk, what did it feel like to walk from there to there?
It would hurt. I was always in pain. There was never a time that I was never in pain. It just, the more walking I would do or standing in one position or just sitting would just increase the pain.
I want to go back to physical therapy now, okay? And I want to ask you about physical therapy in general. Well, tell the jury what your attitude was for all of your physical therapy.
It was positive as I could be. Never a negative side or downside. It was emotional. I think I cried just all the time. I felt proud when I would succeed. Definitely when I took my first steps. But it was hard. And
are you aware of any physical therapy that you were asked to do by any doctor that you did not do?
no.
You listened to the deposition of Dr. Moore and I think Dr. Payne, and they were asked questions about physical therapy. Did either of those two doctors ever prescribe you any physical therapy that you did not do?
No.
How much physical therapy did you do in Texas?
I started physical therapy here before I even went to Texas. They ordered it when I saw them in May, the end of May. So I did maybe 1, 2, possibly 3, no more than that sessions before I went to Texas and continued on until maybe the end of September, maybe the beginning of October when I couldn't afford it anymore.
Tell me about your wrist and how you rehabilitated your right wrist. What did you do?
There was different exercises that they would have me do with gripping things, different items, with lifting weights, as much as what could be tolerated. There wasn't like, I guess, too much different stuff. And, it would just require me to try to grip to, strengthen up the bones or whatnot that I would continue. They gave me stress balls, anything just to keep squeezing, or, try to hold in place that I would continue to do at home, as well as when I was in therapy with them.
Let me show you a video of P15 and you can tell us where that was and what you were doing.
That is, I was in physical therapy, and those were the exercises that they were having me do with some weights at Tupperwine in Texas.
Why is your left wrist going up, but your right wrist isn't?
Because that was the extent that I could do.
Let's talk about the current state of your wrist on your right hand. Show us your right hand. And in your right wrist and show us what you can do with your right wrist. Can you move your right wrist down? That's as far as you go?
Mhm.
So you need to say yes or no.
Oh, yes, I'm sorry.
That's okay. Just doesn't get into the record well.
Take your hands both out and drop your wrists. So you're dropping your fingers on your right hand side, but you're dropping your wrist on your left hand side.
Correct.
How does that affect your life?
It affects it a lot. This is my dominant hand, what I'm used to writing, doing anything with. There is pain, depending on with trying to cook or whatever I'm doing. A lot of it is more so like in this joints area of the thumb. So it makes everything difficult.
How about lifting things? What can you lift with your right hand?
Nothing, not anything heavy. I mean, if it's maybe less than 5 pounds, and that's probably pushing. If I am trying to do it, I can only use, I put all the weight on my fingers and not, so it doesn't do my actual hand.
And I promise not to be gross here or anything, but does it affect your use of the bathroom, your use of toiletries, any of that?
Yes,
About the ability to button things.
yes.
There was a moment in one of the videos, I believe it was Dr. Payne, when she mentioned that you had spoken to another doctor about whether another surgery to your right wrist might do something. Remember that?
Yes.
Did you make a decision about whether to have any more surgeries on your right wrist?
I did.
And tell us what that decision was and why you made it.
I had saw when I came back from Texas, I followed up with the doctors. Being it was grading, they didn't have any availability until March. So by then, that's when I found out that Dr. Payne was no longer there, and they referred me to the new doctor who was, I guess, who took our place, Dr. Mills. He then did more x-rays on me that day. His PA, I guess is what you call him, came and had me do a few things. And he came in and said that, well.
Stop for a sec.
You knew where I was going.
For the record,
Well, I was going to just, it sounds like she's going into some hearsay, and I just wanted to make sure.
Okay.
We're not on the same page.
so Mr. Johnson, if you would help guide
I'll be glad to, Judge. I'll be glad. Thank you.
Ms. Daniels through this.
Ms. Daniels, after speaking to the doctor, what was your view on whether it made sense for you to have surgery?
He told me that.
So
Say that. I'm asking.
it's okay. Let me
That's the legal stuff.
stop. It's okay. In general, you don't get to share with the jury what other people said to you. There may be exceptions to that. And if Mr. Johnson says, what did so-and-so say? Ms. Arnold will get up if she thinks that's not appropriate. But when we're talking about what the doctors or the PAs or others said to you, that's not something you get to relate to the jury. We'd have to have the doctor or the PA come in. So when Mr. Johnson asks an open-ended question, which he's free to do, what happened next, something like that, you'll need to talk about what you did. So his question was, based on the conversations with the medical professionals, what did you decide to do about another wrist surgery? So not what they told you, but what you decided to do.
Okay.
Okay, it's okay.
So did you decide to do?
I opted not to.
And what were your concerns?
There was no guarantee that it would make it better.
I want to take you back now to Texas. Let's go back to Texas. Were you in a wheelchair pretty much the whole time you were in Texas?
Yes.
Let's talk about how you spent your life in Texas when you weren't in the rehab. Where did you live, and did you ever get out?
When we first got there, we were staying at my sister's house for a couple of months. And when it was determined that we were going to have to be there longer than just a few months that we had thought, we then went to stay at my dad's house. I did get out every now and then, only just to go to the store with my dad. My son had to make a decision to do his senior year there. So that is when we had, once school season had started, football. So I would attend his football games. But other than that, I'll be at home.
Let's talk about attending football games. How did you do that?
In my wheelchair, my dad would drive me to the games.
Do you think of anything else you did to have any fun in Texas?
No.
When did you leave Texas and come back to Atlanta?
January of 2021.
Can you tell us about, well, where did you go?
I went back to the property that I worked at. We couldn't go to my mom's house because, as I said, with COVID, and I couldn't afford any place, didn't have any financial means. So I had spoken with my old boss who made arrangements to get us an apartment there on the property.
Okay. I want to talk about your life during that period. And that's from when now? When you moved there?
January 2021.
January 2021, up until this surgery, this most recent surgery, June of this year.
Okay.
Tell us about your progression. You're getting better over that period of time. How did that go?
I was able to move around just a little bit more. Still, there was still pain during those first maybe 6 months. It was really nothing but other than taking my oldest daughter to and from work.
Let me interrupt you there, because when you say taking her, do you mean driving her in a car?
Yes, driving her. I didn't have a vehicle, so I was renting a car, and being that she wasn't on the insurance, I couldn't let her drive herself because I couldn't afford any extra one. But so I would drive her to work and from work.
Let's talk about driving. When did you first drive a car after this depression?
December of 2020.
How did you feel when you started driving again?
Nervous, anxious.
How do you feel when you drive now?
Anxious, nervous.
Has it gotten any better?
No.
So you began by driving your daughter to her work. That was at Lenox Square, right? She had a job at Lenox?
Not right away.
Where'd she work first?
She had went back to an old job of hers at Root to the Wings.
And you would take her there and pick her up?
Yes.
Was this during a school break, like summer break or something, or was the school in session at this time?
School was in session, but they were virtual.
Did there come a point when your daughter went back to real physical school?
My youngest, yes.
All right. And how old was your youngest when she went back to school?
16, almost 17.
And how did she get to school every day?
By me driving her.
And how long did it take you to get there? About 30 minutes, I think we said?
Maybe about 30 minutes. I mean, it just, not to physically get there, but to drop her off, yes, because of traffic, to get onto the school campus.
And then where did you go when you dropped her off in the morning?
I would go right back home unless I needed to stop at the grocery store or something, then I would stop before I went home.
And when it was time for her to be picked up from school, what would you do?
I would leave home and go pick her up
And then bring her
back home.
Now tell the jury what you did most days between the times that you took her to school in the morning and picked her up in the afternoon.
If just at home, just laying in the bed.
Why's that?
That would be the only way to relieve, to make the pain, I guess, less miserable, and just to, put my foot up from driving and to, keep the swelling at a minimum.
Now, over this period of time, this year and 4 months, whatever it is, you took a number of trips from Atlanta to other parts of the country.
Yes.
What is the longest amount of days you were ever away between the time you got back from Texas and today?
Repeat that.
Sure, it's a weird question. What I'm asking is this, from this time period that we're talking about, what's the longest number of days any trip you took lasted?
2 days at the most, maybe 3.
Did you ever take a trip that lasted longer than 3 days?
No.
All right. Let's try to think so that we can just get them all out there if we can. Of every time you can remember traveling, why you traveled and where you traveled, and since this is apparently an issue, we're going to talk about what you did on all these trips.
Okay.
So let's just start with your son. Your son, did he graduate from high school?
Yes.
What happened after he graduated from high school?
He attended college,
Where did he attend college?
Aurora University in Aurora, Illinois.
So I'm not really familiar with Illinois. I know where Chicago is. Is this near Chicago or is it a different part of Illinois?
It's outside of Chicago.
So that means kind of near Chicago?
Yes.
So to get there, would you fly into Chicago?
Yes.
Okay. When your son first went to college and moved into school, did you go?
Yes.
Tell me about that trip. What did you do?
Me and I took one of, I call him my bonus sons, my son's best friend, with me, or with us. And I had bought everything online and had it ready to be picked up once we arrived. I rented a vehicle to put all his luggage in, his clothes, and went to pick up the items that he needed to start school and get him moved in. And that's what his friend, along with, he had some other friends that went to high school with him that were attending the same school. So they helped each other get the stuff upstairs because there was no elevator and he was on the 3rd floor.
And what did you do?
I sat in the hall, wherever the TV room is downstairs on the main floor.
How did you get around when you were in Chicago?
I drove around.
When you weren't in a car, how did you get around?
Well, I mean, I would walk to the building. I did go up to see the room, just make one time just to make, see how things was.
How'd you get up to the room?
I walked the steps.
What do you walk steps? Can you explain to the jury your method of walking upstairs?
One step at a time. Just you literally one step at a time, take the left, just like that.
And when you go downstairs?
The same way.
So you went up to this place one time?
Yes.
How'd you feel physically?
Exhausted. Very tiring.
How long did that trip last, moving your son into college?
I believe 1, maybe 2 days, because there was a parent meeting like the next day after move-in, and I left right after that.
And since he moved in, was your son a football player?
Yes.
And he played football in college, right?
Yes.
There? And have you been back to see him play football?
No, because he's no longer in school.
When he was in school, did you go see him play football?
Yes.
Okay. How many times do you believe you went to Chicago in an airplane to go see your son play football?
To see him play, 2, maybe 3 times, I think.
Were there other times you went to see your son other than move in and the times that he played football?
When I went to pick him up, to bring him home.
Okay, so there was taking him to college, what, 3 or 4 football games?
No, either 2 or 3.
2 or 3 football games, and then picking him up, taking him home.
Correct.
Is that the only time you've been to Aurora, Illinois?
Correct.
What else? Okay, so we've covered that. Let's talk about your daughter, since we're doing that. family things. Have you traveled anywhere with your daughter since the wreck?
Well, she was one of the ones who went with me to Chicago. I never went by myself. But I did surprise her for her 21st birthday to a trip to Vegas.
How long were you there?
1.5 days.
Tell us how you got around for 1.5 days you were in Los
Well, I rented a car, but as far as just being on the strip, because we stayed on the strip, I rented a scooter.
Did you do any walking in Las Vegas?
No.
What was the plan in your head when you and your daughter got to Las Vegas? And is that what happened, or did it kind of go different?
It went according to plan. I knew I wasn't going to be able to do any walking. The main thing was just to take her to enjoy herself as best as possible for her 21st birthday.
Did she have a good time?
I think it would have been better if, considering, but she made the best out of it.
Do people have a bad time in Las Vegas?
I did.
All right. Speaking of your daughter, I think there was some testimony earlier about a trip to Tampa, Florida. Right?
Yes.
Am I remembering that right, Tampa?
Yes.
When did you go to Tampa, Florida?
I went a few days before my most recent surgery.
That's the ankle surgery?
Yes.
That would have been, June of this year?
Yes.
How long were you gone?
About 2 days.
Why did you go to Tampa? First of all, I'm sorry, let me back up. Who did you go with initially?
Myself.
Anybody go with you?
No.
Why did you go to Tampa by yourself?
I needed to get away. It was a buildup. There had been reasons, stress related. And being that I've been dealing with this whole thing for over 2 years and I'm getting ready to have a surgery that's going to keep me down again, I wanted to attempt to get away, to enjoy something by myself. Because I'm always doing stuff with my kids. So I wanted to do something by myself just to relieve stress.
So how did it go? What happened when you got to Tampa?
Well, it was actually Clearwater, but I flew into Tampa. The first day you got to my hotel, I laid down for a couple of hours to recuperate from the flight. Then I had got in the car, went to Clearwater Beach, I guess where all the restaurants are, to try to get something to eat. I went to one that was close to the beach. I did I did walk to the shoreline. That was a struggle. And I think because of the sand and the instability of the ground, irritated my ankle. So I was down the rest of that day. I then learned that there was a shuttle that would take you around instead of me doing driving. So that next day is when I did the shuttle when I went in to get some breakfast or lunch, because I was in the bed the rest of the day and night until I got up the next day. And I called my daughter, who took a trip separately, but just so coincidentally, we didn't plan this purposely, but she went to Houston. So I called for her to come and to be with me in Florida.
Why did you do that? Why did you call and have her come be?
Because I needed her assistance with helping. When my ankles are swollen and stuff, I can't do stuff on my own as far as needing to go get something to eat. It takes a lot, literally days, for it to even come down to a minimum of where I can even I'm not going to say walk normal. The limp is just not as bad or hurtful. I needed assistance with bathing then at that time. Although it was an accessible unit, some accessible units don't come with the seat as what I would request. They only have the bar, so which means that I need more assistance with bathing myself than I would if I was able to sit down. So I needed her assistance.
Your daughter helped you bathe this June of this year in Clearwater, Florida.
Yes,
Right? What else? Have you traveled to Texas?
I have.
And when I say you traveled to Texas, I'm not talking about the time you were living there before, but since you've been living here, have you gone back to Texas?
I have.
Why did you go back to Texas?
I went for, well, my dad had passed December of 2020. COVID took his life. I went, his first birthday was in April of 2021. So I went to see his gravesite because I didn't attend the funeral.
Who went with you?
This was during the school year of 2021 when my son was in school. This was during, just so happened to be his spring break time. So he had flew down to Texas to visit his friends. So I flew by myself there, but me, him, and my brother who lived in San Antonio, we drove back. Well, he drove, but I was in his car because he moved back here to be with me, being that our dad passed. He didn't want to live in San Antonio anymore.
How long were you in San Antonio?
A couple hours.
Couple hours.
Yes, we immediately got on the road after going to visit my dad's gravesite for a little bit.
How long did it take you to get home?
We took 2 days.
And tell us about that trip. Where did you make? Oh, so 2 days. So you stopped somewhere on the way home. Or did you
Yes.
stop on the way home?
That day we drove to Houston is where we had our first stop. We stayed the night in Houston, got back up the next morning, and then drove into New Orleans, where we stayed another night, got back up the next day, and came on in to Atlanta.
What was it like for you being in the car that long?
It was long. We would stop like every 2 hours just so I can get up. I had the whole back seat to myself, so my leg was propped up on the seat the whole time. However, I still needed to stretch. So every couple of hours we would stop so I could stretch.
I think you took a trip to California for a military graduation. That's something else when I
Yes.
had that wrong.
My ex that I was dating, his son was graduating from basic training of military. I assisted him as far as helping him financially get there. He hadn't seen his son in 10 plus years. This was something major. So just to help him, I assisted him with getting there, but my main purpose was to go because his license was suspended. So I rented the car in my name. He did all the driving though, but just so he can attend the military.
How long did that
And so,
last?
what the trip?
Whole trip.
We were probably just 2 days altogether.
What's it like for you flying on an airplane? Is it just like sitting in a chair, or is it better or worse? What does it feel like?
It's the same. It just causes the swelling to happen more, I guess, because of the pressure. So it happens faster. But it's about the same. Being that I am accessible, because I always get wheelchair assistance anytime I fly. So I'm immediately in a wheelchair from the moment I get to the airport all the way till I get to the plane, and then I walk to my seat. I'm back into a wheelchair as soon as I get off, all the way until either I'm at home or where I'm at the rental car place. So I am able to prop my foot up where they do seat me because I am in the front. So I do have my foot propped up during the flight.
If we talked about the travel you can think of, are there any other trips that we haven't discussed?
Other than going to Charlotte a few times,
Charlotte?
North Carolina.
Why were you in Charlotte?
The first time I went was in January of 2021. Again, the guy friend that I was, my ex, he happened to be going to Charlotte during the same time that my dad's funeral was going to be taking place. So just to help to get my mind off, because as I said, I didn't attend my dad's funeral. So just to make it just a little bit easier during that time, I went to visit my best friend for about a day, maybe one full day when he was back home. He did all the driving there. And then I went again this past March for her birthday.
For how long?
For 2 days with him as well. He did the driving.
So, Daniels, is there anything, any other trips we didn't talk about?
No.
Okay. If you've been able to take the trips that you discussed with us, and if you've been able to drive your daughter before your recent ankle surgery to school and sometimes to a job, why have you not been able to have a full-time job for money?
Because I can't tolerate being seated for a certain amount of time. I can't tolerate standing for a certain amount of time. There's like a certain extent. I mean, not to say that I wouldn't push myself, because I'll push myself, but I'm going to suffer in the end, to where if I am exerting myself to do anything, even with these trips, I'm going to suffer the consequences, which will have me in the bed for a couple of days.
Is there ever a moment of any day in which you're awake that you feel no pain at any time?
No.
You're right.
A break.
Pardon me?
I need to stretch for a little bit.
Okay. How much more do you have in terms of direct examination?
Quite a bit.
Okay. I just was wondering if we're going to take our afternoon break now. I wasn't sure I have 2 more questions. You have more than 2 questions. You can have as many as you want, within reason, but this is a time to break. It sounds like Ms. Daniels would benefit from a break. So ladies and gentlemen, off to the jury room with you. Don't talk about the case while you're back there. Stretch out, and Deputy Gordon will round you up when it's time to bring you back in. Mr. Johnson, anything else before we break?
Not this time, Judge.
Ms. Arnold?
No.
Your forecast is that you'll finish with direct exam today, or that might go into tomorrow?
My forecast is that I will finish today.
Okay. Good to know. If you could help, I don't know if Ms. Daniels needs help getting down, that would be super.
Wait, Ms. Daniels, let me get this, okay?
I can't move it back, so I'm gonna do it.
Hold on. Good. Grab on.
I'll be back.
All right. What's that now? I'm gonna help you get in the chair.
But if I'm gonna have to stand up
You're not gonna have to stand up.
when they come in,
We'll excuse you from that.
okay. Because one chair is pushed in.
All right, it's exactly in the right place, so let's see if we can get you in it.
You know, roller chair.
And let me give you something, please. This is the thumb drive that has its PT.
We're gonna mark this PT. I have exhibit stickers.
Gordon, yeah, is there nowhere to get ice? Those waters in there, are they cold? Yes, please.
Okay, so the number I got is 1314. Okay.
Thank you.
Are you gonna need to play this anymore?
Yes.
Only because I don't wanna put the stick on it.
Don't put a sticker on it yet, because the
Oh, you
jury,
can do it with it. I'll put it on the white tag.
yes, because the jury may want to see it since it's in the evidence.
No problem. I just don't want it to obscure it, but I can see where I can fit it in. Snacky.
Daphne, will you bring me my purse real quick, please?
My hands are clean.
What is that? What's that? Yeah. Yeah. This the pecan sandies. Is that what this is? That's what it looked like. I love pecan sandies. Yeah.
Tomato, tomato.
Look, I'm from San Antonio, not Atlanta.
Oh, that's how y'all say it.
Huh? Pecans in Texas, yeah. I think here in Georgia, they say
I say
pecan.
I'm from Pennsylvania.
And you say
Pecan.
pecan. Here you go, Daphne. But he was listed as a, no, he wasn't. I have to be, that there's certain people that I can let drive me around and I'll be okay. I mean, I still have anxiety. That drove me around, my mom's husband. So I mean, it's not like I don't have anxiety when someone else drives me. Technically, no, not with a suspended license, but I mean, I'm just being truthful. That's the reason why. That's the only reason why I went. Otherwise, I wouldn't have been going. Daphne. Is there a trash somewhere? Thank you.
Ms. Daniels, you ready for us to keep going? Yep. Okay. Ms. Brown, are you ready? Once you get that bite taken care of? Okay. All right, we can bring the jurors in. Mr. Johnson, can you push Ms. Daniels in a little bit more? We're just talking about accessing the mic. Thank you. So the mic doesn't move on, oh, you.
This is as far as it goes.
Yeah, I mean, the mic moves up and down and doesn't telescope towards you. So we've got to scoot you in.
Okay.
It's okay. I mean, it goes up and down so she can get it closer to her mouth if she's in close.
That recorded Jesus.
It's all right.
Judge President.
Great, thank you. Everyone can be seated. When you're ready, Mr. Johnson.
As part of your life since this happened, you undergo a functional capacity examination.
Yes,
And was that for this case?
yes,
How many functional capacity examinations did you have?
2.
We heard from the functional capacity evaluation expert that we retained to testify in this case, Mark Yeager. Who else examined you?
Peggy Freeman.
Was her testing the same, go the same as Mark Yeager's, or were there differences?
Some similarity, but there was a little difference. I believe maybe a few things, but she had typing added on with hers.
Give your best effort in both.
I did.
How do you feel generally about being, I'm just getting a couple of general questions here. How do you feel generally about being inside a moving car?
Anxiety.
What makes you feel better? Driving a car or being driven in a car?
Neither, but it's more controlled with me driving because I can control. I guess being that I didn't see the bus coming towards me, I don't recall it happening. So with me having control of it, although with me driving, it's like the anxiety is like every car is going to come towards me, but at least I have control to move out the way. Compared to if I'm riding in a car with someone, I'm looking and very nervous that I'm going to get hit.
Are there some people who you're more comfortable letting drive you than other people?
Yes.
Who makes you least uncomfortable when they drive? How about that?
My ex at the time, Mac, or my mom's husband, anyone who, well, I mean, I don't drive with too many people, but if you're pretty much like a good, not slow, but technically a slow driver and not crazy, it gives me some calmness.
We're gonna talk about your ankle fusion surgery in a minute, but I want to talk about your knee. What has your level of, what has your knee felt like since this happened? Tell us about that. Like, since you came back to Atlanta from Texas, what does it feel like to have that right knee?
Again, I'm always in pain, so that's all I can describe, other than with it going inward. And now it's more inward since they've taken the hardware out.
What have they done to try to make the pain a little better?
Well, again, I've been prescribed strong anti-inflammatories. I've never been one to take meds. I will tolerate the pain. I have a high tolerance of pain and will sustain, or not sustain, but will, until it's just unbearable, then I will take pills.
Let me ask you this, have you had any shots?
I've had 2 steroid shots in my knee.
Did it hurt when you got the steroid shots? Or were they?
Them administering it?
Yes.
No.
Okay. Did the shots help your knee back?
The first one did.
How long did it last?
About 2 months.
And then did you have another one after that?
I did.
And what happened with that one?
It did nothing.
Since that second one that did nothing, what have you been doing to control your knee pain?
Just the usual where, well, again, all I do is lay down. I will ice it if need be, or again, as I said, if it becomes unbearable, then I'll take ibuprofen.
Let's now talk about the ankle. What made you agree to have a subtalar fusion in your ankle?
After speaking with the doctors, and they kind of assured me that this would be the best option unless I want to live the rest of my life with the pain that I'm in.
That's my question. Tell the jury about the pain you were in that led you to agree to
It's a constant pain. So regardless whether I'm laying down, it was just constant, just more walking or anything will just cause it just to progress. But it's just, if I wanted to eliminate the pain as much as possible, the surgeries would be my best option. But again, it was my choice.
Let me show you what we marked as P30 and ask you if you can identify that.
Yes.
Tell the jury what P30 is.
It's a picture of me after my last surgery at my mom's house.
Judge, I tender P30 into evidence and ask that I be permitted to show it on the screen.
Any objection to P30?
There you are.
Admitted.
Okay, so let's start again. Where was this taken?
At my mom's house.
And when was it taken?
After I came home from the last surgery.
And that last surgery was when?
June 22nd.
Of this year?
Yes.
Tell us about your life after returning to mom's house. First of all, why are you at your mother's house if you were living at home?
I went to my mom's house to have more help with the aftercare, because I wasn't going to be able to be as mobile as possible. With my daughter constantly working, of course, my son can't help me with personal things. I went to my mom to where I can have more help, as well as her husband would be the one that could take me to my appointments. I wouldn't have to find a ride with staying at home. And as long as I said, my youngest daughter is also still in school, and my mom's house is closer to the school, so where she can get an Uber to and from school.
At the time you got back there to your mom's house when that picture was taken, were you able to move on your own?
No.
Were you just completely stuck in bed at that point?
Yes.
How long did it take you after the ankle surgery until you were able to get out of bed?
I don't recall the date, but I just followed the doctor's orders. So whenever I was told to get up or whatever, then that's when I did.
What was the pain like following the surgery? Was it better than before or worse than?
Well, right now, I mean, it's still the healing process, so I can't compare it. I can't give you an honest answer.
I don't mean forever. What I mean was, after you got home from the surgery, what did you feel like?
Of course, it was pain because of surgery.
When you remember back to the pain following the surgery and then going forward, has it gotten a little better or?
It's eased up some, yes.
Has it? Yes. What makes it feel better for you these days?
Just not being on it. It still swells. Now that I'm putting weight bearing to where I can tell, I can feel there's screws in my heel now that I didn't have before. So I can feel that now.
So when you say you feel screws in your ankle, what does that feel like?
It's in my heel.
In your heel. What does that feel like?
Sharp pains.
Were these screws that were added as part of this fusion?
Yes.
Is that getting any better?
No.
Is there anything you can do to make it feel better?
No.
Does elevating your leg make you feel any better?
Of course, not being on it. Yes.
Not being on it, you say. Makes
Correct.
you feel better. How about raising it up, propping it on something? Does that do anything?
Well, as long as there's no weight on it. I mean, that's, but as soon as I get up out of bed and put weight on it, I feel it immediately.
How have you dealt with your ankle during trial, as you sat in that chair over there?
There's a bar up under there that just coincidentally, and so I would prop it up while I'm sitting there. However, it's not really doing much because I need to have it more elevated. Now I'm hurting more because there's nothing I can prop my leg up. I'm just sitting as you all, and it's very uncomfortable.
I'd like to show you what we've marked as P29 and ask you if you can tell us what that is.
Yes, it's a picture of my leg after the most recent surgery.
I tender plaintiff's P29 into evidence and ask that it be displayed.
Any objection to P29?
There you go.
Admitted.
All right. Can you tell us which of those scars were caused by what?
The one around my knee, they went back into that one. So that's the second time for the one around my knee. The little one up under there, that's new. The ones next to my tattoo is new. The one on the side, that's the second time that they went into that one. And then you can't really tell, but there's a incision behind on the heel. That's new.
Are there other parts of your body that have scars from this collision that you believe to be permanent?
Yes.
Judge, may I have permission to place a chair in front of the jury while Ms. Daniels shows the jurors some permanent scarring that would be hard to see at that distance?
I don't object to that. Ms. Arnold, any objection to that? Okay. Just proceed with caution.
I'm sorry?
Proceed with caution.
I mean, I can stand up. Yeah, I could just stand there.
Can you stand there? Are you okay?
Yes, but I got to pull the chair back.
Yeah, remember, you're on a little bit of a ledge there.
I'm not gonna let it fall. No. Okay. If you just go stand right, and I'll stand next to you. So we're gonna go to the bench over here. Now, are there, and we may should have done this before, and so I'll go forward, share. Were there other things on your leg that were not visible in that photograph that you wanted the jury to be aware of in terms of deformities or anything?
No, you can pretty much see everything.
Okay. What other parts of your body have scars?
Pause for 1 second, please. And jurors, you're free to stand up. I noticed one juror stood. Well, no, the closer she gets, the harder it is to see something below that wall. So jurors, if you can't see what's below the little wall, feel free to stand up.
So we're gonna talk about something above the wall. All right, so tell us about, is this what you're referring to right here?
Yes, this is one of the scars. And on this side
Can you all see, okay?
from the.
You're in the way, can you move? Thank you so much.
I guess this would be the best way to show you my right hand. And this is as much as you can see, but everything else is there. So those are the other scars there.
Thanks, Ms. Davis, I appreciate it. Let me help you get back in your chair. Hold on, listen. Move this thing as close as I can. All right. So. You good?
Yes.
Hold on 1 sec.
Gotta change masks.
Great. So.
Wait, are you good, Ms. Brown? Okay, thanks.
That all looks like. So tell us where we are in the healing process for the subtalar ankle fusion.
I just recently started physical therapy. I've gone 2 weeks now. I'm only going once a week.
I'm sorry, you've only gone once a week?
Yes, I'm only given once a week is what was given to me.
All right. And how many have you had so far?
2.
How's it going? What do you do during physical therapy?
Give me different stretch exercises with the band to try to strengthen up my toes, as well as to build up the strength in the bones with the ankle area. I also put bearing on the foot with the heel, with the boot on as well. But this last one, we did it without the boot because I'm getting ready to be weaned off of being put into a regular shoe.
What are you hoping will be the ultimate result of this subtalar ankle fusion?
That the pain will be gone with me walking, or just to be just as normal as possible.
What do you understand your limitations will be as a result of the fused subtalar joint?
I won't be able to move my ankle like from side to side, or twist it somewhat.
Are you still having swelling in your ankle right now?
Yes.
How about your knee? You have any swelling in your knee?
Yes.
What is your normal daily level of right knee pain?
At the minimum, maybe about a 4 or 5 if I'm not doing anything, which I don't. But until I start walking more around the house or standing up, because a lot of my exercises at home is standing up, doing like some rocking back and forth, trying to get the weight equally. So standing up for a good amount of time. My physical therapy is about it is about an hour long. So I try to do those same hour long exercises at home when I'm not in physical therapy.
What have you decided to do about your right knee?
to have the knee replaced.
And why did you make that decision?
To not, it was the best way or the next best option, just to live without no pain, as much minimum pain.
How do you feel inside when you think about another surgery in the future? What does that make you feel like?
Very uneasy. I don't like surgeries. I don't know anyone who does, but very skeptical. But I'm just going to trust that they know what they're talking about.
Go back to the scarring we showed the jury. How often do you notice the scars on your body?
Every day, all day.
What goes inside? What goes on inside your head when you see the scars?
Insecurity, depression.
Let me hand you what marked as Exhibit P33 and ask you if you can tell us what that is.
It's a sum of my total medical bills to date, I'm assuming.
Behind that are the bills themselves.
Yes.
And what is the total of the medical bills so far?
$909,794.90.
Thank you. Tender P33.
Any objection to P33? Admitted.
I want to talk about the future and your plans for the future. I get it that when this whole trial seems like it's been about the fact that there's uncertainties, okay? What do you want out of your future?
To be back as normal as possible, so I can continue to be the mother that I've been with to my kids, although yes, they're older, but that's my life. I'm hoping to feel like I'm somebody again, work. I finally found myself when I found that job. So I want to be back as normal as possible.
What if you couldn't do that job, but you could do a different job? Would your attitude about succeeding at whatever job you get change?
In a way, yes.
And how would that be?
Because it's not, I give my best in whatever I do, but when you find something that you're really good at and you succeed in it very well, then I would like to stick with that.
How many years did it take at HSI for you to develop the reputation you had there as of March 2nd, 2020?
How many
years did it take for you to build up the reputation you had within that company?
It only took a couple of months.
Which got you your first promotion.
Correct.
In terms of what the company thought of you as of March 2nd, 2020, how long was that whole process?
Well, I had been with the company by then over 7 years.
What's your worst fear for the future?
That there won't be one?
If you're around and you think ahead, does anything stand out as being the worst for you?
Not being able to continue with giving my children, making sure that they have a life. Because it's been interrupted. My life is not the only one that's been affected by this.
And let's talk about your life being interrupted. What life events since you returned to Texas and your children were who they were until now, have you missed some activities in your children's lives?
Have I missed activities? No, but activities were taken away.
Okay, well, let's do it that way. What activities were taken away?
My sons.
And that's football? How about your daughter? Has she been looking at schools? Do you have a daughter who's been looking at schools?
Yes. She's in her senior year. Right now, I mean, it's somewhat affected because I had to have the surgery. We did have plans to do college tours because this is her senior year, but it's on hold.
Is there anything about this ordeal, either from the date of the crash until we're all here today, or from today for the rest of your life, that you want this jury to know that I haven't been smart enough to ask you?
How it's affecting my kids.
Well, the measure, what the jury's going to be allowed to consider is the impact of this on you. They're not going to be allowed to consider the impact on your kids, but how has the impact on your kids made you feel?
Less than a mom. Because there's no way that I can't say how the impact on me and not express how it's impacted them if I can't say it. Because it's been a big ordeal. My son is not in school anymore because of it.
Nice that.
So stop. I think you've identified it, Ms. Daniels. It's important that we not talk about the impact your situation has had on your kids. And so
Okay.
I'm going to stop that particular line of response. You're welcome to explore more the impact on her, but not, and you asked a fine question. The answer was going in the direction it needed not to
I
go.
appreciate that. Thank you, Judge. Are you proud of your children?
Yes.
Are you as proud of them today as you were before this crash?
Yes.
You think they're proud of you?
I don't know.
What do you think?
Honestly, don't know.
That's all I have, Judge. Thank you.
Ms. Arnold, when you're ready.
I'll wait till Ms. Daniels is ready.
Sure, but you can approach the podium.
Yeah.
I can't hardly hear you, Brandon.
Is that like green or red?
It's green now.
Good.
Yeah. Okay, that's better. Ms. Daniels. Mr. Johnson touched on it, but you enjoyed your job as a property manager, right?
Yes.
Having a stable job like that is important to you, right?
Yes.
Enabled you to provide for your family,
Yes.
gave you a sense of professional fulfillment.
Yes.
And I think it's fair to say you'd do anything to have that feeling again, right?
Yes.
And that means focusing on your ongoing rehabilitation efforts so you can get back to work.
Yes.
Maybe you can get back to your job as a property manager.
Hopefully.
And it's your intent to return to work sometime next year, if not sooner, right?
Whenever I'm physically able.
And if there's a job you can perform, which enables you to provide for your family, you're going to try and do that, right?
Yes.
Even though it might be something different than what you did before.
Did you ask a question?
Right.
Okay. Yes.
So let's talk about your job before as a property manager. And you told us at your deposition that a majority of those duties were confined to the office.
A lot of them, again, as I said, it's never a day-to-day thing. It's hard to say. Whatever day, each day is different.
Right. And most of those duties are in the office, right?
A good handful of it, but again, as I said, it just depends on what is needed on each day.
Sure. And you had 5 employees assigned to you, right?
Yes.
Okay. And that included an assistant manager, right?
Yes.
Leasing agent,
Yes.
maintenance staff.
Yes.
And you worked at HSI for 7 years before this accident, right?
Yes.
Started as a leasing agent and worked your way up.
Yes.
And your boss, Miss Poole, was quite fond of you, right?
Yes.
Said you're an excellent employee, right?
Yes.
But you never had a discussion with her at any point about coming back to work in some capacity over the last 2.5 years?
No.
And you haven't made any other efforts to seek any form of employment in the last 2.5 years? Okay. And no doctor, no medical doctor has told you that you are unable to work, right?
Repeat that?
No medical doctor has told you that you are unable to work.
Correct.
Right? You mentioned the screws in your heel that are causing you pain from this most recent surgery.
Yes.
How long has that been causing you pain?
From the moment it's the surgery.
Have you talked to Dr. Kadeki about that?
Yes.
Okay. And do you mind me asking what you have around your neck?
A fan.
Okay. And I've seen those. I just want to make sure that's keeping you probably cooler than we are standing in here. Ms. Daniels, excluding the physical therapy that you've been doing recently for your ankle, you've not been back to physical therapy since you moved home from Texas 2 years ago, right?
Correct.
Okay. And you were never formally discharged from physical therapy, correct?
In a way, yes and no.
Okay. In a way, no, because your last visit, the recommendation was to continue the plan of care.
No, they didn't say to continue. Again, as I said, due to financial reasons, because my when my employment had ended.
Okay. Objection. I just want to make sure that we stay within the bounds of what's admissible and what's not.
Sure.
Rather than.
No, that's fine. And it is, sorry, it is not inappropriate for you to object, even though this is your witness. I appreciate you helping maintain some of the guardrails that we agreed to outside the presence of the jury.
So do I continue?
Let me ask a different question. No medical doctor told you to stop physical therapy?
No.
That's correct. No medical doctor told you to stop physical therapy?
Correct.
Okay, thank you. And the home exercises and the stretches you were assigned during that time in Texas, we talked about that at your deposition too. Do you remember?
I don't remember in detail, but yes.
Okay. And at that time, you weren't doing those often because you said there was no point.
Correct.
While you were in Texas, you didn't follow up with an orthopedist out there, did you?
No, I was never informed to.
Okay. You didn't have that discussion with Dr. Moore?
No.
You mentioned, Ms. Daniels, some depression on direct that you've experienced. No medical doctor has diagnosed you with depression, correct?
No.
Okay. No medical doctor has diagnosed you with PTSD, correct?
No.
Okay. No medical doctor has diagnosed you with anxiety, correct?
No.
Okay. And you haven't received or sought any treatment for any of those, right?
No.
Okay. And no medical doctor has diagnosed you with any long-term memory loss as a result of this accident?
No,
And you haven't sought any treatment for that as well?
no,
Because, Ms. Daniels, you have opted out of further treatment for your arm, as we talked about, it appears you've learned to compensate, right?
yes,
And I've seen you drinking your water bottle with your right hand, right?
yes,
You're still able to use your right hand, right?
yes, to a certain extent.
Right. And you mentioned that it causes you some aggravation, right?
Yes,
Okay. But as far as eating and brushing your teeth and cooking, you're able to still do those things, just with some discomfort.
correct.
You're also independent with personal care, such as bathing, toileting, dressing, right?
To a certain extent.
Okay. And that's important because you couldn't bathe or toilet in those weeks and months after the accident, right?
Correct.
And you are able to do those things now.
To a certain extent, yes.
And that's what you told us at your deposition too, that you're independent with those things.
Yes,
As far as housekeeping, you do vacuum a little bit and sweep the floor, right?
I have, yes, but I don't.
Do you recall talking about that at your deposition?
Yes,
Okay, you're able to do those things.
to a certain extent, yes,
Okay. You're able to use the Swiffer to mop.
yes,
Driving is also something we've talked a lot about today. You're able to do that independently.
yes,
Ms. Daniels, you're fairly active on TikTok, right?
yes,
And for the benefit of the jury, TikTok is a social media platform where people with accounts can post pictures and videos, right?
yes,
And if your account is public, anyone in the world can see it, right?
yes,
And they can like or comment on the posts that people make, right?
yes,
Okay. We talked about your trip to go help your son move into college, right?
yes,
And that was a proud moment for you as a single mom, since he was the first one in your family to go to college, right?
yes,
That was a post-worthy moment to you, right?
yes,
Okay, so you made a post about that on TikTok.
yes.
You, do you recall making a post when you went out to Minnesota for his first college football game?
Yes,
That was another post-worthy moment, right?
yes,
That was in September of last year, right?
yes,
Last football season. Do you recall posting another video last September of you riding the exercise bike?
yes,
And at your deposition several weeks later, you told us that's something you were doing about once a week, right?
yes,
And that was at the gym at your apartment complex?
yes,
Okay, which you still have access to
yes,
because your kids are living in your apartment, right?
yes,
Okay. Self-care is something that's very important to you, right?
yes,
Okay. Getting your hair done, getting a manicure, pedicure, all the girly stuff we women like to do. That's something you like to do too, right?
yes,
Okay. Those things are important because they make us feel like ladies, right?
yes.
And thankfully, those are things that you are still able to do since this accident.
Not as often, but yes,
Do you recall posting videos to TikTok of yourself getting pedicures in January, March, and April of this year?
yes, I do get them often. It helps with the massaging of my legs.
Good. And pedicures can take anywhere between 30 to 90 minutes, right?
Correct.
Do you recall making a post in March of 2020, getting your hair done at the salon?
Yes,
Do you usually have the stylist shampoo for you too?
yes.
Okay. And they do that one of those salon sinks?
Well then, yes, but now I don't use the sink anymore.
Okay. When was the last time you used the sink to get your hair done?
Well, I'm saying I don't attend one that has one of those sinks anymore.
Gotcha. Do you recall making another post 2 weeks after the one we just discussed of yourself sitting for a different hairstyle? About 2 weeks apart in March of last year.
No, March of last year. No, I don't.
Getting your hair done is one of the ways that you can still be fashionable, right?
For me, getting my hair done was for my insecurities. So it'll help me to not face what I'm going through. So it wasn't for a fashion reason. It was more for security reasons.
Well, before this accident, you were going to get your hair done every 2 weeks religiously, right?
Yes.
It's something that's important to you, right?
Yes.
You used to sleep on your arm so that you wouldn't mess up your hairdo, right?
Correct.
And I give you props for that. And you still are able to go get your hair done since this accident, right?
Yes, not as often though, but yes.
Right. And your love for fashion brings me to shopping, because that's also something you're still able to do since this accident, right?
Online.
And I think we all agree online is certainly more convenient, but you've gone shopping. You've made actual visits to the mall too, right?
Yes, taking my children.
Okay. And you used to drive your daughter to Lenox Mall when she was working at Zara, right?
Yes.
Okay. Do you recall posting a selfie video to TikTok in March of last year while standing in an elevator holding a Zara bag?
Yes.
Okay. And Zara, for the benefit of the jury, is a fashion clothing retailer, and is it not?
Yes.
Okay. So let's talk about travel. We talked a little bit about it. We'll touch on it. We won't belabor it because that's also still something you're able to do since this accident, right?
Yes.
You talked with Mr. Johnson about the trip to San Diego, California with your ex-Mac, right?
Yes.
Okay. And you didn't rent a scooter for that trip, right?
No.
Okay. You rented the car that he drove, right?
Correct.
Okay. Mac was actually around for much of your early rehab, wasn't he?
Yes.
Okay. And he stayed over quite a bit at your mom's house during that initial recovery period.
Yes.
He even flew out to Texas with you back in mid-2020 and stayed for about a month to help you get settled.
Correct.
And you guys are not currently dating, right?
Correct.
Okay. And you haven't talked to him since March or April, right?
I don't remember when, but it's been some time.
You mentioned the trip to New Orleans. You were with your brother and your son?
Yes.
Okay. And you guys went down to Bourbon Street?
Yes.
Okay. And do you recall posting a video to TikTok while you guys were down on Bourbon Street?
Yes.
Let's talk about socializing with friends and family, which is also something you're still able to do since this accident. In June 2021, you went to your best friend's wedding, right?
Yes.
That's Mikkel?
Yes.
Okay. And you wore a pretty red strappy gown?
No.
Okay. What did you wear to that wedding?
It was an orange sundress.
Okay. Orange sundress. Straps?
Spaghetti straps. Yes.
Okay. And you actually stood in front so you could video her first dance with her husband, right?
Well, I was already sitting right there.
Okay. But you stood up and you were able to video the first dance that they had, right?
Yes.
And you've been out with friends to celebrate birthdays since this accident.
Yes.
Do you recall posting a video to TikTok in August of last year of you dancing on your birthday?
In my home, yes.
And you were with some friends?
No, that was my children.
Okay. Other people were with you?
Yes.
Okay. And that post was within days of the functional capacity evaluation performed by Mr. Yeager, right?
Yes, my birthday is on August 1st.
Right.
Yes.
And his exam was on August 6th.
Correct.
Okay. Do you recall posting some photos of you dressed up with friends for your most recent birthday just last month?
If you call that dressed up, I don't know. I had on a shirt and a skirt and some tennis shoes.
Okay. You had on a
and
skirt.
that was with my children.
Okay. And your mom was there too?
No,
Your mom wasn't there?
no.
Okay.
I don't know what you're referring to.
Okay. Well, your birthday was last month, right?
Yes, but my children took me out for lunch. So it was just my children and my brother and his girlfriend.
Okay. Another post-worthy occasion, right?
Yes,
Okay. And that was your 45th birthday?
yes.
Ms. Daniels, during the last 2 weeks, you've made your TikTok account private, haven't you?
Yes,
Okay. And that means that members of the public, like me, can no longer see your post, right?
correct.
Okay.
If you're not someone who I'm following back, correct,
Okay.
you can't see it.
All right. So I cannot access it as we sit here today, right?
No,
All right. Thank you very much.
you're welcome.
Mr. Johnson, do you have follow-up?
Briefly. You were asked about physical therapy and your efforts at physical therapy. Let me just ask you a general question. Have you ever given less than your full effort at trying to recover from your injuries from the date of the crash until today's day?
No,
Thanks.
That lead to anything else? Okay. I've seen some note cards getting filled out. Take your time. If there are any other questions, jurors, that you want to jot down, and Deputy Gordon will collect them.
I got a book.
Cute. All right, you all can be at ease while I chat with the lawyers. It'll be a minute.
I'm just standing up to
She just needs to
stretch.
stand.
I was just standing up to stretch.
Does it roll?
No wheels on it. Just glides.
Did you hear that? You hope you didn't pop anything out. Did you hear the crack? Yeah, I did.
I'll just sit on the edge and move to the mic. Because I'm doing the
All right, order in the court. Just getting these organized. I've never said order in the court before, you know, that was the first time. That's kind of funny. I don't even have a gavel. You guys could have completely ignored me. All right, Ms. Daniels, start with the day of the collision. Do you recall how fast you were driving after you left that red light? You say the last thing you remembered was the red light. Any recollection of how fast you were going at impact?
I don't.
Do you know what the speed limit is on Cleveland Avenue in that area?
35.
If the pain was at the level you've described, lots of pain, why is it that you didn't take the prescription medication that the doctors recommended, maybe at a lower dose, take half a pill, or if they said 2, take 1?
Because they're narcotics. And again, as I said, I don't do meds, I don't do narcs. If I can, I will tolerate it until it's intolerable. And then if need be, then I will take a narc. But once that was during that time when they prescribed them to me. But I was off of those and was given the 800 milligrams of ibuprofen. So I would take those again, as I said, if it was unbearable, I would take 1 or 2 then.
In your mother's house where you stayed for a while as you were getting better, is that a multi-story unit? In other words, does it have more than 1 floor?
It is, but we've made her formal living area into my bedroom.
Okay, well, that got to my second part, but you predicted the next question. So that bed that we saw you on, that was on the first floor of your mother's residence?
Correct.
Okay, and then the bathroom, shower you'd use, first floor, second floor?
There wouldn't be any showering. Are you referring to just period altogether, these both times?
Well, I'll be more specific. When you were living in that room, that formal dining room or living room that was converted to a bedroom and you were less mobile, when you used the restroom, was that a restroom on the first floor or the second floor?
First floor.
Okay.
But it's a half bath.
Half bath?
Yes.
Okay, so it's got a toilet, but you're not taking a shower there.
No.
You described at some point, or someone described that you were able to shower, but sitting in a chair.
Correct.
Was that at your mother's place or at your own apartment?
In my apartment, I'm doing it both, but my showers at my mom's house, I don't do too often because it is upstairs.
Okay. You, at some point, I think it was maybe after being in Texas, stayed in an apartment at the Vinings at Arbor Brown. Vineyards at Brown's Mill. Was that apartment provided to you for free or were you required to pay for that?
Required to pay.
Okay.
No discount.
And what floor was the apartment on?
It's the manager's unit, so I'm not attached to the building. So it's like a little cottage style house, 1 level, 3 bedrooms.
So street level access.
Correct.
Your youngest daughter is in high school still?
Senior.
Okay. Does the school she attends have a school bus system that you could use instead of having to pay for Uber or driving her yourself?
Being that we're out of district, where she's on this program, the McKinney program, where when you're misplaced, so they help you and assist you. So they're assisting us with the Uber cards that we get, the gift cards to pay for her Ubering until, because it's 2 different districts. So until they get the access where Atlanta Public can bus her to her Fulton County school, they're providing us or helping, assisting with the Uber.
Who helped you get, I guess you called it the manager's unit at Vineyards on Brown Mill? Did you arrange that or did someone help you get that apartment, that unit?
Again, as I said, Heather, who was the regional manager, still over the property.
That's Ms. Poole?
Ms. Poole,
Okay.
yes, I'm sorry. She's still the regional manager over the property. I contacted her, letting her know that we were coming and needed a place to stay. So she made arrangements to give us the place.
Okay. Have you contemplated asking employers, whether it's going back to this job or others, for a reasonable accommodation based on the limitations that you face?
I have not, only because I know I'm not at the level to even be any kind of worker.
Okay. Tell the jurors why you did not attend your father's funeral in Texas.
my dad was going through a divorce. And his wife, reasons behind that, would not let me.
So she told you you weren't welcome there. Okay, I'm sorry. When you're ready, I got a couple more questions that have nothing to do with that. Ready? You talked to the jurors a bit about your trip to Clearwater and mentioned that there was some irritation or issue while you were walking in the sand. Did you fall or twist your ankle while you were walking in the sand, or was it something different?
I didn't necessarily fall, just being that it wasn't level ground and it's the sand. So yes, it was some twisting to try to just keep myself balanced when walking in the sand.
Explain to the jurors how you're able to pay for the trips we heard about, whether it's going to Las Vegas or Clearwater or any of the other trips that we heard about if you haven't been working.
I received personal loans.
Mr. Johnson, do you have questions for Ms. Daniels based on what we just discussed?
I don't think so, unless Ms. Daniels, there's anything else you want to clear up based on any of these questions.
So no, that's not, if you've got a question, you can ask it, but Ms. Daniels has had a chance to answer the questions that I just posed.
Is that like asking a genie for 3 more wishes?
It's like not really asking a question at all. It's saying, why don't you talk to the jury? So,
Thank you, Ms. Daniels. I appreciate no further questions.
all right. Ms. Arnold, anything else for Ms. Daniels? Okay, Ms. Daniels, thank you. Mr. Johnson, if you wouldn't mind helping Ms. Daniels safely navigate our little ledge.
I would not mind.
Mr. Johnson, your next witness.
That is my last witness, Your Honor.
Okay, plaintiff rests.
Plaintiff rests.
Okay. Ladies and gentlemen, we are at a natural break point. You're going to be leaving a little early, but there are a number of things that I need to talk to the lawyers about outside your presence that flows naturally from one side resting. But let me ask the lawyers a quick scheduling question. I need to let the jurors know when they should come back tomorrow. We'll talk for another 20-ish minutes, maybe a half hour. I don't know that it'll get us through the charge conference. How much time do you think we'll need in the morning to work through whatever we don't work through in the next half hour? I can't start as early as we did earlier this week. I just want to avoid jurors waiting around.
Do you have anybody on a witness?
Do you need me to say, Your Honor, whether?
No, that's what we're going to talk about outside. So, but I want to complete the charge conference before I ask the defense whether they're presenting evidence or not.
I don't think the charge conference should take that long, Your Honor.
Okay, so we may finish it today. All right, then I'm gonna have you all be here at 9 tomorrow. Please do what you did today. Be here by 9. If you get here at 6:45 or whenever Officer Clay got people here, I can't guarantee that folks will be able to let you in that early. I was here funky early because of my crazy kids pre-start of school thing that doesn't happen tomorrow. So please don't talk about the case tonight. Even though one side has rested, the evidence is not necessarily closed. What you'll hear me ask Ms. Arnold tomorrow morning when we all reconvene is whether she rests or she's calling a witness. And so We don't know yet if you're going to hear more, and it wouldn't be appropriate to do outside research because I haven't charged you. You haven't heard the closings, et cetera. So stay dark as you have been in terms of interacting with others about your role here. Have a wonderful evening, and I'll see you by 9 tomorrow. Thank you so much. Leave your notepads in the jury room. All right, you all can be seated. Ms. Arnold, do you have any motions before we turn to you telling me what your forecast is for tomorrow, and then we pivot, or does Mr. Dial have any motions? Okay.
We're giving Mr. Dow a job. He's
Uh-oh.
been dying to speak.
Very unusual for me.
Okay.
Your Honor, I've got several directed verdict questions.
Okay, well, hold on one second. I'm just getting these cards in numerical order.
And I'll be brief.
Famous last words. I am ready for you.
All right, the first on plaintiff's lost future wages claim. Your Honor, this is a bit of an unusual case, given that she's having these ongoing surgeries and recoveries, and I think it makes any testimony regarding her capacity to work in the future highly speculative. I know Mark Yeager testified regarding her inability to work, but he only examined her one time, and that was in August of 2021. And since that time, a lot has happened. She's had her ankle fusion in June of 2022. She's now in the process of recovering from that. She's going to have a knee replacement at some point in the future, then she's going to have to recover from that. So I don't think there's anything other than speculative evidence in the record regarding her ability to work in the future. There's no vocational rehabilitation expert, which seemed like yesterday you were even surprised about. And so for that reason, we moved for directed verdict on the lost future wages claim.
So I hear you, and I will hear from Mr. Johnson when you're done with your presentation. But is it in your mind speculative that Ms. Daniels can't work right now? Because there do seem to be certain events that could happen. To your point, there are certain events, a knee surgery or improvement with the ankle, et cetera, that make the notion that Ms. Daniels will be forever unable to work. Right. Speculative.
Yeah.
But if we look at it from the other direction, is it speculative that for the next X months, she can't work? And I don't know the answer to that, and I need to hear from Mr. Johnson, but then what is going to be ultimately subject to speculation is, where do the two sides argue that the X appears, that after mystery date X, it's really not fair to assume that Ms. Daniels couldn't work at all. Maybe not at what she used to. And then we heard from the economist, well, if she would have made $42,000 a year, but it's reasonable to assume she could do some work.
Right.
If she chose to.
Yeah.
But that's at 30, then you've got the delta and you multiply that out. I hear you, there's a lot of guessing.
I think there's enough evidence in the record for the jury to make a decision regarding her ability to have worked since the time of the accident until today. Now, regarding the future and what date, are we going to agree upon, or what date do we think that it'll become speculative? I would say certainly by, I'd say September of 2023. I mean, you even heard Dr. Seaman testify about that, and he had her back to work by that date. And I think the evidence is that she's going to have knee replacement surgery. I don't exactly know at what point in time, but then I believe one of the doctors today said it's going to take 6 to 12 months. So I would say 6 to 12 months from whenever she expects to get the knee replacement surgery, which based upon my understanding is she can get that surgery once she's recovered from the ankle fusion, which was supposed to be 3 months, which is like this week, I think. So I would say 6 to 12 months from this week.
Okay. And when was help me remember why Dr. Seaman mentioned the 9/23, September 2023, about a year from now.
Yeah, I think it's because of the testimony of the doctors, which said she had the surgery on her ankle in June of 2022. She then had a 3-month recovery window based on the testimony of the physicians, and then it was going to be 6 to 12 months from that point in time, or when she could then have the knee replacement surgery. Then it was going to be 6 to 12 months for recovery after the knee replacement surgery. So I think he just said, hey, she should be able to work by 2023 in some capacity, September of 2023 in some capacity.
Not that he's a vocational expert, but that was his testimony. And so far that may be, other than Mr. Yeager, the only evidence in the record as to someone opining as to when Ms. Daniels might next be able to work in some capacity. And then help me remember or provide your recollection as to what the evidence is as to when the knee replacement surgery would be.
I believe they said she needed to recover from the ankle surgery, which would take approximately 3 months, which would be, I think the surgery was June 22nd, 2022. So that'd be September 22nd, 2022. Maybe a little bit, bump a little bit of time out for that, but then you get a 6 to 12 month recovery from the knee replacement. So, I mean, if it's later this year, then, you know, that gets us middle to late next year. So I think his September 23 calculation.
But you're not aware of any evidence in the record that the knee replacement surgery has been scheduled, that there is a date for it?
I'm not. I will gladly defer to my colleagues here. If
they're good at passing the little orange post-it notes.
They are.
Okay. It is whatever it is. Okay. So that's loss of future wages.
Right.
What is your next motion?
Lost future medical expenses. I've not heard any evidence regarding what those may total.
Okay.
The next is any argument on any claim for PTSD, depression, anxiety, or memory loss. Plaintiff just testified that she has not been diagnosed with any of those conditions by any of her physicians.
Why did you pick the memory loss, other than there was clear testimony, very understandable testimony? Ms. Daniels doesn't remember what happened after she pulled away from the stoplight.
Right.
She wants that memory loss. I don't think she wants to remember the impact. But why did you pick PTSD, memory loss? Was that something that was pled in the complaint, or that's just standard civil defense lawyers saying, hey, I don't want to hear this in closing because we didn't hear it during trial?
The latter.
Okay.
And then there's, I think, going to be a charge on pain and suffering, and it's the standard charge. But regarding the shock of impact portion of that charge, she specifically testified that she doesn't have any recollection.
So let's talk about that during the charge conference.
Okay, will do. And then the last thing, I don't think this motion is necessary, but there was a mention in the complaint regarding attorney's fees and expenses. I don't think that claim is being brought here at trial, but if it is, we would move for directed verdict on it. I don't think there's any evidence of bad faith, stubborn litigiousness, or causing the plaintiff unnecessary trouble or expense.
Okay. I think Mr. Johnson's been pretty explicit about that, but I'll give him a chance to clarify.
Out of an abundance of caution, I just wanted to make sure that claim wasn't in the case.
Okay. Mr. Johnson, we're going to go in reverse order because I think they get harder as we go backwards. Do you intend to seek through this jury's verdict any attorney's fees?
I do not.
Okay, done. What about the anxiety, PTSD? Anxiety, let's set that one aside.
Yeah.
But specific mental health diagnoses, how this was so stressful, Ms. Daniels must have PTSD. You need to award something for that, loss of memory.
So I've never argued that, but I'm certainly going to tell the jury that they should compensate her for what she testified her issues were as she understood them. But I've never used, I don't think the word PTSD, unless I missed it. I don't think it came up at trial. So am I going to say she has anxiety when she is in a car?
Sure.
I think I will.
Okay. Got it. But it's not a specific medical condition for which she'll need medical treatment, for which medical bills will be X and Y and Z.
Nope.
Okay. I think you're in safe territory there, which segues nicely into future medical expenses.
Dr. Kadakia, the only future medical expenses that were mentioned by Dr. Kadakia. He said between $12,000 and $40,000 for, I think it was Kadakia, might have been
Sadlack. I think it was Kadakia for the knee that said 12 to 40,000 in response to Brandon, Ms. Arnold's questioning. So to the extent that the doctor testified about that, that could come in.
But you would limit it then to there's an expected future medical expense for the knee surgery. Not, we don't know many more physical therapy sessions there'll be, and maybe Ms. Daniels will need to get a wrist re-examined. It would be anchored to which one of those two doctors said something about.
I'm going to point out that she has an unknown amount of medical expenses in her future, but that we were unable to quantify that in time for trial.
Okay. So you won't be seeking an award for future medical expenses?
Other than the $12,000 to $40,000 if they want to consider that.
Okay. Before you get to loss of future wages, Mr. Dial, this is that narrow question about the cost of the knee surgery.
Yeah, that's fine. He says 12 to 40,000.
Okay.
Fine, but
Got it. And
I was like, hey, there may be who knows what else is going to be going on in the future.
got it. I've heard Mr. Johnson say he's not going to do that. So if he does, I expect someone to say stop, and then I'll tell the jury that Mr. Johnson wasn't supposed to do that and he knew better.
So wait, so just so I'm clear, I'm not going to give any numbers for any future medical except for it may be the 12 to 40.
Yes.
That the only numbers I'm certainly going to say that surgeries cost money.
Sure.
Okay, that's
yeah.
Gotcha.
Right, but not a vague reference to there could be other surgeries that we don't know about.
So I don't know if I'm sorry, I spoke over you. In your closing, you had in your opening a helpful chart that listed all these different things. If there is a future medical expenses line item in there,
that's a great point.
Better only have 12 to 40.
Right. It's not in there.
Okay. I think we're okay. It's going to be contextual. And so if you feel like defense that Mr. Johnson is saying too often, and who knows how many surgeries there'll be in the future, we'll need to stop that. But if it is targeted that, and we also know that there'll be likely future medical expenses, the knee surgery, then I'm comfortable because one of the doctors cabined it in that range. It's a slippery slope, and you'll want to stay at the top of it as best you can.
Okay.
Yeah, I just don't want to invite speculation from the jurors because there's also going to be the associated rehab and therapy, and he didn't put any evidence of what that's going to cost, and I don't want the jury to speculate and guess.
Nope. And they'll be told they're not supposed to speculate or guess. So the only number they're going to hear about future medical expenses would be, if Mr. Johnson chooses to bring it up, would be that knee range. Okay. Loss of future wages.
Yes, thank you, Judge.
You're welcome.
We are not going to argue that she will never work again. That would be speculative. What we are going to argue is, based on the evidence presented at trial, that she may very well work again. And if she does, although we don't know because she hasn't healed, but if she does, we brought an expert to say, here's what she's likely to earn, and here's how that's a lower amount than she would have earned had this not happened. That's the testimony we're going to present. We presented it through expert testimony. It is admissible, and that is the future economic loss that will be argued.
So acknowledging that anything about the future is inherently speculative. So we set that part aside because lost future wages is an element of damages in a case like this. You are anchoring it to Dr. Seaman's testimony, where basically, if we envision it graphically, he's got a line that would be the higher of the two lines. Here's Ms. Daniels' earning potential going forward, assuming the accident had not happened. Yes. She had stayed at the apartment complex and did well.
Yes.
And then there is a lower line that he described. He may have described more than one lower line. Yes. Because who's to say Ms. Daniels doesn't find a job in a different line of work that doesn't involve climbing lots of stairs that pays well.
And he was questioned about that.
He was.
And the parties can argue over.
Okay.
For sure. But can you imagine the law being that a defendant could so injure a plaintiff that they required surgeries out in the future for 10 years, and until that 10 years passes and the 10 years worth of surgery, then the defendant could say, you can't ask for any future wage loss because, that's speculative. I mean, obviously, here we are at trial.
Ms. Daniels didn't cause herself to be in this position. MARTA did. And we brought an expert to say, not that she'll never work again, but that if she does work again, most likely it would be a year from now, and here's what she's most likely to earn.
Your response to Mr. Dial's observation / my observation that, yes, Dr. Seaman said that. Dr. Seaman is not a vocational expert, and so it is inherently speculative on his part to draw those lines, not because of injuries or, to your point, that we don't know exactly when Ms. Daniels would be fit enough to return. He conceded that we're going to assume she can, because his understanding was that she is not permanently incapacitated.
It is not inherently speculative. It is subject to vigorous cross-examination and jury argument. But we established him as an expert. He gave his opinion as an expert. I believe we're entitled to go to the jury on that issue.
Okay. And the counterpoint to that?
Your Honor, there oftentimes, as you know, life care planners, vocational rehabilitation experts, all sorts of experts like that could have provided this testimony regarding her ability to work and or the costs. I mean, I don't disagree that Seaman can testify based on certain assumptions, but he's assuming. The problem is they don't have anybody who has talked about her ability to work when she's gotten these surgeries completed. And I mean, it's all speculative. I mean,
there is always going to be a piece of speculation in there that we have to accept because it's the future. Built into this case is another chunk of speculation that we have to accept, which is, when could Ms. Daniels go back to work? It could be made non-speculative had the side with no burden chosen to call a vocational expert who could have said, perhaps in his or her opinion, she should have been working 6 months ago. Yes, there are impingements on the wrist and the ankle and this and that. We hear 95 different jobs that Ms. Daniels could be doing. That's not in the record. In the record is some testimony from Mr. Yeager and from a non-vocational expert. Well, not that Mr. Yeager was either, but he was able to at least talk about categories based on the impingements, like light work, no work, heavy work. Ms. Daniels is not going to be working in a warehouse where she's getting 50-pound bags of rice off a shelf and putting it onto a pallet. Maybe not before,
August 2021.
and maybe not before then too. But so accepting, because I accept it, so you're going to have to accept it. You can object, but it's how we'll roll. There is some speculation woven into any calculation that's going to be made. Where is the unacceptable piece of speculation in the model that Mr. Johnson has described?
Well, I think, like I said, late 2023, because we don't know how she's going to recover from that knee replacement surgery. She might recover brilliantly. And the doctors all said she's going to have no pain. So like I said,
but wouldn't that be your argument in closing? That is that why are we assuming anything other than the line that is described by Ms. Daniels is back at work? I mean, this is, I think, what most of the to and fro in closing will be. Hey, there were pictures of you dancing with your kids. I can't go upstairs, but 2 feet at a time, back and forth, back and forth. And the jurors are going to need to decide. I don't think by pure guesswork, you know what, we can see Ms. Daniels is never going to be what she was before. And so that job she had, she's not going to get. She'll find something. And so it's not infinite lost future earnings. And they're going to need to work through that. Could it have been more fine-tuned with a vocational expert testifying? I think so. But I'm going to give you this opportunity, should you choose to pursue it. My guess is this kind of issue has been litigated before. If you find case law that says it is too speculative for the question of future wages, lost future wages, to go to the jury without more on this vocational piece, I'm open to that. It is not my field of expertise. And so your team of 3 are welcome to look at that. And we won't let the ink dry on that until closings. I know you'll be thinking this evening about what you're going to say in closing, but it's easy enough to wipe a slide out if I conclude after you send me some cases, this is stretching the speculation too far. So I hear your argument. I think it's well-founded, and it may well be that you come back tomorrow and say, they're not cases, but we reserve the right to object during closing if where Mr. Johnson is pulling the jury is the only way they could get to where he wants them to go is by speculating. And I guess I could give a cautionary instruction that, look, I'm going to tell you during the jury charge, you can't speculate, but I think that's going to be where you focus. All right. All right. Ms. Arnold, what is the plan based on everything we've just talked about calling a witness tomorrow? Or do you want to sleep on it?
Real quick, Your Honor, just a clarification on the third motion regarding PTSD, depression, anxiety, and memory loss. If I heard you guys correctly, there's not going to be a discussion about PTSD, depression, or memory loss. He's not going to be arguing those things because there's no medical diagnosis or treatment for those.
So what I heard, we didn't hit on depression, we hit on anxiety. But what I heard, the thrust of Mr. Johnson's approach is going to be, my client is sad because she can't be there for her family like she was before. She's sad because she can't go out the way she used to and go to clubs. I think that's appropriate. If he uses the word she's depressed, you want accident, he wants collision. I'm okay with using the word depressed. Similarly with anxious, she's anxious when she's driving a car. If Mr. Johnson starts saying you need to compensate her for depression and anxiety as if it's been diagnosed in the same way that you need to compensate her for the wrist, that's a problem. I don't think Mr. Johnson's going there. I'll police it. You should feel free to police it. But that's the difference that I'm drawing. So I'm not forbidding you from saying accident or saying you're sorry, nor am I forbidding Mr. Johnson from using anxious, anxiety, depressed, depression, probably not depression, but sad, depressed, because I think those are accurate, common parlance uses of English language to describe what Ms. Daniels and family members discussed.
I appreciate that clarification, and I think as we already established, PTSD and memory loss really aren't in the record. Those are just things she talked about at her deposition.
Okay, got it.
Okay, thank you.
You bet.
No, but the plan for us is that we will rest, and we'd like to invoke the ability to have the opening and closing arguments because we didn't put up any evidence. So
Okay. We need to have a charge conference. Hold on one second. Hold on one sec. All right. Would it be helpful if I have a little more time than I thought, if we had the charge conference now, assuming Ms. Brown has the stamina, or would you prefer to do it in the morning?
We're going to be very quick. There's only 2 issues that I have.
Okay, why don't we start now? And if people start flagging, well, let me ask this. Do you want the charge conference taken down?
Yes.
Okay, well, then it will behoove you to be concise.
All right. Let's start with the fence plan.
I'm going to start with my document. I'm going to put it up on the screen. All right, you should have in front of you on the screen the draft that I sent out this morning. I'm going to stop at each of the highlighted areas because that meant I had a question or a concern. You should stop me if in bouncing from highlighted area to highlighted area, I skip over something you want to discuss. So you will see from the screen, I'm not inclined to give special charge number 4 about a defendant being under no duty to help a plaintiff in making out her case. It is a correct statement of the law. I think you're free to argue it. I think a more confined and appropriate charge is that the plaintiff has the burden of proof and has to prove it by a preponderance. Are you going to be the arguer, Mr. Dial?
Yeah, I'm okay.
Okay, so that will stay out. If you see it struck through, I'll get you a final version tonight / in the morning. I'll give you a hard copy in the morning, but that'll stay out. Next on page 3, the limiting instruction. Maybe you all had a notion that something would be so limited. I'm not aware of anything that needs to be limited. Mr. Dial?
I'm not aware of that either.
Mr. Johnson?
No,
Okay.
I'm not even.
That'll stay out. Page 4, failure to produce evidence. I don't think that came up. If you have a specific, you want to argue in closing, share it with me. Otherwise, I should have told you. My philosophy about jury charge is that it should be as accessible as possible. I started crying when I saw that proximate cause is in the single worst jury charge. Well, until I'd never seen these things about mortality tables, but the jurors are gonna have no idea what we're saying about mortality tables. But if they're in, they're in. Anyway, I try to keep it short and sweet and in plain English. I don't know that we need to burden them with this notion about failure to produce evidence unless there is a specific instance of it that you want to talk about. Mr. Dial?
No, we're okay with what's called.
Mr. Johnson? You're all right omitting it?
Well, I want to make sure I'm clear on what we're going to do. We are going to comment upon the fact that Peggy Friedman was retained as an expert, examined our client, and was not called as a witness. Just didn't want to create the, and so given that I'm representing to you that I'm going to do that, would that make this an appropriate charge?
So my point wasn't that it's bad law. I just don't know that we need
I'm
to.
letting it out.
Okay, great.
If the defense wants it out.
You're okay with it being out?
I'm just letting you know, because you said, I don't think it came up.
Got it. You have an instance that you think you're going to talk about with the jury, which you're free to do. You're also comfortable that that's not backed up by a jury charge.
I am
Okay.
comfortable with that.
Excellent.
Thank you.
We're okay leaving that out.
Okay, taking it out. Next up, proximate cause. I tried to simplify it a bit. I think that the third sentence, it's the bottom of page 4, is not necessary because I don't think we've got, well, car number 2 hit car number 3, which hit car number 6. But this would, I think, be more of a defense question. Is there something you plan on arguing in closing where you were sure hoping the judge is going to say there's this intervening cause that would mean that the defendant's actions were not the proximate cause?
No, I mean, we have a mitigation argument.
Great. And
Charge on that,
yeah, and it's appropriate to charge on mitigation.
So we're good on that.
Okay. Then question about at the top of page 5 there, this is parenthetical, bracketed. I don't think that there's a concurring or contributing cause to the injuries here. So I think it's okay to omit a sentence that says it need not be the only cause nor the last or nearest cause. You're all right? Good. Let me do strike through on that. All right.
What?
Yes.
Last one there that I wanted to talk about.
Then you did the right thing.
Nominal damages.
Yes.
That's not an appropriate charge in this case, I believe. We would ask that not be included. I don't even think that the MARTA believes that nominal damages would be appropriate in a case like this. Nominal damages are when the jury wants to say a point has been made that someone, did a wrong, but there's not really any damages that flow from that, so we award nominal damages.
I understand what nominal damages are. I hear you on that. Defense view.
We're okay taking that one out.
Okay.
Yeah. Where's the sound? Wait, Judge, give me just a moment.
Sure. I'm not deleting anything. I'm just making notes for me to take it out. Now you want nominal damages in?
No,
Oh.
I wanted to go back up to causation
Okay.
because there's some admission, there's some stipulations in this case, and I want to make sure that,
So stipulation is at the very top, that first pair. I'm now on page 1. That's where Ms. Niles put them. I don't normally start it like that, but so read that first paragraph above burden of proof.
sure, I'm just trying to reconcile, let's see here. It further admits the plaintiff was injured because of the collision. MARTA disputes the amount of damages plaintiff seeks, but not causation. And so I'm wondering if the proximate cause charge is really appropriate here, given that proximate cause isn't the issue. I don't believe we've alleged any type of injury that MARTA
Didn't cause.
right, or even that MARTA thinks it didn't cause.
I agree, but someone asked for proximate cause, and I've tried to shrink it as much as possible. I don't know that it's necessary in this case. I wasn't sure if we were going to hear from one of the doctors. Well, you know, Ms. Daniels actually had a compound fracture of her wrist 2 years before. That's not what we heard.
Your Honor, we're just looking back at the consolidated pretrial order. In the consolidated pretrial order, MARTA specifically puts in their section that they are admitting direct and proximate cause of plaintiff's injuries. And the only issue for determination by the jury is damages. So I think what's appropriate is for there to only be a damages instruction with regards to the prima facie case and not an instruction on causation, since that's admitted by MARTA.
Well, where you been all trial? Okay.
Inside my head.
Yeah, Mr. Dial.
It's more so the amount of damages that we proximately caused.
Yeah.
Not that we didn't proximately cause her damage, some damages.
Right.
It's just the amount. So
Value.
proximate cause is actually proper.
One at a time, but
Proper reason for that reason.
But the issue is, what are the proper damages? The things that are readily quantified, medical bills, my understanding was that you aren't challenging the medical bills, $900 and something thousand. They were admitted, no objection, that number's out there. It's everything beyond that, pain and suffering and whatnot.
Yeah, did we cause her, how much wages did we cause her?
Right, but what else has the jury heard about that would be the other cause of those things? Isn't it a question of magnitude as opposed to existence? If you're going to have an argument that, you know, wait a minute, it wasn't the accident that caused.
I mean, it's the mitigation thing, or not going back to work.
Okay.
Yeah, we think she can work, so if we cause her to lose as money, future lost wages, as they're going to say, I mean,
Okay, I think you're certainly entitled to argue that. I don't think omitting the proximate cause charge will hobble you in any way. I just think it's going to be confusing to the jurors because it really applies to what caused the accident? What caused the broken leg was the MARTA bus hitting the car. And you all have admitted that. And I think it leads to a cleaner jury charge if we don't get into causation because of MARTA's admissions. You may open yourself up to an argument like, well, how serious are they about admitting liability if we're having to hear about cause? But I don't want to detract from the argument that you or Ms. Arnold or Ms. Page may make in closing about the failure to mitigate, et cetera. I just don't think proximate cause is an arrow in the quiver that you would pull out and say, there was no proximate cause.
Okay, I agree. You've convinced me.
Okay.
But I mean, we can still make the mitigation arguments and all the other arguments.
Absolutely.
Regarding the amount.
And there will be a mitigation charge. I think you have now prevented several jurors from falling asleep during the charge. All right, I'm going to scroll on down. So I highlighted a bunch of things because I've not encountered them before, because these cases usually settle in Superior Court. 5% per annum, I assume that's some statutory thing, that's the interest rate that is used to discount things? Or did you invent that in light of the feds are announcing a interest rate hike tomorrow? It may be in the middle of trial, we're going to have to change that.
That should be struck. There was testimony by the whole thing that you, once you've determined it, you may reduce it. You may reduce the plaintiff's gross future earnings to present cash value. The only numbers that were given in this trial by Bruce Seaman were reduced to net present value. He never gave a gross number for the jury to then later go reduce to net present value. So if they were to take his number that was reduced to net present value and then reduce it further, it would be an incorrect number.
Then why do we need the mortality tables?
Because the mortality tables tell us how long a person's going to live, so that if they're going to suffer pain for every year of the rest of their life, the jury can calculate how much is owed for all those years of pain.
Okay, it's not to do the math of, I envision a future stream of earnings that goes out this far, and there are three ways we do it. Someone testified about life expectancy, or we use a annuity table, or we use a mortality table.
That's correct, Judge. Dr. Seaman testified as to a working age, 67.5, and then he also said some people use 61.5, and here's the difference, and here's why you choose one over the other. It's not life expectancy, because we hopefully don't all work until the last day of our lives.
And then to your first point, Dr. Seaman, the figures you will be using from his testimony have already been discounted.
The net present value, every one.
Okay.
Yes.
I think they've already been based on a certain working life expectancy.
Right, but we still, the mortality tables goes to how long will, as I understand it, the plaintiff's argument would be, how long will Ms. Daniels live dealing with the pain and suffering? And so it is much less complicated than the 5% and this and that. It is, her life expectancy is X. She's 45. We just got that testimony today. And so 90 minus 45 is 45. 45 times X gets you your number. Okay.
Yes, Your Honor. The mortality table deals specifically with proving a permanent injury. So it's specific to the injuries, and it's specific to the claims related to the injury in terms of pain and suffering specifically. So
Got it.
we're just looking at what to assign pain and suffering for the rest of her life, should the jury determine that we have met our burden of proving that our client suffered a permanent injury.
Got it.
Separate from like lost wage, future wages.
So what I'm proposing, if you will follow the bouncing cursor, is that future lost earnings look like the paragraph you see. So it's the pattern charge, oops, with another S here.
I think in fairness to the defense, the next sentence above needs to be cut.
You should also consider plaintiff's life expectancy
Yeah.
because of the way Dr. Seaman did his work.
Yes.
Okay.
You're welcome.
All right, Mr. Dial, any objection to the future lost earnings paragraph looking as it is edited here?
No, subject to it's brilliant research, so I might.
Right, it may be that,
And we take the whole charge out.
Right. Okay. Do you then need, Mr. Johnson, the next paragraph damages life expectancy because you're going off the mortality tables?
I do need that because it talks about you may determine the life expectancy solely from her age.
Yep.
And that is necessary, as is the mortality tables.
Just two different ways to determine, and jurors may say, I don't buy this mortality table thing. They're authorized to use their own experience.
Exactly.
Okay, makes sense to me.
And Dara, do you want to address the mortality table issue at this time, or?
We're about to get there because that's the next charge. So bottom of page 7, what do I put in the blank? You have in evidence a copy of the blank, is it like the Stevenson mortality table?
They're listed in my amended trial exhibit list. I'll call the names out to you.
Hold on one sec. I think I have it.
P41, P42.
Yeah, we're arguing about whether they can go back to the jury anymore.
Okay, thank you.
So that sort of services.
Yeah.
If that's what we're talking about, yeah.
So they do go back.
Yeah.
Yes.
Well, yeah, I think they do too, but let me just write. So it's 41 and 42.
Yes, Judge.
Refresh my memory on that.
It's not surprising to me that these things are from 1958 and 1949.
It's time to update those, don't we think?
Well, life expectancy went down over the last few years. Maybe we're back to those levels.
Yep.
I think all that comes out because these mortality tables now are used as a tool only, should the jury choose to use them, to determine life expectancy.
There's a typo, Judge.
Okay.
Right above the highlighted part, yeah, very end, you have to follow top instead of follow two, yeah. Okay.
And then we can take out the entire annuity tables paragraph because those are not in, you elected not to use those. All right. So my next question is about pre-existing injury. Understood why it was submitted. Other than we heard about, there was some wrist situation that Ms. Daniels had. Oh, no, it was her arm and her neck because she slept on it. That's the only pre-existing anything I heard of. Were you planning on arguing pre-existing injury in closing? We can take it out?
Yeah.
Okay.
You can, but Judge, just to jump back a second.
Well, let me just close the loop on pre-existing injury. Mr. Johnson, no objection to omitting pre-existing injury.
No objection.
All right, it will be out. Yes, Mr. Dial.
The pain and suffering charge.
Yeah.
Reference to shock and impact. She specifically said she didn't remember the impact.
Right, and you did, that was one of your arguments during your directed verdict piece. What's your response to shock of impact in light of your client's testimony?
Depends on what is defined by impact. If you were talking about simply the moment that the vehicle collided with the MARTA bus, I agree. There was no evidence of shock of impact. There was plenty of evidence of shock post-impact when she was in the car being rescued by the fire department. And so as long as shock of impact isn't, as long as that term doesn't cover that period of time, then.
So I think you're free to argue about the pain and suffering, probably emphasis on suffering, because it sounds like from what I recall from Ms. Daniels' testimony, because she was in shock, she didn't feel pain right away until they started trying to move her and she saw her leg and whatnot. So I'm going to remove shock of impact. And I think what you're describing and your client described falls under the pain and suffering.
Okay.
All right.
Yeah. Well, so, because it's on his board.
But he can argue it he can argue whatever he wants, and you can, it's not in the charge. I will not be saying that is something for them to consider because I don't think shock of impact is, but all I say is you may consider the following factors if proven. So.
Then why does he get to argue that it is something they can consider?
I don't know that he's going to say you should consider shock of impact. He may be talking about how she processed all this, and you'll be free to say, well, one thing we know is she didn't remember the impact. She told us that.
He's got a board of 11 categories and blank lines, so I anticipate he's going to write numbers in next to all these, and one of them understands shock of impact.
Right, and what this jury charge says is you may consider these things if proven. It's not an exhaustive list. I mean, if what Mr. Johnson wanted to say is you should think about, I mean, I don't think he is prohibited from talking about how that's part of her pain and suffering. And I think the way you rebut it is the way you're going to rebut it. More importantly, I will not be telling the jurors that shock of impact, should some of them think, she's going to have flashbacks, she had to watch it on the video, that's an element that they are to consider.
Okay. I'm not going to ask for money for seeing the bus collide into her car, and not going to do it.
Let's press on. On page 10, we've got plaintiff special charge number 4. And I highlighted that because I figured we should discuss it.
I don't think it's applicable in this case. I don't know exactly why it was requested by the plaintiff here. Why? I don't know of any negligence of any doctor or treater that's been alleged.
All I've heard is that some of the rehab folks didn't treat Ms. Daniels real carefully, and so it was painful, and she said, I don't need to be in that spot anymore.
Let me explain why I put this charge in.
Okay.
Because I don't want the jury to misapprehend MARTA's responsibility if she has revision surgeries. I don't want the jury, which she has had a revision surgery to her ankle, and she's going to obviously have a revision surgery to her knee with a total knee replacement. I don't want the jury back there saying, you know, really, we can't award her money for that because it may be that the doctors just didn't get it right the first time, and that's why she's having to have this second surgery. And if that's the case, that can't be MARTA's fault that the doctor didn't get it right. So this clarifies that that's an improper way to look at this.
So one, I don't think MARTA will argue that. I'm happy to preclude them from arguing that. You can make the point that you just made. I don't think I will be instructing the jury that they should consider MARTA liable for damage resulting from the improper or unskillful treatment of plaintiff's injuries, because I don't think there's evidence of that. That what you were calling the revision work, as I understood it, was driven by the fact that Ms. Daniels continued to be in pain, and so they fused the ankle. They weren't able to tell at the time that that would be a source of pain.
The defendant doesn't want it in, and I'm okay with that.
Okay. And the rest is standard pattern stuff or McBurney stuff. So, yes.
The only other caveat I would make at this time is if for some reason MARTA were to come up with some case right on point that persuades you that we're not entitled to seek any future wage loss, we would then ask for the pattern charge of diminished capacity to labor, which we didn't put in because we're making a future wage loss.
Okay.
But I don't anticipate that's going to be the case, but I wanted to let you know that that would be our proposal in that event.
All right. If you could have that language at the ready, should that be my ruling, then I'll be happy to paste it in. All right. Anything else, Mr. Dial? And I'm not sealing this forever. If we need to talk in the morning more about the jury charge, we can, but I feel like we've covered it pretty thoroughly.
Yeah, just 1 second. There was a charge we requested regarding damages.
So there were a couple that you asked for with particular language that magic language didn't get in because Ms. Niles and I decided that the concepts were covered in the collection of damages charges that were given. Which one were you worried about?
Our request to charge number 2 for damages, speculative damages, the burden of proof, speculative damages last with the plan.
I have it in front of me.
Yeah, reasonable certainty.
Okay, hold on. So what's on the screen right now?
The same thing we're looking at for.
Well, is it now just 1 page wide?
Yes.
Yeah, so there's your language right there. It's just not a standalone charge, but look at that little paragraph.
You're not to worry.
Plaintiff bears the burden of proof. She must prove each item of damages with reasonable certainty, et cetera, et cetera. I think that's functionally the same language.
And reasonable certainty is another word for more likely than not, for 51%.
I mean, you're going to argue what you argue. It's what's in the charge. But yes.
Yeah,
Are we okay?
yes.
Okay. All right. I'll take that down. And Mr. Johnson, anything else before we wrap for the day?
We think we're good for today, Judge.
Okay. Can you be here by 8:45 tomorrow?
I'll be earlier than that.
Okay. Just be ready to go at 8:45. Ms. Arnold, anything from the defense?
No, Your Honor.
All right, let's be here at 8:45 and we'll get rolling. Thank you, everyone.